Everybody nice to see you. Okay, good morning. Call this meeting to order. It's the Flagler County Board of County Commissioners Workshop, Monday, January 12th, 2026, 9 a.m. If everyone will stand for the Pledge of Allegiance. Now we'll just take a moment of silence to say some words and reflect on our members serving overseas and our emergency management services and police officers who protect us. Okay. All right, welcome everybody. We're going to have a very long workshop today, it appears. I think we'll just go ahead and kick it right off with our item on health insurance. This is a discussion on self-funding versus fully insured. If you'd like to go ahead and come up, I'm sure Charlie.
Good morning, everyone. How are you? My name is Sherry Beignet. I am the benefit consultant for the county. I've been working with you since 2010, actually a little bit before that. I think I've been working with you since 2006, now that I think about it. And today we're going to talk a little bit about the fully insured versus self-funded aspect of your health insurance plan and kind of hopefully understand a little bit better about how the program is best fits the county, basically. Is the presentation available? All right, thank you. You can go ahead and move to the next slide. Or is that something I can do here? All right, so I first want to just kind of give you a brief overview about the difference between fully insured and self-funded. A lot of people are very familiar with fully insured programs. That's what traditional insurance over the years has been, is a fully insured program. Self-funding kind of came out maybe a little bit later in the history of insurance. But in previous times, you would basically pay a premium, and smaller groups do this today. You basically pay a premium to an insurance company, and that insurance company covers your claims. And at the next year, they take a look at what your expenses have been, and they estimate what they should be for the upcoming year, and they charge you that amount of money. They kind of bundle everything together in that kind of an environment. When we have self-insurance, we basically break those components apart from each other. And we may buy different pieces from various companies so that we're able to get the best deal on those various components. And so what I did on this very first slide is show you what those components are. The first component is what we call administrative services, or ASO. And this is paid either to a TPA, a third-party administrator, or to a carrier, in your particular case, who is acting as a third-party administrator on your behalf. And they do things like process your claims. They actually pay it out of their bucket first and then charge you afterwards. So there's a little bit of coverage of that, but ultimately it is their responsibility to just pay those, but you ultimately are paying those claims. And they handle all kinds of administrative things like making sure that you have enrollment forms or cards, ID cards, things of that sort, is still handled by the insurance carrier. They also provide what's called a summary plan description. It is a huge document that outlines how everything is covered. So they provide that. We actually just got the final document for the current plan year earlier last week. They also maintain your records, and they provide us with reporting. One of the big things that they do is they negotiate with the providers in the area. So they've negotiated rates and costs with our local hospital here, Advent Hospital, and the other providers that are participating in their plan. They actually negotiate those costs on our behalf, so we're not doing that directly. They also provide disease management programs. This would be things like there's some really great pregnancy programs that are available. If there's cancer programs, that if you have cancer, they're going to help you. Diabetes management programs, those are all available through there as well. And then there's also some wellness components that the TPA handles as well. In a fully insured coverage, those would all be handled under the fully insured coverage as well. So no difference there. The ASO cost does have a little bit of what we call retention, and it's basically the revenue for the insurance company in it. However, it's significantly less in a self-funded program than it is in the fully insured, that retention or that revenue. And the reason for that is when you are in a fully insured program, they take on all of the risk. If you have $1 million claim and they've contracted in a fully insured environment to charge $700 for employee-only coverage, they can't change that premium. They're going to continue to charge you $700 in premium for the remainder of the year. Now they're going to hit you the next year because they've had to pay that off. But in a self-funded arrangement, they don't have to take on that risk. So those administrative costs are a lot less. So the company, in this case the county, takes on that risk. If that $1 million claim happens, then the county has to pay for it. So in order for us to help mitigate that risk, we also have another component called stop loss. And we'll talk about stop loss on the next screen. But I do want to mention that in a self-funded arrangement with the ASO, there are no premium taxes. There's a little bit of carrier profit margin, as I mentioned, that risk charge, and some continuity program. So we can go ahead and move to the next slide, or is that something I should do? Okay, perfect, thank you. The next component is the stop loss, also known as reinsurance. And this is basically insurance to help protect from those really big catastrophic claims, those $1 million claims. Our stop loss coverage here at the county actually has a $200,000, what we call specific deductible. So any claim that's over $200,000, this reinsurance is basically reimbursing the county for those funds. So it's extra insurance on top of what you guys are doing on the insurance program. So there are a couple of components of stop loss coverage. The first is what we call specific stop loss, and it is that individual person. So each one of the people that are covered under the plan, whether it's an employee or a dependent, has a specific deductible that has to be met before this stop loss coverage is going to start reimbursing the county. As I mentioned, that's $200,000. So if we've got somebody with $1 million claim, then you're going to pay as a county the first $200,000. The rest of that is going to be reimbursed from that stop loss coverage. So that helps us when we have those really big claims. There is a component of that called the contract type. And it's basically how long a period of time when the time period that is going to be used to determine whether or not that particular claim is going to be paid under this particular stop loss coverage or the following plan year, as for example. So you guys have what's called a 1236 plan. It's actually a really rich policy, even though we just moved carriers for your stop loss coverage. And basically what that means is if a claim happened or was incurred during the 12-month period of your plan year, it is going to be covered on that as long as it's paid within the next 2 years, during that plan year or the 2 years after that. So for a 36-month period of time. You guys probably don't care or need to know that, and that's my job, to make sure that things are paid and processed properly so that you are covered in that particular case. But we always want to make sure that you've got adequate coverage there. The other component of a stop-loss coverage is what we call aggregate coverage. Now, with the specific, it was for each individual person. With the aggregate, it is the group as a whole. And basically what they're going to do is they're going to look at what the claims were, or what we estimate the claims are going to be for an upcoming plan year. And then if the claims go over 125% of what that anticipated claims amount is going to be, then the aggregate coverage kicks in. And we actually had an aggregate claim here at the county 2 years ago, and we are just now getting the final check for the reimbursement on that. But we hit that 125%. That was back when we were covering weight loss medications, and those were really contributing to that. Plus, we also had $1 million claimant in that year, which was a big piece of it, and just a lot of things going on in that particular year. It's actually pretty rare to have an aggregate stop loss. We're finding it a little bit more frequent now as costs increase, but it's important coverage to have just in case something major happens in your plan. Another piece of stop-loss coverage that you need to know about is what's called lasers or specific deductibles. So the carrier has the ability to basically laser or take someone out of that specific deductible. Now, they could remove that person completely, or they can say, instead of being $200,000, we're going to make this person's specific deductible $500,000. Okay, that is something that's pretty common, and we use those occasionally to help reduce costs. We did that this year because we had an individual we knew wasn't going to stay on the plan, and so we used that to kind of negotiate to make sure that our rates were a little bit lower in that particular case. But it is something that's out there. Now, your plan has a no new laser component to it. So if if we renew with the same carrier, next year they won't put a laser on it unless we request it for a premium reduction. Okay? So that's the second component of the stop-loss coverage. Is the stop-loss coverage. Now, there are a few things that are advantages and disadvantages for stop-loss coverage. First of all, the stop-loss, some advantages. The first one is fixed cost stability. So we know what the administrative or that ASO fee from Blue Cross and Blue Shield, in your case, is going to be every year. We actually usually have 5-year contracts with those, so those are pretty much set in stone. We can negotiate those stop-loss, or those ASO fees. We also know ahead of time what your stop-loss premiums are going to be. And we're pretty good at guessing what those increases will be in future years as well. So there's some stability in that. Where the disadvantage is on that particular piece, and this isn't necessarily, well, it's down there, it's under claims fluctuality, we don't know what the claims are going to be. I don't know if you're going to have $1 million claim this year. But we have lots of data that we use and the actuaries use to estimate what your expenses are going to be. And by putting in that stop loss, it helps us know a little bit better about what the expenses are going to be. So that is one of the disadvantages. Then another advantage is cost management. One of the things that we have the ability to do in a self-funded plan that we don't in a fully insured plan is make plan design changes on individual components. So, for example, if I see in your claims that you have a lot of people using the emergency room, and these are things that they should be going to their doctor or to an urgent care center for, I can change your copay on your emergency room without making changes to the other provisions in a plan. In a fully insured plans, they are pre-made plan designs, and I can't change that particular provision without changing the whole plan design. So that's another good advantage that we have under the self-funding arrangement. We also have access to a lot more data for your claims. I actually am able to see individual claims on a self-funded basis. Now, keep in mind that not everybody has access to this information, so you can rest assured I can't see I can see your claims, but not anybody from the county has the ability to do that. In fact, we work with the county to try to protect the county from having any access to the individual people's claims, because we don't want that to become any kind of a decision-making process. So we help protect the county in that. But it gives me the ability to see whether or not there's a high utilization in your emergency room visits, or if this particular medication needs to be covered or not, because there's a bunch of people utilizing this. So having access to that data is super important. When you're in fully insured, we don't have access to most of that data. So it makes it much more difficult. It also gives us the ability, if we see a high uptick in, let's say, cancers or diabetes, we can maneuver and make the wellness programs what they need to be to address those particular issues. I don't have that same capability in a fully insured program. We have also, I've already talked about the lower administrative costs. In a fully insured program, those costs for administration are much higher than in a self-funded program, again, because you're taking the risk as a self-funded client versus the carrier doing that. One other important thing is we have the ability to carve out certain programs. So our stop loss is carved out with a different carrier. It's not through well, actually it is through Blue Cross this year, but in previous years it wasn't. But Blue Cross was the best deal this year, so we took that. When you're fully insured, we don't have the ability to do that. That reinsurance that's under the fully insured program is always going to be with Blue Cross, and we don't have the ability to negotiate that. But we also have the ability to carve out things like your pharmacy benefit manager. So right now, you are carved out with Optum for your pharmacy benefit manager. They are giving the biggest rebates for prescriptions right now, and therefore they are better than if you were carved in with Blue Cross and Blue Shield. I will mention another big reason on pharmacy that I like to have pharmacy benefit manager programs carved out is because Blue Cross doesn't have a lot of controls over certain things like specialty medication drugs, which are super expensive medications. They don't have great programs to help ensure that members are paying less and that the county is paying less for those programs. But with other programs like Optum, we do have the ability to do certain programs like specialty copay assistance programs that will help reduce costs as well. And then I've already mentioned being able to customize your plan design. That is a big piece of it as well. Disadvantages, of course, the county takes on that risk. So if we have $1 million claim, ultimately you are paying it. We're getting reimbursed through the stop loss, so we have some mitigation there. But it also does have some asset exposure. So if you have $1 million claim, or if there's a legal action, the county does take that on. We do everything we can to help protect you in those types of things and make sure that you have all of your legal documents. One of the big advantages of having your coverage through a carrier like Blue Cross or United Healthcare or Aetna or any of those, the other big carriers, is that they actually will help with that, and they provide all the legal documents. That's a part of the ASO fee that you pay there as well. Claims fluctuation. This month, your claims were really low, about 200, I have to look at it, and it's later in the presentation, but it was $750,000 the month before, or 2 months before. It could have been $300,000. So there's lots of ebbs and flows. That's a big disadvantage as well. And then there is some run-out liability. If you decide, for example, to move into a fully insured program, any claim that happened during the current plan year, so through September 30th of 2023, 2026 at this point in time, you're still responsible for those. Blue Cross is going to administer those for you, but you would still be responsible for paying those. So there is that run-out liability that needs to be met as well. So we have to keep that in mind if we did decide to make that change. One of the things that I did do is I went to Blue Cross and Blue Shield and I asked them to provide me with fully insured rates for your group. And they did do so. And those rates, you can see those in the darker green on the right hand, on the lighter green in the middle of the screen. So the employee-only rate, $1,042.81. Employee and spouse, $2,377, et cetera. So that if you were fully insured currently, this is how much Blue Cross would be charging you. However, and when I look at your enrollment, just so you are aware, I went ahead and calculated what the annual cost based on those fully insured rates would be, and that came out to $12,644,355. So if you were fully insured, that's how much you would have paid out. And you aren't going to get any of that back, no matter what your claims look like this year, because you're fully insured. They've taken on the risk. Your expenses, just so you kind of have an idea, for the 24-25 plan year, were $9,117,796. So you actually saved quite a bit of money by being self-funded. So that, I want to make sure that you understand that $9 million includes the ASO fee that you paid to Blue Cross. It includes the stop-loss premiums that you paid to the insurance carrier, which is not Blue Cross. I think it was WellPoint last year. It includes all of the claims that you paid for medical and prescription as well. It does, however, remove the rebates that you received from the prescription, and it removes the stop-loss reimbursements. So that is the actual expenses amount that you paid during that 24-25 plan year, $9,117,000. Now I do want to mention to you, you'll notice on here in the darker green, there are what we call premium equivalents. So when every year when we look at what your rates should be or your funding needs to be for the following plan year, we have the actuary calculate what your expenses or what your rates would be as a self-funded plan. And we use those premium equivalents for your COBRA and your retiree rates. And that's what you see there on the right-hand side. The reason that there's a difference is because when you are fully insured, the administrative costs are higher. So their premiums are going to be higher. They also have an idea based on the expense, they see the claims, so they have a better idea about what they think the future is going to hold. And they will increase your rates because of that as well. So it is a better situation for you to be or it has been in the past, a better situation for you to be self-funded based on the things. One other thing I forgot to mention, in that $9,117,000, it also includes the expenses for the clinic, and we also have an international drug program called CannaRx, where members can get their drugs through this program at no cost to them, and that helps reduce the cost because we're buying it through another country instead of the United States, where pharmacy expenses are pretty high. Those expenses are also included in that $9 million. At this time, I'm going to introduce Brian to you. Brian is from My Health on Site, and he helps us manage the clinic. And he's going to give us a little bit of data about the clinic.
Good morning, board.
Good morning.
I'm Brian Branham, Vice President of My Health on Site, and it's been an honor to serve the county and the employees and the members on the health plan for a number of years. So we're very excited and honored to serve the employees. So just a couple highlights, like Sherry mentioned. This was from 2024 data. We had just over 4,000 appointments completed at the health center. With that, when you do the math and compute, we saw a little over 2-to-1 savings. And I'll go into some highlights about how we get to that. Like Sherry said, with fully insured versus self-funded, one of the things that the health center, we're seeing medical visits, right? We're agnostic whether the plan is fully insured or self-funded. But when you're fully insured, what the mission of the health center, what it accomplishes is there's no claim filing to the plan. We file 0 claims. So everything that the expenses that are included in that $9 million, I believe you said, Sherry, on the previous slide, those are direct pass-through costs to the county. So the staff, the meds, the labs, everything we do is a pass-through. We do not file claims. So that's what generates the savings from the medical plan. So when you shift all those services away, it creates the savings. So just a couple more highlights there. 85% utilization at the health center is very, very good. We have 75% participation by the current employees at the health center there. Just a quick call out there, 76% of that 75% that are participating visit the health center 3 or more times a year. So you have very, very good utilization.
Question.
Yes, sir.
Just explain a little bit on the difference. Just the provider utilization was exactly, does that mean?
So, yeah. So the way that we budget for the health center is based on hours or capacity. So we have provider hours that are set 5 days a week. And that provider participation, meaning the utilization of the appointments that are used, is 85%. That's what that means.
Is there actually a doctor there, or is it a nurse practitioner?
So we have a combination throughout the course of the week. We have an MD and we have 2 nurse practitioners.
And it's 7 days a week?
5.
5 days a week? What are the hours?
Ooh.
Sorry.
Mondays are 8 to 5, Tuesdays 8 to 5, Wednesdays 8, and Thursdays along. We open later on Thursdays, and we stay late on Thursdays. It's 10 to 7, and then Friday is 8 to 5. 8 to 5. We did try Saturdays a number of years ago. Anita, was probably 4 or 5 years ago, let's say. Maybe a little bit longer. We did open, I think it was, we did it for about 3 months where we had half day, 8 to 12, I believe it was, or 9 to 1. The utilization was a little lower. We thought that we would get the utilization and we didn't. So the cost to do that versus the utilization we were getting, we decided that it wasn't to continue with that.
So does our staff go to a urgent care or quick,
For urgent care services?
when this isn't open?
Yes, you would use the.
We have to search out another clinic, right?
Use the
Or the
plan.
ER.
You would use the plan or urgent care, right. That's right. So the idea is to create the capacity to allow for those types of events. So not only are we acute to treat acute care, we treat chronic conditions as well. So that's why we try to maintain that utilization. Our target for capacity for utilization is 85%. And what that allows for is same day, next day appointment. So it's very quick to get in. Early on, when we were busy, it was very, very high. So we did expand. We were able to expand some hours to allow for that same day, next day appointment. And that's exactly the point, is to avoid a very, very costly visit to an urgent care or worse, ER. Because that's very, very expensive on the plan.
Chair, one more question. So on the 75% participation, do we do outreach to the 25% that aren't utilizing it to find out why?
We do have surveys that are, but they're put out. It's been a while since we've done a county survey just from the county side. We have surveys when you come in. We have a ton of announcements. We use a system called Constant Contact that posts services at the center, upcoming events, like when you do your wellness event that starts in August and runs the year. We're participating in that. We complete what's called the VHP, or Vital Health Profile. So there's a lot of outreach for that. So there's a lot of communication. With new hires, they get there's a packet that includes services that are provided at the center and what's available to them, and what it means for them to, because there's no copay. There's no copay for the visit. There's no copay for the copay or for the meds that we dispense, the labs that we do, any of that. It's all free to them. Sure.
I think one thing that's really important to remember is that due to privacy rules, the county doesn't know who is going to the clinic. So when you say we, the county really doesn't do anything other than globally, but there is some outreach. They do have access to the population. They have enrollment data, so they can see who is utilizing it and who isn't. So
Yeah, I know survey-wise, you can answer it when you're checking out and the pad is there. I just was curious, right? The goal is to get them there, and just as long as we've got something in the works, even if it's global, that we do the outreach. I understand your point, though, about privacy.
Well, it's also probably a combination of people who have insurance through their other employers, or there are a lot of people who don't go to the doctor.
Yeah.
So it's probably like a good shot of that.
That's a big, that's a good point. One thing that we find when we work with clients is you find that patients they're invisible to the plan. Doesn't mean that they're not sick or have issues, right? So what that means is they're not a claim yet. So the idea is to get them in. We try to eliminate that barrier to care, meaning it's close. It's 500 yards from here. It's free. So those things that we try to provide to get the population to come in before it becomes, and there's scores of events that I can tell you where we've intervened because we had our lab draw and a annual physical visit, which I mentioned is our VHP. We've caught so many things because of that, where folks haven't been to the doctor. And it's mostly us guys. And you haven't seen a doc in 6+ years, which is crazy to think. But
And they also, just if you haven't been there, they also offer mental health counseling.
we do.
Also.
We do. That just started in January of 25. So that was a couple years previously we had discussed the need for that. Obviously, there's the high demand for behavioral health. The access to care was also an issue. You're not alone. This county is not alone. We have other counties, other clients that are doing the same thing. Actually, you were one of the first to bring it in-house like this. So it has been successful. We have over 50 patients now that are coming through since starting of January of 25. So it's been very, very successful so far. Just a couple more highlights. Over 40,000 prescriptions, and when you translate that to copays, it's a little over $42,000 in copay savings. On the medical visits, a little over 2,800 medical visits, which is another $26,000 that saved the employees in copays. So you take a look at the ORs, a little over $2 for that. One other thing I'd like to just mention real quickly, 84, oh, yeah, sorry. Sorry. You have 84% of your employees, like I mentioned, your vital health profile and the wellness programs that you have in place today. 84% of your employees are participating in that, which is fantastic. So kudos to Anita's team and Sherry in the wellness program that the county puts together. it really gets the folks in. Like I mentioned, by doing that, we catch things, keep the spend off the plan.
May I ask an off-the-wall question? I'm good at that. What do you see as the participation numbers between the years of COVID versus today?
Right.
Because that's a huge, how do I say, circumstance that we never occurred in this country, right, or in this world. And now I don't know whether there's an onslaught of people looking for, health care versus what the figures were 5 or 6 years ago when people were hiding in their homes.
Yeah, good question. So during COVID, fortunately, we did not shut down a single health center throughout the entire time. So obviously a lot of protocols. If you've been to the health center, you saw the signs out front where we were treating literally doing sick visits outside. But we did everything that we possibly could to not have to close the health center down, unfortunately. By God's grace, we didn't have to shut a health center down across the entire state. So we did a lot. It was a lot of work. We did see some, obviously, in the first coming months, there was drop in utilization. Obviously, a lot of folks didn't know what was going to happen. So we even made here in the county, we actually worked with the health department during that time, where we were in fact helping them with the employees and members of the county to administer the vaccine if they wanted it. So we were providing access to that. But yes, there was a little bit of a drop in utilization.
Back then.
Mm-hmm. It was. But today, the utilization is right at about 78%, right at 80%.
So was it cost effective then or now? Which one was it more cost effective?
Both. Yeah, both.
Okay.
Again, even though the utilization may have dropped during COVID, we're still avoiding any service that we provide is not an exposure to the plan. So anything that we can do to shift away from the plan is encouraged. When you take a look at your health plan, there's four major buckets that your claims are in. Professional services, your inpatient, outpatient services, your drugs, right? Or outpatient's one of the three, and your drugs. The health center immediately impacts when you're self-funded. It immediately impacts their professional services and the medications, which typically are between 35 and 50% of your spend. A little higher with school districts, but when you look at that, it's a big chunk of what you're spending on your plan. So we immediately try to avoid that. When you're fully insured, which this discussion is about, claims are going through the plan, even though you have the health center, right? When your renewal comes up to what Sherry was mentioning, your premium is based on what they expect your claims to be on the plan. That's fixed. Even though we're saving money because we're not filing claims, you have to wait until you get the renewal next year to negotiate. Well, we feel the savings from the clinic, and there's a negotiation piece there. It's not where it's when you're paying your claims the way you are today. So, but on the slide, basically what we do is we go through and we look at your professional services, the labs, the RX, and when you add that up, it's about $888,000 in claims avoidance from the plan. So if you were, for example, if the health center were to go away, or just imagine all those services would get dumped back into the plan at a higher cost. So again, just when you're self-funded, those claims are not being processed through the plan. They wouldn't be if you're fully insured, but when you're self-funded, you are not paying any claim because everything's being passed through the county. So, any questions for me?
Oh, just one more, and that's just the one-to-one ratio. It doesn't really account for issues that are caught early on, and
Oh, correct. Yeah, it's kind of hard it's always been a question is how do you put a cost on the claim that never occurred?
right.
Which is hard to do. Sometimes we identify things that cost money, but it saves from, the heart attack down the road. Right? We had a gentleman a number of years ago that, not here, at a different client, that had labs done and didn't think that those labs were his labs. We went through the process, verified everything, and that person needed to see a cardiologist and went to get more advice, ended up having to have bypass, and became our biggest cheerleader. Credits to the health centers to saving his life. So those types of things, it's kind of hard to put a dollar amount of what it would have cost.
Right. And I
It's
think
obviously a lot more expensive.
right. The point being, right, the clinic I think is very effective, and I think the employees love it because of the convenience. But from our standpoint, sitting up here, it's the cost savings from being a preventative model, being employees catching things early on and being able to treat things before they get worse and before they get expensive.
Right, that's right.
I did have a thought, and as I was listening to Andy, the thought went to the side. Oh, screening. You're talking about preventative. It's very popular in the outside of this governmental setting, which I've spent most of my life with. They do those screenings. I've watched what's happened with those screenings, and I do know people that are surviving due to those screenings. Is that part of what that you are offering now? Somebody could come in and say, I want to get scanned. And the scans are getting very detailed now more and more as things go on.
You
So,
mean like
a heart, lung, body scan, the scanning.
So we don't have the equipment for that. However, we do have opportunities to partner with imaging firms that we would be able to do that.
But
Obviously,
you don't normally do that, is my question.
the screening starts with first health history, getting your lab, and then going through that. And then from that lab event, if there's things that warrant additional
Addressing
addressing something
issues.
through a
I
specialist.
understand that. I'm wondering if you have an outside company that comes in and does any of the screening. Is that a standard? No,
No,
it's not constant.
There,
Okay.
there is, when it comes to occupational related services, firefighters, annual physicals, and those types of things, where we do bring in imaging, those types of things. But it certainly can be added. We would just need to, we would partner with a firm
Outside,
that
yeah,
would
an outside
provide the timing and the scheduling to do that. That wouldn't be an issue
I
to
just
do.
didn't know if we were offering that or not. And that's something that's getting very advanced very quickly
It
in
is.
preventative healthcare. And that's my concern. And how much more will that cost us if we do that? That's the other side, too.
Yeah, we would, if that's something we would, we would go and try to negotiate a better deal, if you will, with imaging. As an example, we have clients that we direct contract with imaging where we're at 85% of Medicare. And if you're going to the plan and getting an MRI done or CAT scan in the professional setting or an outpatient setting, it's 200% of Medicare. If it's inpatient, it's 400 plus. So we'll negotiate that at a much lower rate because they like the cash, and it's much easier.
I understand.
So.
Thank you.
But thank you. Awesome. Thank you.
I will also mention on the scanning, we have done some scanning through the wellness fair that we've done in the past through Life Scan, I think is what it was called, that is similar. Angio screening through the vascular screening through the wellness program. But we can absolutely look at some of those types of things and get some costs related to those. But yeah, there again, it's hard to figure out what the return on investment is,
what's your
but
ROI?
we definitely want to make sure that we offer those opportunities for people to do, to get those screenings if they'd like, so, for sure. Oh, that's okay. So I did want to just give a quick brief overview of some of the other pieces of information that I think are helpful as you are thinking about fully insured versus self-funding. The first is kind of a history since 2009 of the employee premiums. The coverage for single insurance here right now is $36.06. We actually back in 2009, had a zero cost plan at that point in time. And it's been increased, as you can see. We tried 2 plans for a while with a $20 copay cost for employee-only coverage, went down to 1 plan, and it slowly creeped up. From 2016, we were at $25, and then we've increased, we didn't have any increase from 2016 to 2023, which is a huge gap. And you can also see the family coverage. I will tell you, these rates for coverage are very low compared to what we see out in the marketplace. That said, they're not the lowest that I've seen. I actually have a client that their employees pay nothing to insurance, whether they have employee only or family coverage. It's a little different environment than what you guys are in, but these are the premiums that we are currently charging per month to the employees for their coverage. There is no way that your employees would be able to go out and get family coverage through the marketplace for less expensive than what your premium is right now. So we have very good participation in your premium, in your coverage. And that's important because we're pooling all of your people together, and those individuals that are healthy are paying into a fund that basically is helping to cover some of those bigger expenses. And so it's really important that we have high participation in your health insurance plan to help keep you from having what's called adverse selection in your coverage. Now, we also track your employer contribution. Your employer contribution is a little different than what you would probably have if you were fully insured, because for the county, we actually calculate what your total costs are estimated to be, and I divide it by the number of people that are enrolled in the plan, whether they have single coverage or family coverage. And you fund based on that amount. And so you can see we started in 2006 when I first started working with your account at $13,000 per person per year. We dropped that in 2008 to $9,000, and then it's again creeped up a little bit. Again, from 2016 to 2023, 2022, we did not have any increase in the funding for the employer. I will tell you during that time frame, it wasn't because I wasn't recommending increases, but the administration at that point in time was not making the increases to the funding. There was a nice, healthy health insurance fund at that time. They were actually pulling money out of the fund during that period of time. And even some periods of time before that, and then we've had to start putting money back in. And so that's part of why you've seen over the last last year or so, some requests to move funds from general to the health insurance fund, because we want to make sure that there's enough money in that health insurance fund. You can see in 26, 27, $3 million was moved the opposite way from the health insurance fund into the general fund. $1 million in 28, 29 was moved into the health insurance fund, and $600,000 in 29, 2010. And then in 22, 23, we've had to move money back from the general fund into the health insurance fund at $800,000, $1.2 million in 23, 24, and then this year, $1.5 million to help cover the expenses. So we're dealing with a couple of things with your health insurance plan. We had a big chunk of time in there where we were not putting revenue in to the health insurance fund, and we also had money coming out of the health insurance fund related to moving the money around to cover other expenses because it was a nice hefty fund at that point in time. So we're dealing with those two items when it comes to this.
Can I ask a question? So this, there's no benefit to setting this up as an enterprise fund where it only funds itself?
Well,
That ever been looked at?
I don't
And
know.
why would $3 million fund something else?
I will have to ask finance to help me with those questions because I actually am
fine.
not privy for that.
They can hold on that. I can get the answer later. It's not a big deal.
Sure.
Like you say, if you want a healthy fund, it's like, all the stuff that they're claiming happens in Medicare, that our Medicare's pool or fund is paying for other stuff. I'm surprised that there is not some type of a stop on this or a way to prevent this.
Yeah, so the state of Florida does require you to have a health insurance fund, and it requires you to have enough money in that fund or accessible from the general fund, actually, if for some reason it's not in this particular fund, to cover at least your expenses for a year plus what's called a 60-day surplus, so 60 extra days of expenses, plus what we call IBNR, which is incurred but not reported. Remember when I talked about if we move for fully insured, that's what we're talking about, is that expense if you were to move back to a fund, or not back to, you have been self-funded as long as I know, but to move fully insured. So there are some requirements from the state of Florida. As far as how those inner workings work here within the county, I'm not privy to that information.
Well, it looks like there's been a loan made because,
Yes.
right?
In essence,
So
that's
you're
what's
using
happened.
money in 2006, but I had to pay it back in 2025,
Yep,
right?
yeah.
Okay. So there's no way to stop that from happening.
Again, that's a financial question I'm not able to answer.
And I already asked the question about the fund. Okay. And there's no way to know why. There's no way to know why that money was transferred out. We do know why we're transferring it in, though.
Yeah, I'm sure that there's historical reasons. I don't know what those were.
Thank you.
Yeah, sorry about that.
No, you're good.
All right, so I also, the other thing that's happened over the last couple of years is you've actually had some rough years. So back in that 2010 through 2023, 2022 timeframe, you were running pretty well. And we were recommending at that point in time increases, but they were minimal increases, 3, 5, 10%. Over the last 3-4 years, you've actually had some pretty rough years. So this first slide is from 2024, October of 2024 through September of, well, it's actually November of 2025. So this is the last year's worth of data. Prior year's worth of data, sorry. This is the prior year's worth of data. And you can see in May, we actually had a really rough month. You can see we had $1.8 million of claims, medical claims that were paid out. Pharmacy was also a little bit high that particular month. So we had a really rough month that year. Overall, when we look at your expenses to budget number, for that year, that number was 98%. So we were running for that year as a whole right at where we needed to be. And we were already short in funding from prior years. So we were needing to make up some money in increasing funding, and that didn't happen enough to be able to continue moving forward. So that's the prior period of time. And then this is the some more current pieces of information. You can see here, this is data through November. We had a really good month in November. We were actually $657,000 better, more money coming in than what the expenses were, which is great. But you can also go down below there and see that month of May down there where we had that $1.2 million budget variance upside down. So you can see the greens are positives, the reds on that one column there is the negative. So we're actually running pretty good so far this plan year, but we're only 2 months in. I will tell you, you had that ag claim, and that ag claim money is going to make a huge difference, because it's a total of $1 million. We got half of it in December, and I'm expecting the other half of it. It's actually a little less than half of it. We got over half of it the first time. We should have the other half any minute now. Like, I'm expecting that check within the next week or two. So we're going to have an extra $1 million that's going to be added to that fund, which will really help stabilize things going forward as well. This is some information on your current stop loss. So I misspoke earlier today. Your current stop loss is actually $250,000, not $200,000. I think it was $200,000 last year. And so far this year, we've had one individual that is on my radar to watch. They have not quite hit the stop loss yet. They have a total claims of $218,000. And then last year, you can see our top claimant had claims of 1.5, almost $1.6 million. And so you received that stop loss reimbursement of almost $4 million for that particular individual. Yes, those $1 million claims happen, and they're becoming much more frequent, unfortunately. And the prior year, this is the prior year period, the 23-24 plan year. You can see you've got some pretty high numbers there. If you take a look at, I think it's February, you've got another net plan cost of $1.3 million. That's another $1 million claimant that hit that particular month. You had two in the last basically 2 years. So it's been a really rough couple of months. And so we are definitely hoping and crossing our fingers and knocking on wood and everything that we possibly can, saying some prayers that you will continue to have the year that you're having so far this year, and that things will start moving better forward for you all. Okay? You look like you have a question, Pam.
It's not a question. I've got a lot of thoughts going through my head at the same time, as you know me, Sherry. I would think that more early intervention could prevent us from those.
Yep.
I don't know if it would cost us more to do the prevention than to go into a reverse.
Yep.
It's like reverse osmosis to me. That's all I can think. And
sometimes it's preventable, and sometimes it's not. I will tell you, one of the two. The individual knew that they had the condition for a long period of time and didn't have it addressed until it was basically too late, and they ended up having to have a transplant done. And that's unfortunate. Those are the kinds of things that we can lead the horse to water, but we can't make him drink.
And the other part of it also is there's so much new medical technology that people that would have already been left the earth are able to stay here longer.
Yep.
And get replacement parts faster. I know so many people with transplants right now on kidney transplants. 5 friends of mine have had new kidneys put in.
It's unbelievable.
And I can't believe different age groups, different lifestyles. It's not necessarily so. I don't know what's causing the masses to be so ill as far much further and much faster than that used to be. And catching up is never going to happen.
Yeah.
Unfortunately.
Yeah.
But as long as they have these great tools, we can keep people alive. But then it's the cost of keeping them alive. So how long can we continue in this plan and this pattern until we can't afford it anymore?
Yeah, and unfortunately, that's the
That's the
question
question.
of
It's
health
gonna-
insurance
Yeah.
throughout the world and
Yeah.
nationally. You know, unfortunately, everybody's dealing
I do
with
get
that.
it. I understand, but it is a concern.
It is concerning.
And I don't know how we stop. How do we get stopping the costs
Yeah,
healthfully here?
yeah.
The rest of the world is not my problem today.
Just the
I'll
county.
I'll save it. I'll save it later. But in the meantime, I'm more concerned about how do we keep our staff and our
Early
people well.
intervention and making sure that we do what we possibly can is definitely important. It doesn't solve all problems, we know that, but at the same time, we want to make sure that we can do everything that we can to help people. And that's why the clinic is such a great thing. And we offer free prescriptions through the clinic and through Cannot RX. We're doing everything we possibly can to help promote people to be able to basically get their health care taken care
I
of.
understand.
So, yeah, excellent.
Well, thank you for
The
your.
clinic's
thank
not
you for-
going to solve the, how many
Catastrophic.
pregnancies we have, how many babies are born. It's not going to fix cancer, unfortunately.
It's not going to fix premature babies.
It's not. It's not. This is, you know, insurance is for the people that don't need it. I mean, we pay for the people that need it. This is how it goes. So do you look at morbidity? Do you have a comparison of our morbidity versus other insurance morbidities? So is our rate of childbirth higher than, are there things that you can play with that you can analyze? Is cancer more prevalent in Flagler County than in Volusia County? Can we pre-plan for some of this stuff?
Yeah,
You know,
I
is
can
there a
definitely get
way
some reports related to that, and we can talk about some different things that we can do for that.
And then the other thing is, this is not popular, but how much can the insured bear before it's no longer a benefit? So are we paying a disproportionate amount towards the insurance than, let's say, the school board folks? How much can we absorb without knocking this thing?
Yeah. And it's a delicate balance, really delicate balance, especially because your rates are so low.
Right.
As we start increasing those, if the employees don't have increases in their wages to combat that, they're not going to take insurance, and that's going to cause us to have that adverse selection. So if we do want to look at that, my recommendation is to do things like add in a lower cost plan that maybe has a higher deductible. Let those people that are wanting more catastrophic coverage because they're pretty healthy, look at those types of coverages, offer them a lower cost option. But those that need the higher benefit plan than what we've got now, we can increase those premiums, things like that. And we do those things slowly so that people can adjust their situations at home and that type of thing. Yeah.
So for those of us on Medicare that don't participate in the plan,
Right.
do you have any studies showing how many people do people move into the Medicare plan if they're employed here?
If they're employed here, yes, a lot of times they do. Not always, but a lot of times they do. If they're retirees, I see almost all of them once they become Medicare eligible, because those rates are so much higher. Remember, we use those fully insured equivalent numbers for the retiree rate. So they're paying not quite $1,100 for coverage a month versus your employees are paying $35 a month. So in those particular cases, we definitely see that. And retiree population, unfortunately, is one of the more costly pieces, and we have, because of state law, we have to fund them exactly. I shouldn't say fund them. We have to offer them the same coverage that you are offered as an active employee here for retirees because of state law.
Oh, retirees. Okay.
Yeah. But they're an expensive population. So yes, a lot of people do move in as active employees, but not everybody. I can definitely get some numbers on that for you, though.
No, if it's not impactful, it's not worried about. But I just thought that there'd be more data on aging out. But okay.
I can definitely look at that. I will tell you, that's really not where your big expenses have been. Neither of your high-cost claimants were Medicare aged. And honestly, it's kind of amazing. You haven't had it, but almost all of my really big $1 million claims are premature babies. It's amazing how many premature babies cost a lot. So let's knock on wood that we don't have premature babies. We did have one, actually, and but I think it was only $600,000 for that premature baby. Okay?
One
Sure.
final question. All the constitutionals are part of this county
Except for
plan,
the sheriff's office.
except for the sheriff's office.
Correct.
Thank you, clerk's office.
Except who?
Except for the
sheriff's office.
sheriff. A few years ago,
They moved away 3
They
years
moved
ago,
away.
4
Is
years
there any movement or possibility of the sheriff coming back, or how did that movement affect the plan overall?
The movement from the sheriff's office moving out really didn't have a major impact to your plan. Although your claims were higher the following 2 years, it had to do with your high-cost claimants that were really the big drivers of that. It really didn't have a lot to do with the sheriff's office moving out. The sheriff's office moved into a fully insured program. And one of the things that I think is interesting as we look at what happened with the sheriff's office, they haven't had the ability to control their rates quite as well as you all have. So you've been able to kind of still keep things status quo, trying to make up for some of those things that we talked about in the prior year. But they've had to jump from insurance company to insurance company in order to help maintain their rates. And that's what happens in the fully insured market because you don't have any control of what those increases are going to be.
Yeah, and that's very tough on the employees.
Yes. Yep.
Okay.
Yep. I did kind of take a look at some of the counties and cities in their nearby area and whether they were self-funded or fully insured. The ones under the self-funded words are all self-funded, and the ones under fully insured are fully insured. You'll notice it's the smaller ones that are fully insured. The bigger ones are all self-funded. You have been self-funded, as I mentioned, long before I was a part of the county's account. So, and I honestly think it's the best place for you. I think that it's always worth looking at to see whether it is, and we will continue to do that for you. But as we do that, we do have a couple of considerations. We've already talked about the difference in the expenses. You do fund based on that flat per person basis. So funding would need to be changed a little bit if we moved into the fully insured program. We would also need to keep in mind that we kind of already talked about those two. If you moved to a fully insured program, you would still have run out. So we would need to account for that. Blue Cross also would charge you an additional 15% of the claims cost to administer that run out. So that's an important thing to keep in mind. Currently, your rates, well, I will tell you for fully insured coverages, we would be able to start pulling quotes for fully insured coverages for a group that's a 10-1, probably March, April, May timeframe. I have on here, they have to provide those within 90 days of the renewal date, but I think we would be able to get them a little bit earlier in that timeframe if you want. But I will also mention that you are currently in the middle of a ASO contract. Not to say that we couldn't pull out of that with adequate notice, but that doesn't expire until September 30th of 2027. The last time we actually did a full out to bid market check on your group was in 2017. So, you know, we're about due within the next couple of years to do that for sure again as well.
One more off-the-wall question. How many people are on this program?
You currently have about 700, well, let's look. We can
Just
see
to
that.
get an idea of cost per person.
Yeah, so you can, if you take a look at the numbers on the screen there, you'll see, let me find this year's. We currently have 522 employees retirees or COBRA members. When we add in their dependents, we have 1,180 belly buttons. So that would include those people plus their
Was that
children and
1,600
spouses.
or just, or
1,180.
plus the,
No,
totally?
total. Belly
Okay, that's the
buttons.
total number.
Yep, 1,180
But it's only
members.
522 employees.
522 throughout the entire county.
So that 1,180 include the children, the spouses?
That's correct.
Right?
And that includes COBRA's retirees and active employees.
Okay, so they're still on that program,
Correct. Yep.
okay. At the cost of 13 million?
Yeah. Yep. Well, actually, it was 9 million in 2024, 25.
This year, 13 million?
No, I don't anticipate it'll be that high. We're currently, total expenses so far this year are net plan costs for 2 months, $925,000.
Yeah, but I can't use 2 months out of 12
Yeah.
in my division, in my head. I'll do the numbers, but it just seems
12 million.
extraordinarily
Yeah.
expensive.
Probably a little less than 12 million. It is expensive. Health insurance is expensive.
Yeah,
We were just talking as we were coming down, Brian and his group are fully insured because they're a smaller group than you are. And their family premium is $4,000? $4,200 for family coverage.
a year.
A month. A month.
A lot of corporations offer insurance. My friend over there knows exactly where I'm at. And I think the payment for a husband and wife, I don't know what it is this year, but my husband's paying $36 a week
Yeah.
and has fabulous coverage.
But that's the employee
Corporate,
portion.
right, that's a corporation.
Yeah.
I
And
understand
every situation is different. Like I said,
I don't know what
I've
they're
got-
paying, so.
I've got a group that charges their employees nothing because they absorb all of the cost.
Right.
I have other groups that their family rate is for
I
employees.
know you
is-
can't compare
yeah,
apples to oranges.
It's really hard.
I understand that.
Yeah.
It's just an enormous amount of numbers in
It
my
is.
head.
It's very expensive.
So are doctors.
Exactly. Exactly.
And getting doctors. I know we haven't, that's the other problem, so we can't even fix that right here. So
Yeah.
I appreciate your information, Sherry. Thank you so much.
Absolutely. Any other questions or anything else I can provide to you?
Good presentation, thank you.
Thank you. Good. Well, thanks, everybody, and I hope to see you all soon.
Thanks for all the hard work. Appreciate it. It's good.
All right. Do we want to do public comment behind each item? Or do we want to wait till the end in case there are people here just for the particular item?
Ken?
We'll go ahead and do public comment on health insurance only. We're going to open up public comments, a 30-minute time period allocated for public comment specific to the health insurance discussion for this one. Each speaker will be allowed up to 3 minutes to address the commission. Speakers should approach podium and identify themselves. Anyone who wish to speak on that?
Can we allow Mr. Bexley longer than 3 minutes?
Sure.
How about just 4?
Yeah. 3.25.
Hey, guys. Tom Bexley, Clerk and Comptroller. Appreciate the presentation by Sherry. Long-time relationship. We've kind of grown up here together. Nice to see you. You guys answered or contemplated, talked about a lot of the things that I wanted to talk about today. The whole idea of economies of scale, though, that's, and Sherry says that that's not necessarily a big deal when the sheriff left our plan, and I understand that, but I think there is an advantage to adding as many people to our population as possible. School board, cities, I mean, the whole idea of consolidation of services has always been a popular topic. Why not contemplate that with our insurance program? You go from 700 participants to 7,000 participants. It's got to help. The sheriff coming back on our plan too just makes sense. It just doesn't feel right with him being off the plan, but you know, he's got to do what he feels is best for his employees. I would never second guess him. A potential legislative question. Why not talk to our legislators about the idea of joining the state's health insurance program? mean, I don't know how the plans compare. I don't know if it's a good or bad idea, but why not ask the question? I know that this has been contemplated by my Clerks Association on behalf of all 67 counties. The state hasn't been too welcoming to do that. Not sure why. Not sure if this is a cash cow or something that costs them money. Who knows? Also, one last thing. We, your constitutional officers, did an internal survey of all of our employees 6 or 8 months ago, I guess, when we were really questioning the value of the current health insurance program based upon that huge increase that we had last year. I want to say it was $2,000, $2,500 per participant, which is sizable. The results were not surprising. This health insurance that you offer is a tremendous benefit to our team members and our employees. I can tell you, if you took it away or changed the benefits or increased the copays, you'd have an all-out riot, not by just my folks, but by everybody. The utilization of the clinic, which I don't personally use, but that's personal choice, is huge to people, especially people with kids. They can just run them over there. It's easy. It doesn't cost them anything. And the idea of this preventative care that Commissioner Richardson was talking about, I can't tell you how important that is. And I'll share something with you, and I'm not pointing fingers or accusing anybody. A couple of years ago, I was diagnosed with cancer, and I don't think that's any big secret. PSAs are recommended for men to start at age 50. At age 53, I hadn't had one yet when I was utilizing the clinic. And I went and had one with a private urologist, and pop, there it was. And I asked the question, and they said, oops, sorry, forgot. The whole idea is great, but if we're not doing it the right way, then it's not doing us any good. So I'm a big proponent for the clinic for that purpose, and I would encourage you to keep that in place. I did the math. $17,000 per employee for an employee only with $100, say, employee contribution a month. That's about $1,550 a month, or about $18,000 a year. That is big. I think we're probably the best plan in the county, and I appreciate you guys supporting this, and I would encourage you to do everything you can to keep this in place. Thanks.
Thanks, Tom.
Thank you.
And don't forget your colonoscopy at 52. And can I add, not all consolidation, I would say, would be helpful. It's dependent upon the experience of the group. And the experience I have with the school board is nobody wanted to consolidate with the school board. They're a higher aged group that is per person more costly, and we don't want to acquire that to our group, and nobody else does. It's just, you have to look at the groups individually to see if they're going to make sense.
Every group has their own diet. You know the word I want to use. Their dynamics, and I don't know where we fit in or where they fit in, and that would be a long-term review and discussion of their costs versus our costs, and putting that together. I think that would be a tough challenge.
You may remember why the sheriff dropped out, and because his cohort, if you will, were younger, better shape, and he felt he could get a better deal. I don't know how it's working out, but in conversations with him, that was the reason he thought he could get a better deal.
I can see that.
Good morning, Mr. Royer.
Yeah, my name is Raymond Royer. I'm the candidate for District 2. Going around doing my petitions, I've talked to some sheriffs on the lower ranks and they're not happy with the sheriff's move. they're paying more with less benefits. So they were very disappointed with the sheriff. And yes, they have a healthy young, but still those young guys are going to get hurt. And then when they have to pay, they're paying more and they'll get less coverage. So I think he should throw that theory out the window and review it. I think it's probably too late for him to get in this year because I'm sure your program has already started. So it would be something that they would have to look out next year. But yeah, but the petitions, the sheriffs, the junior officers and down are not happy with the plan. Thank you.
Thank you. Anyone else wish to speak on this? No? Seeing a closed public comment on this issue. Two takeaways. One is I know of some school board members that have been talking to our local senators and House reps asking about bills that would help them to merge with other school boards for insurance. But there doesn't seem to be a whole lot of willingness to do that. So to help them, because they have the school board has not a favorable plan either. But there seems to be no movement with this set on that. So I do know that's going on because I helped frame some of that argument for that. Then my other it's just a personal takeaway. There is a page which we had presented last year. We've had it presented again for this issue that has the catastrophic claim details. While I know why you give that information, I feel like the first 5 items are with a small population like the county employees are identifiable to who the person is. So if we could just maybe not show that in the future, because I don't know if you guys see age, gender, and their diagnosis. It's just I don't feel it's relevant to the topic, but it's very specific, of what they have, and I don't know if it's necessary. Is it necessary? I just think it's kind of. I know it's not a true, like a HIPAA violation, but I'm just not comfortable with it in there, I guess.
Can I just say on that, they may be able to use those statistics,
Well, it just
right?
needs to be.
As far as what you're measuring, males versus females, or
But not in our public meeting to show I don't
Okay.
know. Well, because a comment was made about someone not taking care of their health, leading to the large claim, and I just don't know if it's relevant to have all this in here. I don't know. So it's just my personal feeling. If you can get away with not putting it in there, I don't know if I'd put it in there, but it's
Yeah, well, just think about it if you were one of them. So it's,
well, I am one of them.
I know, but it's not relevant.
Right.
Their data, they can get that data and share it a different way. It's not
Right.
relevant to us or the public.
okay.
So
Chairman, you made a comment that you had, when the question about the state insurance,
Joining.
you had made a comment that you looked into that. Can you
So
share any of that?
the school board is
Oh, the school board.
Yeah,
Okay.
having issues. It's specific to the
They're
school board.
self-insured.
Yeah, they're self-insured, but I don't think they have the same plan as us. I mean, they don't have as good benefits apparently as we do.
Well, their experience is really not good, so it leads to higher rates. And I mean, it's just an entirely different cohort that has to be treated differently, and they probably have more employees participating, but each one is unique, and they just.
I just think they're just wondering if there's a possibility to go to a fully insured but consortium with different counties. They're looking at, like, is that an option for them?
Well, they do have through the different the school board. I think there's options for them to do that with the small county, like our small county coalition, the different types of trusts that are out there. But I think that's available to them still.
Didn't sound like it, but yeah, so I think that everybody's looking to see if they can partner
So is
up.
that what Mr. Bexley meant when he asked
Well, he
about
was-
the state?
Yeah, his was specific to getting on the state's plan, what
Right.
state insurance,
Right.
the state employees get. Why can't we piggyback onto their plans?
Is there an answer to that?
there is not a true answer to that, so we can find that out. Maybe next week we can ask.
Very good. Thank
To see if there's an appetite for that.
Thank you.
Okay. All right, moving on to Mr. Ringel, joint planning with the city of Palm Coast.
Thank you, HR team.
Good morning, Adam Engel, Growth Management Director. Got a few slides here that just hit the high points of what I had provided in the cover memo. We've got joint planning with the City of Palm Coast right now handled through specific interlocal agreements or broadly through informal coordination. Projects are reviewed by each respective local government, and comments are provided to local government, the local government having jurisdiction over the project. So right now, we got kind of project by project review that's happening through their DRC for projects within our limits, through our TRC for things happening in their limits that they want us to look at. Quarterly coordination meetings are being handled between all local government planners. We started this right around the time we were doing the airport zoning talk, as we wanted to take those interlocals to them, and so we started this just about a year ago. County's draft 2025-2050 comprehensive plan calls for formation of a formal joint planning committee, and the joint planning committee has 3 identified tasks. The first one that address collaborative planning, decision-making, and population projections, public school siting, location extensions of public facilities that are subject to concurrency, and to identify locally unwanted land uses. The second identified objective of the Joint Planning Committee is to develop a coastal resources management plan. And the third identified item for the Joint Planning Committee, prepare a plan for establishing interlocal service boundary agreements, what we call ISBAs, with Bunnell, Flagler Beach, Palm Coast, to help guide annexations, roadway maintenance, utility service delivery, law enforcement, and fire service. And so those are the specific identified items from our comp plan and they show up very quickly in the intergovernmental coordination element that are specific to joint planning committee that's being formed. In our draft comp plan data and analysis, I mentioned this and kind of called this out. Our language that was there talks about you can certainly have more planning that we can do, but the conclusion of our consultant was no additional agreements or coordination efforts are anticipated or needed in the near future. I highlighted that in the staff report. Then you're kind of like, well, okay, so then why do we have that section talking about the Joint Planning Committee? That is the option that they did come back with and put that out and said, look, if you want to do something more, here's where you do that. That gives you an enhanced level of coordination with that Joint Planning Committee. But at their time, at the current time, what we have now, with the joint planning, with the interlocal agreements we have in place, their determination was that we have nothing specifically required either in statute or in our comp plan language itself that means that we have to have additional interlocals. We do have that comp plan objective. It does talk about formal process, and then right below that is where these policies are included for the joint planning committee being formed. We do have work underway now on both a joint planning agreement that would have all of the municipalities along with the county together, parties to the joint planning agreement, and then multiple interlocal service boundary agreements. And you saw my treatment of that in the staff report. The joint planning agreement would be the thing that would handle issues on both sides of the common borders. And then the ISBA would be specific to unincorporated areas adjacent to each of the municipalities where they expect urban services to be extended and where we would expect annexations to occur. So the ISBA to me is that tool, arguably, that would allow for annexations to occur without regard for enclaves. And when you read that ISBA statute, that's what it comes back and says, is it says, look, you can create your own rules within this ISBA area, but primarily the driver there is the provision of urban services by municipality. You anticipate those services to be provided. Then when that happens, that jurisdiction kind of becomes a little cloudier, a little murkier, and those annexations then happen within that, almost with free rein, but at least without any concern raised by the county in the context of, is this appropriate? If additional interlocal agreements right now are necessary, they're particular to specific items, like the animal shelter potentially. We may have that coming up. With that brief item, my cover memo that I've submitted, you've got the drafts of both the JPA and the ISBA, at least specific to City of Palm Coast. Ready for your discussion, any questions you have. And certainly, Mr. Rodriguez, don't want to take any pride of authorship with what I had done with both of those documents. I think the happenstance that we had was that he had done this work in Volusia County, and so the template that I used before we even had him on the radar to hire him was what Volusia County had done with New Smyrna Beach for its ISBA. You certainly have that opinion of the county attorney that I mentioned in the cover memo. Maybe we don't have to have both the JPA and the ISBA. I can also forward to you that I did have a talk with City of Palm Coast staff as recent as last week, and we came back and said maybe there's some attempt that we can make towards consolidation. Simple is always better. So with that, wait any questions in your discussion. Thank you.
Sure, thank you. We'll start with questions. Any questions from?
I'll start. Through the interlocal agreement, right? Let's use the school interlocal agreement that we have. We share a lot of information.
We do.
Not a lot of teeth in that for requirements or anything that I remember. But my question is, I see it mainly only through an interlocal that we do have more leverage to get things done. Because what I've seen with recent
Issues.
yeah, I'll say issues. Thank you. That's a very nice word.
Issues, yeah.
Is we can raise concerns, but if we don't have a willing partner that wants to work with us, they go unheard. So just trying to think of ways that we increase leverage on certain things. We've talked a lot about roads that municipalities are feeding onto maintained roads. And maybe it's issue by issue, I don't know. But I think my only concern is through this process. I think planning is critically important so that we, to the benefit of our residents, we are looking and proactively taking care of issues before they occur. We can look at those things. But from a specific county perspective, we've not had partners either administratively helping us or any of the elected officials. They have a narrow focus for what they want to see done, and we're seen as the bad guy. We're trying to stop it, or we're trying to insert ourselves into something that is not ours. But we were doing it because it affects the unincorporated county. So I'm just trying to see where, as I expressed that verbally, don't know if there's a solution or how we become better partners between it. And maybe it's just that continued dialogue between them. But that's just a 10,000-foot look right now.
Yeah.
No.
That's it.
Okay.
I think I just wanted to get that out there that, is it through the interlocal, is it through the, these other forms of agreements that we are able to better enforce our positions a little bit? Thank you.
I think the ISBA comes close with that because, at least specific to roads, it's got a qualifier. I think 51% of the land area, I think is, maybe I'm quoting it wrong, but that's adjacent to it that would prompt that roadway potentially going to that jurisdiction that has the jurisdiction over the properties adjacent to it. So that, and then I'm thinking too out loud, and again, Mr. Rodriguez can correct me on this. The caution I've got using kind of a Volusia model is that we always got to keep track that Volusia's charter, and then also has that that, was it Volusia Council of Governments, I think is the group. Maybe I'm quoting the group wrong, but there's another layer of coordination that's there that almost has a quasi-land use authority, and that's, even if we did this with this joint planning committee, that's not what we're talking about. We're not talking about a shadow or a second land use authority where you would, there's always hesitation on the part of the elected officials, and I'm not saying it's without cause, where you don't want to convey your authority, your specific authority, to another local government. We're willing to hear what you got to say, but we're going to consider that in due course, and ultimately the decision is ours.
Yeah.
And so it's difficult. I do think the devil's in the details. I do think you can make it as specific as you can, and then if the parties agree to that in that interlocal, or that interlocal service boundary agreement, whatever that instrument is ultimately that's there, I think you can mutually hold your feet to the fire.
And does I guess it doesn't help with, because we still have had trouble getting Volusia County, right, to even work with us on our southern boundary issues, although they've been very good. And I'll call out the Old Kings Road issue, which they've listened, spent plenty of meetings with the appropriate representatives down there, and they, as a single issue, they've listened and worked on it. But can the regional council be a benefit of bringing these, especially in Flagler, since we're a member of the regional council, they do look at it's not DRIs anymore, but large-scale plans they look at and they review. They're part of the commenting, just like the state and the other permitting agencies. But I don't know if that's an umbrella that might bring us together.
Chair, if I could.
Oh, absolutely.
I think that's possible, but I think the other part is, and we've seen that kind of dilution at the regional council level where, because of the statutory changes, they're not doing so much of that anymore. Right. But I think that's something we could certainly talk to them about. And the good part about them is that they don't have one or the other, they have the region as their focus. So they're kind of your impartial arbiter if you needed to have somebody come in. I think there's a possibility there. I like that idea.
All done, thank you.
Carney?
Well, joint committees are not, it's not a new concept. I mean, they're all doing it. Wouldn't be in our comp plan if we didn't have some intention to do something. I think that the county has some expertise that other municipalities may or may not have. I would not consider it that we have more authority, but we have more of a subject matter experts in some of this. We need to express that subject matter experience that we have. If we look at it as, the big what if in the room and we don't try it, we need to expend some energy. There are things out there that I'm becoming very familiar with this past couple of weeks that I didn't realize I would, but there's a water wars ordinance out there that every single municipality in this county has to agree to certain things. And again, we went back with Attorney Hadid and Sean and Attorney Moylan, and we discussed annexation. We discussed how to better look at this. Keeping our eyes shut and not dealing with some issues is to the detriment of our citizens. So there is a happy medium. Joint planning should take place, and it should have taken place 10 years ago. So I'm all for planning. Mm-hmm. Agreements can change. We all know that. Looks like the water wars can't because it's stamped by a judge. So there's a lot of things happening in this county that the other municipalities may or may not know. And I think that we can be a driving force in trying to make it all come together, especially things like fire protection, utility services, even development applications. I mean, we can help with this stuff. So if we extend our hand and we try, I think we're better for it. And I think it will be, once we show our commitment to planning and our commitment to what the county can look like. I ran into a private conversation with somebody who was supposed to be on the agenda tonight, and I stressed some concerns that I had, and she specifically said that I was correct. So there are some things that need to be ironed out, and hopefully we could do that.
Madam Chair, I want to just give you my vision of what I see we have in Flagler County. We're made up of a couple municipalities, not 32 like I'm used to, or 23 of a heavier, bigger community. We, as Flagler County, have the framework. The commission here has the framework for the entire county. We are the entire county, and our interests are for that. Everybody else is players along with us. So I think we have to have a cooperation. They're the puzzle pieces, and we're the framework, is the way I see it. If you can picture it in that big square, and usually you do the puzzle from the outside and then work in. You don't work from the inside working out. So I think we have to have some kind of camaraderie and maybe some, what do you call it, when you do workshops in a joint situation where there's a common thread. And that's how you make peace when everybody has their own agenda. And everybody has to have their own agenda. But it has to have a teamwork set, and I don't think we have that coordination at this point. And maybe that's what we need. I don't know if there's another way to do that or if that's allowed to be done. So I'm going to refer to my counsel about that. But that's one of my visions of how maybe we can make things easier and more comprehensive.
Well, I mean, Adam did allude to there are multiple mechanisms, and I mean, I'm familiar with both. As I said, and Volusia has the model of, now Volusia doesn't have ISBAs with all of their cities. I believe it's, if I recall, we had ISBAs with Ormond Beach, New Smyrna Beach, Edgewater, and Oak Hill. I think those are the ones we had ISBAs. We did not have an ISBA with Daytona Beach, and there was not one with DeLand. DeLand sometimes caused us headaches because DeLand had all sorts of enclaves. Orange City was the other one that caused us all sorts of headaches as well. Yet the county dealt with those cities using other mechanisms. And then I had the experience of working in Orange County, where the Orange County Attorney's Office said, we will never execute an ISBA over our dead bodies. That was their word. Orange County liked to work with their cities through JPAs. So in my experience, City of Apopka had a joint planning agreement with Orange County, which stemmed from part of the Wekiva plan, which was a part of a study done as part of the expansion of State Road 429, and it was an overall study of the area, and that then kind of governed the growth and the cooperation between Orange County and the city. And it did touch on patterns of annexation, patterns of development. The city worked on its land development code based on those agreements, based through the JPA in moving forward. So there was certain cooperation there for roads and for utilities and for law enforcement. In that aspect. So those are two avenues that the counties and the municipalities can work through. So I don't want to call them necessarily mutually exclusive, but I mean, I wouldn't advise doing both a JPA and ISBA because they would both cancel each other out. The ISBA allows you to then kind of work in annexation mechanisms, which a JPA would not. And especially since we're not a charter county, our rules of annexation are going to be strictly limited to what is permissible under state statute. We cannot rewrite our own annexation rules because we do not have a charter to do so. While as an ISBA, because the statute allows annexation rules to be written within an ISBA,
then there can be certain rules and certain mechanisms for annexations within the ISBA that are statutorily allowed and would be consistent even though we are not a charter county. So those are the different mechanisms that we both can use. And you just refreshed my recollection because I had completely forgotten about the Volusia, the VGMC, which is a kind of a regional second level. It's what's called the Volusia Growth Management Commission, which is a second level review made up of both county and municipal for certain projects that have to be reviewed. And these are projects that are really going to affect both the county and municipalities, a lot of them dealing with road issues. I think I remember impact fee issues went to them. Comp plan amendments that were going to have effects on multiple governments would go to VGMC, and there was also opportunities there for the county to levy objections as well as for the city to levy objections before the VGMC. But that commission was established by the county's charter. So it's another added layer of bureaucracy that at least Volusia County had, which would not be available to us. But there are methods of cooperation, and then even if we go on a case-by-case basis with each individual city to handle issues of enclaves, where we can enter into local agreements to handle the annexation of enclaves, and within those agreements, then we can transfer the responsibility and maintenance of roads, any responsibilities of utilities. Those can be handled in those types of agreements. We've done those on a case-by-case basis with cities, and those can be within the scope of those agreements, and those are simple interlocal agreements for the transfer of jurisdiction of enclaves as well as transfer of jurisdiction and maintenance obligations of roads. So there's a whole facet of different mechanisms and tools that we can have for intergovernmental cooperation.
Mr. Rodriguez, was Wekiva, was that an area of critical state concern? Do you remember? I think it is, isn't it?
I think it is. It's because it was both with Orange County, Seminole County, Lake County, I think is also involved in that one too.
We had a bit of talk about that, and there's some legislation's coming up, and so areas of critical state concern also are, think of them as almost, I would probably call them natural DRIs, that they're usually some environmental consideration. You see, I think the first one was the Everglades for the most part, but you have the areas of critical state concern that have a higher level involvement that's kind of baked into them. And the one argument too, I'd also make sure that you remember is that annexation, just as what Mr. Rodriguez had said, we're right now governed very strictly by the statute. ISBA will give us some flexibility there. Otherwise, our ability to comment at this point on those things related to annexations, future land use, and zonings are pretty much restricted just to land use. In the context of the statute, we are restricted now by some changes that have happened in 163, the chapter that specific to comp planning. It says we can only comment on how a proposed amendment is impacted or impacts the adopted county comprehensive plan. And so that's the extent of it, and so we are in a little bit of a different situation where we've been able to make comments on both Bunnell and Flagler Beach because we're fire EMS provider, respectively. And so we've had some ability there. Also, those roadway impacts, certainly, that we've talked about, where our county roads are impacted directly by those developments. But that's a little bit beyond the statutory extent of the narrow focus that's in 163 now on our ability to comment. We're pretty much restricted. Our hands are tied, effectively, to comp plan issues. The agreements we're talking about now will broaden that scope.
Did you want to speak before?
Yeah, after looking through all this, I don't think we need a joint planning agreement. I do think we need an interlocal service boundary agreement, but that has to be based on the law. And we have the judge's decision in the Water Wars event as the starting point, and that should be the map. Palm Coast has already violated it by drawing their own map, which does not conform with what the judge said. So I think we have to go back to what the law is on boundaries and who does what services are provided. So that would be the place to start with an ISBA and go back to what the judge said, because that's law. and then use that as the start.
Madam Chair. Talking to city staff, I think what we'd like to do, and we had a map we gave them, you saw the draft map. It didn't have to be as extensive as that. The area that they're talking about, of course, their focus now is Palm Coast 2.0. And so a good part about it is we're also very concerned about the old brick road right-of-way. And so, my thought, and we were talking about singularly an interlocal for Old Brick Road, we may want to still stick with that. But the city's identified utility extensions that are happening in that area. And so that may be, a good ripe candidate for an ISBA.
Right.
Of maybe inclusive of impacts to Old Brick Road, but maybe not. Maybe we still keep that separate just out of simplicity's sake and because of timing. That's been critical for us. We've been trying to work through that.
I think the ISBA that's of this
Makes sense.
stuff, that's what makes sense to do,
Yes,
to
sir.
start with that. Yeah.
So I guess that was some of my questions, was actually using the Old Brick Road as an example. Because in here, it gives the MSA transfers, it to the city's jurisdiction, the way it's worded, right? But does that, if they annex in 51%, right?
Right. Yes, ma'am.
And so how does something like that, what if it's a road we don't want to?
It could, as we're discussing now, and I think under Mr. Rodriguez's guidance there is that, and when we talked to the city staff last week, that we knew there was no quick cookie cutter. Each one of these, I think we have a base document, and if we have to then be specific, I think just as easy as saying comma, but excluding the Old Brick Road right away. Or
Are they going to
if
look
we-
at this document and say, well, we have rights to the roadway because it's explicit in our agreement that we get the roadway if we annex in 51% or more?
It doesn't have to necessarily tie to that, and is where I'm heading with that. And so we could, that specific ISBA could exclude or could include right-of-ways, could have a different number than 51%. Could have the turnover happen of the Old Brick Road, provided that we have enough conditions on there. We're talking about buffering right now. Some limitations on the number of crossings that will happen. So if there's sufficient considerations that are put into there on the Old Brick Road, maybe in the end, we don't mind if it is transferred to the city. By the time we get done with landscape buffers adjacent to it, restrictions on the number of crossings, it may be additional protections that are placed on it that would make it where ownership becomes moot.
So I'll ask also, where are we with having something like this with Bunnell?
The template's there, and so the haven't had any specific discussions with their staff. So far, it's only been City of Palm Coast staff that have reviewed these documents and had that meeting as recent as last week with them, following the county attorney's office comments on these two drafts. We will talk about it towards the end of this month. I think that's when our next joint planners meeting is going to be held. We're holding that quarterly, and so it's going to be towards the end of this month, and we expect to talk about it then.
So I just want to go back to Mr. Rodriguez. This doesn't bind us to turn over roads if we do these agreements, or, I mean, the way it's worded talks about transfer of jurisdiction, the permanent transfer within the JPA of a road maintenance from the county to the city shall occur as follows. And it says county roads within or adjacent to the existing city boundary shall become roads under the city's jurisdiction and maintenance responsibility when at least 51% of the road segment is either within or adjacent to the existing city.
Right, so it's when those conditions are met.
So, well, so I guess that's what I'm saying is,
If we're specific to,
is it,
if we don't call out Old Brick Road, and we had one in place for an ISBA for that area, and that threshold is met, then the obligation would be on the county to
so
transfer it to
it'll
the
be
city.
there forever that every future planning group and board would have to specifically call out areas of interest that you don't want to, right?
Well, or it would come down to, what other jurisdictions we've done is if you then it would require our comprehensive plan to then identify a certain road as a county thoroughfare or a county right-of-way, and therefore then that is our road. And the only way then you can have a proper transfer of that road would be through the conveyance as pursuant to statute, which is then kind of, it's almost like the road is deeded as part of an agreement. So we would then exclude, that would not be covered under that section, or we would then explicitly exclude that road or exclude that thoroughfare. Well, no, we would designate it as a thoroughfare, therefore it would not be, you wouldn't classify it as a collector or a local road. So it would have local roads would be transferred if the properties adjacent to the local road, if 51% or more of the properties adjacent to the local road have been annexed into the city. We could classify the roads into which one of those roads would be transferred into the city when you have the surrounding areas, and exclude thoroughfare roads or exclude certain roads if we do not wish for them to be transferred to city obligations. But then it would be a determination for you with whether we want to continue to maintain certain roads or we want to give up some of those roads to the cities.
That brings up a concept that Volusia does have unique, and when we talk about the impact fees, we are still bringing back some estimates on what that impact fee study will look like. We're going to bring those back to you. But reworking a transportation impact fee schedule to include potentially county thoroughfare roads. Volusia has that. They have a thoroughfare road impact fee that I think for the most part is collected on just about every project in one of the municipalities that happens there. And so that's something that is unique, at least locally to Volusia. Could be something we have, and you can kind of pick out those potential thoroughfare roads if we started talking about them. And that would be, again, something that would be handled through an interlocal with the cities, potentially to collect that on behalf of the county and remit that to the county to reimburse us for impacts to those identified thoroughfare roads. And those I'd say would be those you'd call out, either specifically within an ISBA or otherwise in your plan that says these are unique to the county. We're not intending for them to ever become a city road, but maybe you do have some provision that if the state wants to come in and take them over, maybe you'll let the state do it.
Right, but if we identify that, we would identify those in the comprehensive plan, because for a practical example, like as I said, we did not have ISBAs with Daytona Beach, and even the Ormond Beach ISBA was solely limited to the US 1 corridor. So, but Volusia had any development that, and the biggest headache, because I felt like I spent 60% of my time reviewing and revising impact fee agreements and prop share agreements with construction on LPGA Boulevard. LPGA Boulevard's a county road, but the majority of the development that was occurring in Daytona Beach and Ormond Beach to the west was along LPGA Boulevard. Every single one of those developments, even though they were being reviewed and approved by the city of Daytona Beach or the city of Ormond Beach, also required those developers to enter into proportionate fair share agreements if they were going to do so, or impact fee credit agreements if they were going to provide those with the county. So you had impact fee agreements that were tri-party impact fee agreements between the county, the cities, and the developers for those roads, because they were covering our thoroughfare road, which was LPGA and I think Tournament Road. There's a few of those offshoots if you drive up LPGA when it goes west of I-95 and curves down and meets up with US 92. That's a county thoroughfare road, which is probably subject to multiple impact fee agreements.
Is that why it's 2 lanes?
It's still 2 lanes, and that
That's
choke
correct.
point over the Tomoka River is the source of many a headache.
Very well. Yes. Okay.
Bridges are not cheap.
So that could happen under those circumstances.
If you have, if we, because that was one of the things I asked you, is if we actually had certain county roads, especially in the thought of the future, the loop up to the TARP, like for just speaking hypothetically, where the Magellan project would be, that loop. If that were theoretically a county road, then we would be able to collect impact fees on that road on projects that were located within the city in order to cover the impacts on the development on that county road.
Traffic impact.
And those developers would then have to not only enter into whatever agreements they would have with the city as part of any impact fees, but those agreements would also have to be entered with the county in order to cover the impact fees for thoroughfare roads.
Real specific question. in specifically the one with Palm Coast, talks about stormwater, talks about solid waste. There's no mention of reclaimed. Do they not have an internal reclaimed water system?
They do. I don't think it's available in all areas, but it's something, I mean, if they came back and edited it and came back and said, no, we want provisions for that, we'd add it in.
Yeah, they have in certain areas.
Yeah, okay.
And it's always good. I always, want to err on the side of caution. Even though it's not there today, could be there tomorrow, better to write it in there.
And then in Bunnell, this is just a, I wasn't here question. Why is there so many holes in Bunnell that are part of Flagler County, but is this just to avoid Bunnell city tax?
No. So in the beginning. As I understand my story, and at least the history as I believe it to be, that there were the two large annexations, one happening 405 and the other one closer, I think, 2010, but don't quote me on that second one. And they were pretty much directed by the large landowners in Bunnell who were upset that the county had still conservation areas over wide swaths of their land that had no density. And so that what I understood Bunnell had offered, and more specifically now they've finalized that and made it in their comp plan, where they don't have a zero density conservation, as I understand it. But that was what the offer was to the landowners, and so that's why you had big pieces with smaller pieces kind of patchwork through that never annexed, because those folks didn't necessarily want the increase in their taxes to the city. It was an offer that was made to those large landowners that was, our lowest density that we offered was one dwelling unit per 5 acres. And those, when you think about it, farmers are land rich. And at the time we were coming in, 04, 05, you could see all the development happening on the east side, and the west side was, for the most part, excluded. And so I believe those landowners looked at it and said, we want to get our piece of this before it's done. And then the bubble hit, and the rest is history, I suppose.
But that doesn't, those aren't enclaves.
They are.
They are. No one
So
stopped
do
it.
we provide the trash service to these little landowners or little big landowners, or does Bunnell?
Short answer, yes. We do provide them as best we can. And we made a couple of jokes about that. Depends on the color of your trash can. That's not
Right.
really correct, but that's.
Okay.
And then the other side of it is, would the cans not get picked up if they're put out curbside? We do have a pretty good handle on those, and we've been working with property appraiser. We have a list. It's not the most efficient, but it is there.
Wow, okay.
Law enforcement was always the harder one that we always talked about. Would you call Bunnell then if you had an issue? Would Bunnell PD respond out off of 305 to address a concern happening on Bunnell property?
Well, the bigger question is, has something happened between 04 and 05 and now that this should be readdressed? I mean,
Not the enclaves themselves. It's still looking for an owner to consent to the annexation into the city. If you remember, we even had some de-annexations that have happened out of the city.
I saw that, yeah.
And so those have been probably just as patchwork as those enclaves were. And we made a decision. I was here for kind of the tail end of the first one and definitely here for the second one. The board at the time made the decision not to contest the annexation. There was a lot of discussion about it. There was a lot of discussion, but there was a decision then not to contest that annexation, and then just to kind of go with the flow, and that the expectation, I believe, was the enclaves would hopefully annex in the future as services extend outward. Optimism.
Coulda, shoulda, yeah.
Coulda, shoulda, yes.
Okay. This is one of my pet peeves, so I don't know where we agreement where this comes up, but where we have unincorporated land entirely surrounded by a city or adjacencies. So we'll utilize the Highway 100 corridor as the other example. Is there an agreement that can be? See, my concern is that we act as the permitting agency which is then quickly followed by annexation. And because of our different land development codes, we have different set of standards. And I see a problem where somebody comes in and develops through our process, which is, and I'll be honest, is not as thoughtful as the city of Palm Coast. It's not as, there are a lot of details, and I can, we've gone around about the lighting. You can drive down 100 and you can tell which was permitted through the city and through the unincorporated just by looking at the parking lot lights. So how do we address, especially ones that are an enclave, where they're gonna, because of, and not because of utilities, it's not mandated, but that they're going to annex in, and it becomes, a different set of standards than if they're developed under a different set of standards. How do we proactively, is it overlay districts? Is it an interlocal agreement with the city on how to handle these? I know property owners have rights and they can, but we don't have to, especially if it's an amendment, a land use amendment, we don't have to approve it. So I don't know exactly where it goes from there. I have a heartburn with that process because we have two distinctly different land development codes, and it doesn't promote uniformity.
Don't talk too bad about our code, because the other part
We're
about
getting there. We're
Well,
gonna address it. So I'm very.
The other thing to remember is that we were the permitting authority for Palm Coast before Palm Coast was Palm
Right.
Coast. We were the Palm Coast Service District, so that, like it or not, blame us or not, we developed the Walmart, which was the second Walmart.
Well,
I
the
think, in town.
Walgreens is the other famous one, the one on the other side.
Sure, sure.
But it's when they
Good or
adopted, they had basically adopted Ormond Beach's land development code, especially for landscape and other things, and that's when it became obvious the difference between the two codes.
And I'll still counter also that, typically what you'll see with the county, the distinction you're going to have with the county's not going to have that kind of urban type stuff.
Right.
You want to drive that annexation so that if you want the parking lot lighting and the higher density development, you're going to drive it into the cities. And so that's part of the reason why you want separate but equal. Do we want to adopt the same thing? No, we probably want to be unique. I'd also tell you then in the 2015 interlocal agreement that we had, and I think that was in place when we did the Flagler Pines Airport Industrial. If y'all remember when that PUD came in, a little unique, a lot of pain on our end, we ended up adopting the city's gateway requirements for State Road 100 into the PUD. And so it was a lot of review by the city. It was something the city was very concerned about, the aesthetics. And so that was built into that. That later became cornerstone. Some of that got lost in translation as we moved forward. But those gateway requirements were something the city was very stringent on. We were doing that particular development. That 2015 interlocal pretty much is just restricted to that parcel south of 100, Belterre Boulevard, Seminole Woods, down to Iroquois Canal, I think is where the south end is. And so that's the extent of that area. But that's an area that's under, I'd say probably calling that out, that's hyper review that happens within that with the city, because there's an expectation those are going to annex. But I think that may be the model for something like that, where you put the devil in the details.
Is it an overlay district? Is it part of the land development code? Is it, we identify corridors and mainly just worry about corridors that are aesthetic?
I'd probably rather see them in specific interlocals. That you could do an overlay if you wanted to adopt those protections in the unincorporated, similar to the city's requirements. We could do it that way, but I'd probably rather see an interlocal that spells out we're going to take it this far, and then it annexes and finishes its development.
Or, I like the overlay because we know what's going to annex to what, probably, right? But I don't know if this is I don't know, for lack of a better word, Bert Harris or whatever, to enforce when we do these things, and we know they're coming up at times, can't we have like a, if we do an approval, like in perpetuity, like can't be changed regardless of annexation, and they have to get a letter from the other municipality that agrees to accept our recommendations, and they won't change it. I mean, I don't, you know what I'm saying, like a pre-existing annexation agreement is required, where we'll use the one in Flagler Beach, right, which is you may at some point consider to annex into a municipality that you touch upon. Therefore, we require, our approval is subject to no changes in density, or is that a thing? Is that a thing? It's not allowed? Like, we can't change it on
I
this?
think I'll jump in and so he can
Yeah.
correct me when I get it wrong, but I think my idea would be that mind what I'm saying, an interlocal agreement that I'm talking about would be very specific to an area. So I wouldn't say an overlay, I'd say an interlocal specific. And then you can run it as far as until your county attorney tells you strayed too far. What if we could be a party to a pre-annexation? You know, maybe we could specify that in interlocal, that between the developer, the annexing municipality, and the county, just so we all know the details. Stranger things have happened, I'm sure.
Right. Or in theory, I think I've seen other jurisdictions where you do create a gateway overlay. So you identify certain roads and properties on those roads where the intent is these are roads that are going to lead into certain cities that have certain aesthetics, so that you want that to be a consistent appearance. So therefore now your land development code, so you'll develop under your current zoning, but now properties located within this area, so we can call it the State Road 100 Gateway, have then these additional requirements that have to meet, which then can be consistent with the requirements of the city. So any new development from the point of adoption of that gateway district forward, they will be consistent. So either they can remain in the county, but have a consistent appearance throughout this gateway, throughout this road, so that it would look consistent with the development in the city. So you don't have that abrupt, county appearance, city appearance. Or eventually they will annex into the city and there will be a consistent appearance, because they could probably develop forward with our appearances, annex into the city, and remain, because they'll just be grandfathered in with what they were approved here. That's an option, I think, because I'm trying to remember places I've been. Down in South Florida, there are cities that have gateway areas where, even though you're in an unincorporated area, for some reason, Royal Palm Beach is one that's sticking in my head. And Wellington, I think, also, probably. I didn't do much in Broward. In Palm Beach, Wellington has a gateway, and Royal Palm have gateways where you had to, even in unincorporated Palm Beach, you had to develop consistent with their colors, consistent with their lighting, because it was deemed a gateway area.
County was part of that, though, right?
Yeah, but it was county zoning, so that was deemed like it was just a corridor. You either call it a corridor, the corridor gateway. So you identify certain areas where you have an urban feel, so that you have an area of consistent development, and then it's just part of our land development code that we would amend to create that consistency. If the ultimate goal is to have a consistent appearance and not that staggered difference in appearance.
It would be deemed more restrictive, so we have to get past 180.
Yes, we have to.
So, Lake County's doing a rural boundary charter amendment. Have you seen that? So what they're doing there is they're drawing lines, saying this is a rural boundary. We want this to the quality, the open space. I had saved this, and the Lake County municipalities are discussing a no annexation zones within those rural areas and tools to manage where that growth happens, so that they can preserve rural lands. I guess it goes to the ballot, like a referendum to decide, but it basically lets people say, we agree to this rural boundary where no annexation can take place.
It won't happen for us because no charter, but at least not
no
yet.
charter, right?
But the one thought I had, and that's
like
one of
all
the
the
things that
charter-
I've emphasized so far when we've talked with planer level,
Yeah.
is that I've said that we and our comp plan specifies this. Any of these ISPAs, JPAs, whatever we come up with, are going to, in our eyes, set that boundary limit on the west end. And so that was our goal out of this is through the span of our plan, 2050, the intent would be that if you're going beyond that, you better have a darn good reason for us to then go beyond that. It won't necessarily be restricted. I'd love for it to be that way, but knowing that there's always one-offs that happen.
Like you've got,
We want to preserve that ag area.
you have SB 180, you have Live Local, right? Now you have SB 208, which is moving through, and it looks promising for the state. And that one is up to 100 acres, doesn't even have to go through a rezone or a planning review board. So any developer can come in up to 100 acres and put in a big development without even coming to the boards. How do you get around these new state laws so that you can protect the quality of life?
And Lake is a constitutional county, not a charter
They
county.
are, okay. So how are they doing a charter
Well,
amendment?
they're going to do an amendment, and they're going to do a rural boundary.
I'm just
amendment,
saying
put it
that
out
so
on a
we
referendum.
can
No, it
They're
would be.
going
look
to
into
put it
it.
on a referendum.
That would probably be in their comp plan, because that would be similar to, Martin County is not a charter county yet. Martin County down there, we had what was called an urban service boundary. So there was a certain line in the county that was established. And a lot of the South Florida counties have these urban service boundaries where a line is, you have this line drawn where west of that line, usually the agreement is that there will be no utilities, there'll be no utilities provided. Your density is usually 1 unit at 10 acres. It's very low density. And that, in order for that line to be moved, it's usually done by referenda. There's either a referendum, there's usually a lot of, Dade County has had battles over the moving of that line. Broward's is pretty set in stone because it's the Everglades. Palm Beach has one also, so that's probably what Lake County is doing. Seminole has one, I don't know if theirs is by charter, but Seminole's has gone to litigation and they have prevailed. They have sustained their rural area where they're adamant about keeping that county rural area separate from where you can have urban development and then the rural area is separate. And theirs just recently was upheld in litigation.
And our 2000 comp plan, just for purposes of the record, set our urban service boundary as a railroad tracks.
Yeah.
And so that was, if you go back in the Wayback Machine, that was our extent, considered, that was back when before Palm Coast existed, the extent of ITT utilities were going to run up to the railroad tracks and nothing west.
But Bunnell's killed the
also.
idea of us
Jupiter, too.
doing a urban service boundary.
Exactly. Yep.
I mean,
Well, I don't want to call out specific landowners, but there is quite a bit still left in unincorporated county that we could, it's maybe not a huge boundary, but it's something. I don't know.
well, there's no uniformity.
If we don't get ahead of this, between what the state is doing, you can have as many interlocal, joint planning, whatever you'd like, but if the state trumps us, doesn't matter, But if you get something like through boundary, like through referendum, right? Can they trump that? I don't know.
Good question.
Because I don't think they can. If you do a rural boundary charter amendment, we don't have a lot left, unfortunately, because of what Bunnell's done. But there's some of it out. I mean, you have Flagler Estates. You have I don't want to call them out specifically, but we have several very large landowners left out there.
Yeah.
I don't know. I just keep reading these, and, Live Local, it hasn't impacted us as much, but between that and now this new one bothers me a lot because there's a lot of pockets of under 100 acres that wouldn't come in front of us. Could be developed any way it'd like to be developed.
If I could come back and synopsize, I think where we're at. JPA, no. ISBA's, yes. We make them specific. We don't have to use that boilerplate language. Potentially in the impact fees, pursue thoroughfare road designation. And so that we can call those out in the comprehensive plan and then also and then any subsequent ISBA. Depending on how Senate Bill 180 shakes out, pursue quarter overlays where those are out and those are possible. Look at that Lake County example for what they're talking about, charter or not, however they're doing it, and referendum or not. Maybe that we can work with, probably with Bunnell directly and Palm Coast on setting that westward boundary. If we could come up with that, I think that's key for us on our side to try to develop a line that is that preservation line for us, that west of that, we're hoping that that's going to stay in agriculture production. East of that, the annexations and service delivery from the cities could happen. But that's something that I think is still very important to us. Have I hit everything that I needed to?
Yeah, I just want to keep in mind, there's always going to be trends
Yes, ma'am.
in development that I've watched through my whole life. And it usually runs with financial times. So we're not necessarily in peril with an emergency need necessarily, because things change, the waves and things change constantly. So we can protect and plan and do all that, but there will always be new changes, new waves, new directions from the state as well as from our constituents. I think it's hard to just say, this is it, this is the way it's going to be, and it's never going to change. We were seeing it happening all the time. And sometimes changes may be better. Sometimes they may be worse. And we're there to protect what's for the best, for the greater good. That's all I can say. I think we've gone way too deep into this at this point. And I understand that your compassion is there, mine compassion is there too. Some things will never change. And that's sort of like a lot of the ownership of who's in charge of it. Who owns it? That turns out.
Yeah, but I
too.
disagree with that, because if you're trying to solve all these problems like roadways, water capacity, all the issues, you have got to be able to manage the growth. And it's becoming almost impractical between what the state's doing for the county to keep up with it, and every municipality around us.
Yes, ma'am.
And that's all we hear is manage the growth, there's got to be some sort of solid solution here that allows, very smart growth, because that's not happened in years, smart growth. Yeah. So, and that's what we need to protect and discuss, is how do we protect local boards so that they still can weigh in on development. At this point, it's almost just staying one step ahead of the state. And how do we do that? And we've got to really we've got to see what the other municipalities are doing, because they're now in the double digits over what we have in population, and they have real problems from it, and they're trying to get their, how do I get around this? How do I get around that? And it's every day some other municipality that's way ahead of where we're at in terms of development is they're suffocating. And then you have the state that also wants to take away your ability to tax, right? And you're like, well, this doesn't work.
I think you get the one point I tried to emphasize in this also was that this is interlocal, and it's always going to require two parties at least. Right. And so you're going to need to get some agreement. You're going to need to, in those workshops, in those joint efforts with your peers, you're going to need to be working on that consensus. Well said.
So do we, sorry, Mr. Dance is away, but do you have firm takeaways from us?
I believe so, yes, ma'am.
Do you feel for now to talk about later? Does anybody have anything else they'd like to discuss? And if not, I'll go to public comment on this matter for a minute. We'll open up public comment on item 5, joint planning with the City of Palm Coast discussion. This is a 30-minute time period allocated for public comment. Each speaker allowed up to 3 minutes to address the commission, and you should approach the podium and identify yourself.
I'm Steve Davis. I live in Painters Hill on the ocean. The discussion of joint planning with Palm Coast in particular needs to carefully include beach management in addition to everything you've already discussed, which is very important, very intricate, very difficult. Palm Coast is the elephant in the room in terms of political influence over many of these things. The beach management plan so far has focused on the unincorporated portions of Reach 2, all of Reach 3 and all of Reach 4 in the northern end of the barrier island. Eventually it'll wind up being 18 miles, but the benefit from doing a proper beach management plan and proper beach management, including dune restoration, beach restoration, seabed restoration, is not only to the barrier island, but also to Palm Coast, precluding the possibility of dune removal and inundation across the northern end of the barrier island into Section C is a dramatic benefit, important benefit to Palm Coast. They cannot act as if they're uninterested. I know the interlocal agreements have developed some participation from Palm Coast, but in addition to the simple beach management issues, this needs to extend into compound flooding. This needs to and would naturally extend into the Back Bay study for the Corps of Engineers 4x4 study that's upcoming. All of the lower coastal basin, everything east of Old Kings Road, the lower area of the county, is being impacted by stormwater being discharged from Palm Coast. Palm Coast was designed originally as if the capacity of the lower coastal basin was infinite. The capacity's been reached. All of the work going forward needs to take into account the stormwater discharge into the lower coastal basin, storm surge into the ICW. It's a very complex issue, and the relationship between Flagler County and Palm Coast runs through all of it.
Yes, sir.
Raymond Royer. Once again, been doing my petitions, and this topic has been discussed all the way up from the south side to the north side of the Peninsula Island. And I think what you need to do is, a couple times I've heard it from the citizens, the word Flagler strong seems to be thrown out there lightly. And somehow we have to come together, because when I hear that word, it means being united. And for some reason, we're all divided. And, we have the west side, we have the east side, we have, the north side with issues. Somehow we have to come collaborate together. I was in Kim's district, getting petitions signed, and, they have flood issues in those districts. Going on for 15, 20 years and still not resolved. We've got county issues where I was up in the north section, District 2, and the roads need drainage. Some roads had drainage put in, but now they're not maintaining it. The county says they're not maintaining it. It's your responsibility. And the homeowners are like, well, we don't have the equipment to take care of the ditches. So I think what we need to do is really, and Adam's got a tough job. That whole department, planning and development, has a very tough job to try to bring this to the fruit of what it is, and again become Flagler strong. Just like we had the meeting last month, Andy, with the wetlands, we have to come up with a comprehensive plan for wetlands to conserve these wetlands, but for some reason we don't pay any attention to them until it's too late, and then now we're going to pay top dollar for these lands to conserve them, and we don't have that type of money. We can't pay development price per acre It's just crazy. So that's where planning and development have to come in and get more comprehensive planning going on there. And again, we don't even have a comprehension plan for our district, for this state. I mean, our bookends have them. St. Augustine, St. Augustine and Volusia has their comprehension plan for salmon replenishment, and we're still trying to work on that. I appreciate the board here. The board has been given a lot of the word history. The history is horrible. There was a lot of, the way I look at it, 50, 60 years ago, there was a lot of Wild West stuff going on. So my time's out, but you got it. Flagler strong. You got to get this word to become united. Thank you.
Thank you.
Incorporated.
David Eckert, Cali del Sur. I see a lot of frustration at the board level here, and I guess I'm confused a little bit about it because when the state is frustrated and wants to manage an area, they create programs and authorities to be able to do that, and you have those same paths forward. And I don't know why you're not doing it. So if the state had not created the DRI program, they didn't have the authority to come in and say that these have development of regional impact. So when you say you can't violate the state statutes, no, you can write local ordinances relative to areas that have specific issues, roads, stormwater, shoreline, and you're not doing it. So I'm a little bit confused by why you say you're straitjacketed into some things that you want to do, because the impetus to do some of the things that you're talking about are right for our county, but you say you're limited. So as Commissioner Hanson talked about the limitations to the water agreements that started, that has to do with potable water and other types of things like that. But on stormwater and other issues, you have the right to say, I'm going to create an area of development that has an issue with it, whether it's stormwater or whether it's roads or whatever it is, and you can then create permitting and other oversight responsibilities over the cities, and you're not doing it. So I guess I'd urge you to take the expertise of Adam, the development department under ITT essentially is what you were doing when a lot of this would develop. And the city or the county is growing to the point where it's going to have to referee, but you got to do it for legal documents. We've got a bunch of half-written interlocal agreements that don't serve any purpose because they're not clear. So take the step to regulate the county the way that you need to do across the cities by doing DRI or areas of critical county concern or something like that, and exercise your authority.
Good morning, Mr. Tanner.
Madam Chairman, board members, John Tanner, an attorney. I represent the nonprofit Preserve Flagler Beach and Beulah Creek, Inc., and I'm here on their behalf. But also as a citizen of the county, I probably have a few personal comments. First of all, the Water Wars Agreement is just integrated. It's part of the law here. It has it's been institutionalized. Judge Zambrano certainly made it clear. He made it his order and said that it survives in perpetuity, in effect, and is quite enforceable. Actually, he opened the door for this county to protect what the Water Wars Agreement was meant to protect. And it actually invited the county, or the parties for that matter, any party, to bring legal action if necessary to enforce the agreement, because the agreement was sound, and certainly it's not perfect, but it's a well-drafted, very easy to understand document. I'm not going to read it to you, but I know I only have 3 minutes, and we'll probably be back this afternoon, and I think there are a couple things we're really concerned about. There's a lot of unanswered questions. This Summertown movement that is going on right now is just the tip of the iceberg. We have Veranda Bay just a couple weeks behind. So what we have is really a development of regional impact. It's not entitled to expedited review, which is where they are right now. It's almost no review. And we're contesting that. We're hoping the county will contest that and go back to the point where we get the type of review that a large development, which is all of Veranda Bay and all of Summertown, it's really impossible to, just because they have different names or different owners, this is all one development, it has been all along, and needs to be treated that way, and needs to be thoroughly evaluated. There are a lot of unanswered questions the county has, a lot of unanswered questions the citizens have. A simple one, the Water Wars Agreement requires the developer to build a reclaimed water treatment plant. There's no mention of that in any of the documents except the Water Wars Agreement. There's no indication of what that's going to cost. We know that one time the city has set aside $47 million towards what we're not sure, but it probably is that plant, but we don't know that. And the city is now going to perhaps undertake that debt. They've borrowed $57 million. It's going to tax the citizens of Flagler Beach around $3 million a year for 20 years. That's a significant impact on their pocketbooks, let alone what's going to happen. The character of John Anderson Highway, as it exists, will be literally destroyed. It will no longer be the scenic roadway, which is a state designation. That piece of property also deals with, as you know, the Flagler Greenway. It deals with the State Blueway. It's ESL, environmentally sensitive land. We all know that. This has not been treated like what it is. This development, if it goes forward, under either or both of those names, will radically, forever, and irreparably change the character and nature of John Anderson Highway and the rural characteristics of that property. I'll see you again this afternoon, and thank you very much for your time. Again, thank you for doing what you do, and God bless you.
Thank you, Mr. Cantor. Any other comments on this topic? So,
Thank you.
I think we should just talk just a little bit more on this topic for just a minute. Because are we really clear with the takeaways? Do you have any thoughts? Because, I wonder if this is going to be sufficient. I guess that's what I'm saying. Do you feel this is sufficient?
What do you mean by?
So on this is beginning because I have a lot of unincorporated out in my area, and I mean, there's a great concern about Bunnell and their plans, and I noticed that, I'm just going to talk just kind of high level. So it seems all the municipalities look to the unincorporated to do the conservation efforts. I don't see local municipalities planning conservation. They look at unincorporated county to do the conservation work for them. Theirs is simply growth. Palm Coast doesn't say let's conserve X amount. Flagler Beach certainly doesn't say let's conserve X amount, and Bunnell doesn't appear to say let's conserve X amount. They just don't. They're revenue makers. They're doing whatever they do in terms of growth. Everyone looks to us to do that work. We don't do as much development because we don't have the utility, and we know that everything that comes in front of us is bound to either have to make a utility agreement or annex into another municipality. Whereas when it goes into the other municipality, they suddenly take over and change the parameters of the density. And suddenly a beautiful unincorporated area who thought they'd be rural is no longer rural. I think if we're out talking to constituents, they're all begging this board, because we're reasonable, rational people in the locals, they're begging us to put boundaries out here, because you have to plan 30 years in advance today. So you're looking at other counties who are larger than us, double, triple. We are hearing about the issues with the aquifer. Nobody seems to want to talk about it, but there are issues with the aquifer, particularly in Central Florida, and we're in the bucket if you read those studies. There are issues with how much water these St. John's can hold, how much the intercoastal can hold, how much it can take in. We know it gives us stormwater grief out west now. How do we, before we get new commissioners and they have their own ideas or they have their own people that they respond to, how do we each take care of, how do we take care of the hammock to ensure that they are going to have the look and feel of the hammock forevermore, you know, like the thing that matters to them? How do we take what's left in the unincorporated county and how do we place rural protective areas so that they don't have to wake up and worry about, you know, I heard it at the Bunnell meeting, and Mr. Dance, I know you heard it there too. Only 3 residents of the city Bunnell came to speak about the issue, but the other 50 for unincorporated county because they live behind where the developments are coming. And we can't even protect our unincorporated county people from something they never anticipated waking up to do. How do we staff, how do you get us there? How do we make the legal agreements? How do we make the boundaries? We're a board that keeps telling you we want to, you know, protect our unincorporated, we want to protect what's left, because we apparently are going to be the only municipality or board that's going to do that. How do we get there? How do you help us get there? Is this sufficient? Are overlays going to do it? Are rural protective areas going to do it? How do we protect what's left of unincorporated? Because I think we're going to find that we're going to be the only municipality to do it. We're going to be the only group that's going to end up doing it. And there's not a whole lot left of it, because a lot of it's annexed in like Swiss trees. We actually talked about, someone brought up annexing in an enclave. We're not supposed to do that. It shouldn't even be a discussion that comes up here. It should be stopped at the counter out there. We don't do enclaves. Thanks for coming. You know, let's fight have legal look at that. But how do we do that? Because I think that we're a board that's like sick and tired of seeing things radically change for unincorporated residents who thought that they had a lifestyle, or filling in wetlands or building on floodplains. I think we're tired of it. How do we protect what's left?
I think the discussion today is good step in that direction. Tools in the toolbox, the adding in the ISBAs, for talking about corridors, that we can rural protection zones. Again, reinstating an urban service boundary to the extent that we can do that unilaterally. But knowing that interlocals are, you're going to need to get a partner. And the other thing, the big hesitation I have now in Senate Bill 180, don't mistake it, it's just the most recent. Yeah. We've had a dilution of land use authority over the last 20, 25 years. We were one of the preeminent states when we first adopted the original ELMS back in '85, and we all scrambled and adopted our comp plans because we had to. We really have gone a long way. Those few of us natives, look back and Bob Graham, he put a lot of this stuff in when he was governor, had a lot of emphasis on environmental areas and putting things where they needed to go, growth, development where it belongs. You may have heard me talk about this before, and I can tell you the technical side. For me, if I look and relying on GIS, that wetland, that flood zone, that poor soils, we can put that overlay together and say, those spots where we have 3 of those together, that doesn't make sense for us to develop. We can come back and we can answer those. We can, and back to your question too. It's why aren't the cities doing this? For the most part, probably they don't have much land area, but there are land areas that are there within their boundaries. I called out at the Flagler Beach meeting that they've got a specific policy that says that, and paraphrasing it wrongly, but that they will pursue acquisition through Florida Forever and similar programs of floodplain areas that are appropriate for preservation. So they've got a policy that says that in their plan. It's 180 again, just the most recent of those. I'm not sure if we picked the right time to do this, but maybe that's the time is just for us to, if we don't act, we'll look back later and say we coulda, shoulda.
Right. I'm putting my 50-year hat on, and I'm saying, how do we do that now?
Well, we have the flood studies, we have stuff to back us up, and unfortunately, it impacts other municipalities. So if we don't introduce the concept, or we don't share what we know, or we don't work on an overall plan, we just have to be careful of land. We have to be able to substantiate what we're doing. Up in the hammock, we could fill this room with hammock folks that never want to annex and never want certain things. And then you fill a room in Flagler Beach that doesn't want certain things. And they gave us the same song and dance in Flagler Beach. These people aren't from Flagler Beach, they're from Flagler County. Well, we're all from Flagler County, whether we are living in Flagler Beach or not. Right. So we've got to start taking a stance on some of this stuff. That floodplain in that proposed annex area is going to be a major project or a major problem down the road. Palm Coast development is already in the upper area, is already, like they suggested. We know all this stuff already. We have to start acting on it. And I don't know how we start, but we can do it. We can do it. We're not taking land use away. They bought what they bought. The people have what they have. They bought swamp water. Listen, I deal with it every day. How much is that land worth up in Flagler Estates? Ain't worth nothing, buddy. You bought it. You bought it from looking out of an airplane, and you bought 6 of these parcels, and there's not a road out there. You can't even get to it, right?
Right.
So, I'm talking about even out in Daytona North. What is the plan for Daytona North? Palm Coast ever going to annex in Daytona North? I doubt it.
No.
So we get left with Daytona North. What's our plan for Daytona North, right? What are we doing? Where are we going? That's the overall problem. It's a planning issue. And you got it. You just got to... I brought up to Flagler Beach, there's not one mention of annexation in their entire comp plan except industrial. That's all they want is industrial. That was when I was on the board, that's all we wanted. We wanted to go down Roberts Road. Well, Palm Coast took it first. See, so we're just chasing each other. We're just chasing each other. So you got it, Adam. You know what we want. You know all of us good enough to know what we want.
Mr. Dance?
Well, you nailed it at the beginning, right? Workshops are to debate, go through these ideas, but we need to formalize that in tasks.
Action.
And action that comes
Action
back
now.
to us.
Yep.
So you laid the groundwork, right? So give Adam some instructions and staff on what we want to do. The county, had the foresight to do the A1A Scenic Overlay District. Mm-hmm. So as far as protections, right? It's not fail-safe, but it is good. And I think as we have looked at some of the recent developments, there are things that, from the county's perspective, we need to go up a little bit higher and not look at the smaller specific levels, but we can go up a little bit and look at where we can expand things like the A1A Scenic Overlay. We talked about that. So I think we did talk about the roads, right? There are certain road corridors probably that we can come back, staff can analyze and give us some opinions on those. You'd be surprised, right? So 150 acres of Below Creek floodplain is a tiny part of the entire northern part of that floodplain. That floodplain extends to the western side of Old Kings Road, south of 100, and even extends across Old Kings Road, where Radiance is being built now. Didn't have the foresight at Radiance to look at the overall floodplain of the headwaters, but it's clear now after doing a lot of analysis and studying. And that's going to be something we talk to Palm Coast, because that whole northern part of Oakings Road is an old DRI, but has not been developed yet. But it falls within the headwaters and the floodplain, and there needs to be protections on the edge, on that edge of the floodplain. But there's so much against us from the state level we're going to have to just continue to fight. We do have tools in the toolbox. I would love to see, right? So the Bunnell, the whole Black Creek, Hawk Creek protection area, that's something that affects our unincorporated residents, but nobody listened at Bunnell about protections on Black Creek and Hawk Creek, but that's something that we can work on. It goes all the way out into Mondex, everywhere out there. I mean, it affects all the groundwater all the way out on the west side. So those are things that we can work with. Again, kind of a regional council kind of perspective as well. Water knows no boundaries, it just flows. So I think the tools that we've talked about, right, I would maybe ask in a short period of time that staff come back and narrow these back to us and give us some guidance on things that we can do in the next, what can we do this year, in the next year, even though, let's be positive and say changes come to 180 in July 1, and then some of those things come off the books. The tree ordinance, again, something that this council did within the last 2 years, that protects, natural resources. That'll come back on the books, and then we can enact some of these other protections.
I'd also encourage you, if your focus is changing, your focus is shifting, which I don't think it particularly is, but if your focus is becoming even more specific, incorporate that into your strategic plan. Be very specific. Because what we're trying to do as staff is we're trying to integrate that as a policy document. So you tell us what you want, strategic plan. We then backfill it. Comp plan then helps us implement that. Land development code helps us implement the comprehensive plan. And so these are all to us interrelated. And beating that horse one more time, the strategic plan then guiding your budget. So also then, we have that expectation. We're focusing our work ethic where you've told us to go with the strategic plan. And so I'm not saying it's not in there already. I think we've got some general language in there. I'm thinking maybe you want to go back and look at that and be a little tighter on some of that.
I was just going to say the word tighten up.
Yes.
And we may need to have a separate workshop specifically for, the compassion of what the chair has shared. I understand it, and I agree 100% with it. I think we all do. I can't imagine anybody doesn't want to see us succeed over the next decades, right? And keeping the flavor of Flagler the way it is, and the way we preserve what we can in the best way possible. I think that's what everybody's interested in, as well as the people who work here and live here and play here. So I think that's pertinent. But we do need to tighten these things up because everything's pretty mamby-pamby until something happens, right? And I'll leave it with that. That's my thoughts. I agree with you on that.
I agree with everything that's said, but the elephant in the room is Veranda Bay in summertime. We have still unincorporated. We have little that we can do. A train may have left the station on that. But there's an opportunity to try to save something that's really valuable. And I don't know that we can or not. It may be too late. It may be too late.
I think that's going to come back to us under other comments for discussion today. There is a plan.
We'll bring it up under other comments. We can talk.
And remember also, you still have, staff has the ability to comment on that comprehensive plan amendment. Particularly, the statute is still out there, it's still very clear on how that amendment then affects or impacts the county's comprehensive plan. So that we are limited, but we do have some scope there of still some comments that we can make ultimately on the ultimate adoption. We still have that ability.
So, okay. Meaningful change this year with this topic.
We'll come back and give
However
you a report.
we gotta
We'll
do
make it quicker rather than later.
And I will just not, there's some, as you mentioned, Lake County, there's some other developments happening around the state that we can pull from, some some kind of best practices that have been implemented already in other areas that we can look at.
Thank you, sir. Want to take a 10-minute break? That
We,
sound?
we do have lunch in the back if you want to take a longer one.
Okay, how about we take, it is 11:55.
Or do you want to open it up for the public on this topic and then we can go? Huh?
I did, but
Oh,
after you
okay, I
back.
didn't.
Yeah.
Okay.
Oh, you were in the
Sorry.
back, I think. Yeah, we've already had public comment on it. We'll go ahead and take a break and come back at 12:15. Does that work for everybody? Thanks. All right, we're taking a break. Oh, where is it? No, we gotta go. What's eating? Hell. All right. Welcome back. We're going to start the rest of our workshop agenda, starting with item 6, the Nexus fee schedule discussion. Ms. Holly Albanese.
Good afternoon, Commissioners. Holly Albanese, Library Director. I'm here to talk about the Flagler County Nexus Center, but specifically the community room, which is sort of separate from the library. All right, so I wanted to give you some information on what's comparison or what I used for comparison. So ours is a very unique venue. Jacksonville Public Library and Boca Raton. So I wanted to give you a couple of libraries to compare it to that had a similar unique venue. Of course, their locations are a little bit different in the sense where Jacksonville Public Library has that downtown view, and Boca Raton, specifically the Spanish River, has a river view, and but I still wanted you to see what libraries are doing, and then I went into showing you what our Palm Coast Community Center is doing, and the Hilton Garden Inn. Those would be our direct competition. I did also want to show you just a regular library meeting room and what that looks like. So Volusia County Public Library has a various number, more than a dozen meeting rooms available for the public, and they either charge or don't or charge a fee depending on whether it's a library card holder, is it open to the public, is what type of business it is. But they don't have a catering kitchen like we have. So I wanted to just give you those. And I believe that's all in your backup, so you have the details of each of those. So based on all of that research, this is what I came up with for a recommended fee schedule. So it shows you that all the room versus half the room during the day, Monday through Friday. The entire room would not be available because, as you know, Health and Human Services uses half the room for the congregate meal site. So we can only, during the day, Monday through Friday, rent out half the room. So that's why you'll see a not applicable on the flat rate or hourly rate for the whole room. So I divided it by days and then weekend hours, and then after 5 o'clock on Monday through Friday as far as the difference in the fee schedule, and then non-profit versus for-profit and individual. So I tried not to do too much in the way of charging for things like linen. The city of Palm Coast will charge for linen, and they were charging $8. I show it here, but it's not something we absolutely have to charge for. It's something that you can add into it. It does, cost money to replace the linen when we have to, if linen is needed for a particular event. But I wanted to give you something. So that's what I have. If you have some questions on that, I'm happy to answer them. I can just rush through the slides, the rest of the slides.
Can I ask you a couple questions?
Sure.
Okay. They're not going to be a standard fee for everybody. It's going to change depending on what event type of person, when you're saying non
A nonprofit
profit
organization versus a for-profit or individual. So sometimes individuals, like for instance, I've already been reached out to about somebody wanting to do a 50th wedding anniversary.
Right.
I do have somebody that would like to have their wedding reception.
Right.
So that would be an individual who's using it for a private function, for a personal private function. So it's nonprofit versus for-profit
But the fees are different if it wasn't, so if I have a nonprofit, I'm going to do an event there.
If you're doing it after 5 o'clock, there is no discount. If you're doing it between Monday through Friday, 9 to 5, then according to this, you would get a 50% discount.
But there's a discount for nonprofit.
For
Well,
nonprofit
From the
only.
standard rate.
From the standard rate.
Okay. And the other thing, the linen, a lot of people bring their own linen, right?
And they're welcome to do that, yes.
But
So
if they don't, do we provide them with a black
Well,
linen?
right now I have black only because we had purchased it to have as
For the opening.
for the opening, the grand opening, so I do have that available, but yes, if somebody's having a wedding or an anniversary, they may have a particular theme.
Right, they
And their
can carry their
caterer
own.
would bring the linen
Correct.
usually.
The last thing is the AV equipment.
Yes.
In another county where I used to do a lot of, I've been doing a lot of that kind of stuff.
Sure.
They charge a connection, an electric fee, rather than equipment. They're not using our equipment, right? They're bringing their own equipment?
Well, they're bringing their own laptop or, yes, so but they will be using our equipment because it's installed in the room, so like the projector,
Right.
the screen, they would be using that equipment, or the microphone, they would be using that equipment.
Okay, I was just thinking, they charged you if you're there 3 hours, they charge you $25 an hour, that type of thing, rather than being as specific or as detailed as this. That may be something you may want to consider, because if they have a 3-hour event and it's $25 an hour
Right.
to use our equipment,
Well, that's, we do have the AV equipment listed at $25,
period.
period. So if it's 1 hour or 3 hours, it would be $25. Now, we do have a flat rate fee, so it depends on what time of day. So some of the comparisons that I had tried to do that, especially for individuals who were having like a wedding reception. So they would give them a flat rate fee of 4 hours or 8 hours, something like that. So we tried to offer that as well.
Just my thoughts of,
Yeah,
as soon as you said that, I remember the plug-in fee. It was a plug-in fee.
yeah. This is really truly using the equipment. So some of the equipment, yes, if they would have to bring their own laptop, let's say they're doing a presentation, they would bring their own laptop, and they would essentially be plugging in to be able to show that on the projector.
Okay.
But yes, we do have that. But please keep in mind, this is not the library's community room because it's outside of the library. The library is overseeing it and managing it. It really is the county's. So this is my recommendation, but we can put whatever the commission would like to see.
Okay, thank you.
There's several areas where the hourly rate, so let's go to the community room,
Yes.
under Monday through Friday. Okay. 2,500 square feet capacity. $1,600 for a flat rate for 4 hours versus $200 hourly. So why wouldn't I rent it for $800 for 4 hours?
That's half the room for $800 for 8 hours, right? It's 8 times 2 is,
No, because underneath it, it says community, I'm on the bottom of this graph.
right.
All right, so community room half, 1,500 square feet, $800 or $100 an hour.
Right, but that's an 8-hour flat rate,
All right, so go above it.
right? That's an 8-hour flat rate.
Whole room.
Well, $200 times, 8 times, I'm sorry. I'm sorry, I got it. Thank
Yeah,
you.
so,
Yep. Answer my own question.
I mean, sometimes you might give them a discount for such a long period of time, so
Yeah.
if that's something you want to do, we can do that. If you'd prefer not to charge them and give them a flat rate. It's just letting them know what the flat rate would be. Sometimes for weddings, I would think that they would utilize the space for that amount of time potentially.
The AV equipment rental is low, but if they're bringing their own laptop,
Yes.
correct?
Yes.
Did you compare that to the community center?
I did, and it's listed here.
Is our sound system like the community center where it's in the room?
Yes.
Okay.
Well, yes. So it's all, there's a tech room inside of the kitchen, which is where they'd have access for the microphone. But outside, in both sides, if we're doing half room versus the whole room, both sides have access because both sides have their own projector and their own projector screen. So they can use it on a half room as well. So it looks like the city of Palm Coast charges,
They charge.
it says speaker, $40. So I don't know if
Yeah, the
that's.
REC, we have our meetings there, and the charge for the PA, the podium, and the screens is almost the same as the rent for the room, but.
Yeah, it says
I think you're a little low at
$40.
$25, but.
And this is going to be reviewed annually too, so we could make changes next year.
One more thing I'm thinking of. Does this room divide into halves? So can you have two halves being used at the same time?
Yes, you can, but not during the day, because Health and Human Services uses half of the room every day for the congregate meal site.
Okay, that's part of the,
Yeah, so they used to rent Church on the Rock, so when they moved in, that was part of the, they were going to save money by not having to pay to rent. So now they use half of it.
so they won't be using Church of the Rock, they'll be using half of our facility.
Yes, Monday through Friday, yes, during the day.
So you only
But
have one half during the weekdays.
during the weekdays, but after 5 o'clock at night, if two groups wanted to use half the
Two
room.
evening events could be done.
Yes, absolutely. 2 evening events,
Just wanted
and
to
then, two, even over the weekend, you could have multiple events
Right.
as well.
Right,
So,
okay. Thank you.
yeah, no problem. So I just wanted to share with you pictures, the add-on that I listed in the recommended rent fee schedule. This is the catering kitchen. The pre-function, when I talked about the pre-function gallery, you can see the area. You probably recall on the night of the gala walking through there. So it's a very large space, 1,100 square feet. As a matter of fact, the Education Foundation is going to hold their Teacher of the Year awards ceremony there in the community room. They're going to use the whole thing, and they're actually going to use the pre-function lobby area for, I guess, a photo booth. They're going to have like a cocktail hour out there, and they're going to have a bartender out there. So there is going to be use of that. And then looking under the portico, which is another large area where we could have, about 200 people, that there is potential for utilizing that space. Like Jacksonville Public Library, they have courtyard. They have half a room, a whole room. So there's a lot of different usage. They call their lobby a gallery. So,
gonna say
yeah, they call it a gallery. So there's different terms for these things, but essentially trying to maximize and look at what the potential requests would be for use of space, and to make sure that we're maximizing the revenue so that we can offset tax dollars.
I see that as an art gallery myself. I see that as an art wall as people come in. That might be a good leasing opportunity for them to be able to display art there too.
There's definitely a lot of
Yeah,
potential,
a lot
for
of
sure.
choices.
And then just showing you again the outdoor portico, which can seat up to 200 people. So if they wanted to do that, they could rent tables and chairs and set that up out there. As Spanish River Library, Boca Raton has a huge outdoor patio area that they do that with, so. and just some layout options that I created as potentials. So this would be 224 guests, and it would be without a dance floor DJ band. It would not be buffet style. It would probably be plated. Or if they did want to do the buffet style, they could put the buffet outside of the room, like we've seen at other conferences where you may sit in the conference room, but then the food would be right outside of it. So you could do that here as well. But that would have to be after hours if they use the pre-function lobby, because if the library's open, I can't guarantee people won't, take some of the food.
Hungry.
So.
They're going to be real hungry when they smell it, yeah.
And then this is showing the multipurpose room, the whole room with DJ and dance floor. And if you came into the gala that evening and you went into the room, you saw a DJ in there and a small dance floor. And we can fit up to about 175 guests if we do that. If you do and that's catered. If you do buffet style, then we might have to reduce the seating count, again, if you want the buffet inside the room, but again, this could be an option of having the buffet outside the room. And then we have layout 3 showing 2 halves of the room being used. You can fit up to 96 people in each side, and that's, again, without a dance floor or DJ.
So those tables seat 8 people. I'm assuming they're 8 foot round.
Up to 8 people.
Yeah. 6
We
to 8.
we can 6 to 8. Yeah, we can fit less. Obviously, it's always more comfortable with 6, but you can fit 8.
Okay.
And then looking at room 4 and 5 as options, I'm showing you room 4 with the buffet in the room and room layout 5 with the buffet outside the room. So up to 80 guests with room 4 and up to 96 guests with room 5. And then talking about marketing digital, we're going to have a landing page. We'll have a featured promotional video. We've already created the brochure, which I think was in your backup. We tried to kind of look at City of Palm Coast brochure that they have for their community room, and we took that and created our own brochure. I do want to promote this venue on some of the wedding vendor marketplaces, such as The Knot and the Wedding Wire. On-site signage, use of other advertising services, flyers, banners, and other potential promotional items. So. And this is just images of the brochure, which I believe, again, was in your backup. And as you can see, it talks about capacity, size, layout, amenities, kitchen features. And then the last one was just something that we could do. It's for event planning services, which would be a 4-tier system. This is more towards large events and weddings specifically, but Osprey, Egret, Heron, Eagle, and those would be based on whether they used half room or whole room, east and I'm calling them community room east and west. So to have some sort of delineation on which room is which. So, and that's what we'd be looking at. So underneath each one tells you what they get, how many hours, and what the cost is for use.
That looks familiar. I've seen that somewhere.
Yes. So since I felt like, between myself and communications, we created this for the Island House. I figured I could use it since we didn't do the renovation for the Island House, that I would use it here. And I really like this tiered package with the bird names, so very apropos for Flagler County. Anyways, so.
I have a real... Yeah. Did you check at Channelside? Did you ever compare it to that location as well? Channelside?
No, I did not. I tried to keep it to like our biggest, so for instance, Hilton Garden being where it is kind of our competitor. And I know that the county, for some of our functions, like the Years of Service Awards, they've held it there. And I believe HR indicated that the last time they were there, it was $600 for use of the room. That's not including the food. So I was trying to keep our rates reasonable, but also continue to make some revenue. I have not looked at channel side, though.
They're quite a different cost than what these two. And when you talk about like weddings, for instance, I've been to 3 weddings there,
Right.
and it's significantly higher. And they offer a water view, but
Right.
not a phenomenal water view.
Right.
We don't have the view, but we do have the space and the
Right.
comfort.
Jacksonville Public Library, they have an 8-hour flat rate. I think the maximum cost, and that was to use the whole library, it was $8,000. So, you know, 3,800 is not as high as 8,000, but that's kind of what I came up with.
As soon as you say the W word, it doubles, prices double.
Yeah, I know.
Water.
Oh, you know even more now.
The water
Andy.
view, yeah.
Yeah.
So again, it's whatever the commission wants. If you want something different, you want something higher, we can do that. We're just managing and overseeing it.
Well, we don't want to watch it sit empty either.
No,
We
no,
didn't
no.
build it for them to not use it, so.
And trying to be reasonable with some of the nonprofits. We have a lot of organizations, clubs using the meeting room up at the library in Palm Coast. As a matter of fact, that room is like booked solid for the next year. We have so much demand for use of that room because it's free space. So, yeah. While this won't be free, we try to help out some of those nonprofits clubs by giving them that 50% discount.
Right.
And then we also have the space inside the library that is going to be treated differently, and that policy is set by the Library Board of Trustees, which they have already done. So,
Thank you.
welcome.
The event planning page, so as you transition from the other itemized to the event planning, is there staff that you've assigned to these for one-on-one kind of catering?
It's mostly going to be me for now. Yeah, so it's mostly going to be me, but I do have some staff that will help me in coordinating and maybe, you know, I have one who's working on some of the, because there has to be a form they have to fill out. And I have someone working on that right now. So there will be some assistance from the library staff, but you've got to think about this. Somebody's got to, especially at night.
Right.
Somebody's got to lock up, somebody's got to, yeah, so.
Even the other ones, if somebody's using it, is I've thought forward to after hours, somebody coming back to either check on it being locked up, or how's that going to work?
It's going to be me
Okay.
for now.
And we'll have to think more about
Yes,
that
yes.
before.
Right, well, right now, you know, my thought process is, let's get this going.
Okay.
Let's see how much demand there is for it, how much revenue we're bringing in, because the whole idea is to offset tax dollars. And so I'm, you know, willing to take on that task for now.
And
Yeah, see.
you'll be the contact, instead of general services, who does all the others, you'll be the one for, they'll
Yes.
reach out to rent this one.
Yes.
Okay.
Yes.
So are you going to be like Palm Coast Community Center where there's staff there during the event? So if something happens, they're able to assist the renter?
There will be, no, not, well, it depends. I should say it depends. If it's during library hours, there will always be someone there. But if it's after library hours, and you know that facility nexus is Sunday through Thursday. So even on a Sunday, if they're using the facility, there is possibility of library staff being on premises. If it's during a time when the library is not open, then potentially, no, there would not be somebody right there at that moment in time, but I would give them my contact information so that if I had, I'm 5 minutes away, I can run down, but I would So like, for instance, the Flagler Education Foundation, they're using it from 5 o'clock in the afternoon until 9 o'clock at night. Now, they probably need an hour afterwards to clean up as well. So my plan is the library closes that night at 6. So my plan is to come back afterwards and
You
lock
can't
up.
get a self-locking lock? You can't get a coded door?
Well, the front doors into the lobby area don't work that way. They're kind of I don't know what you call it, but it has to be dogged and undogged when you lock or unlock the doors. So you can't just simply, I mean, they could leave and the door would lock behind them, or we'd have to make them go in and out the north side doors, because those are the only doors that have their badge access as well as key access. But the front doors are not key access like that. You unlock it. But for now, we could do that. There is a possibility in the future, and it's in the policies and procedures that depending on the event and how large it is, if we require, because we can require per the policies and procedures, we can require them to have security. And if they have to have security, they have to pay for the security, and that is the person that would be responsible for locking it.
Palm Coast can open a bathroom from a computer.
Yeah.
When you have events in Palm Coast, if you need restrooms at certain stops, they can open and lock,
surprise me.
unlock and lock bathrooms.
Usually with security, that comes with alcohol.
Yes.
So do we have restrictions on alcohol or not? Because that will change the types of events we have.
Yes, there is an alcohol to this policy,
Okay.
but
They used to some places request police. I mean, a lot of condominiums and stuff that have a community room will have strict guidelines.
Right.
And, you know, I'm going to spend some time with you to just look over and give you some thoughts of mine if I see it, not at this meeting,
Right.
but at a later date.
the key is that in order for me to start renting the room, this is going to be the fee schedule, and the policy is going to be on the meeting tonight for your approval.
Okay.
So if there is something you want to change on the fee schedule, now would be the time, because I can't start renting until I have it in place.
Well, I just think the use of the equipment is a little underpriced, in my opinion, only for the fact that that equipment is expensive to replace. So if I drop the mic and it doesn't, you know, mics have a tendency to not work half the time anyway.
What number do you want, Pam, for the rental?
I'd say
I would agree with $50 for the
50,
rental.
I was going to
AV.
say $45, $50. Yeah, just because it's expensive. You know, you're talking about delicate equipment. If you play in a
Do
band,
we have consensus on that? $50 for AV rental?
I was kind of thinking along the lines of $25.
Oh,
yeah. Then there's an hourly rate, right? There's
that works.
I'm good the way it is, just to see how things go, but
well, they may not
What
need our
happened
equipment.
was the library board met on these and went over these and agreed to it. And we had talked about maybe coming back in 6 months and looking at revision, particularly in the podcast space on charges.
The trustees, we did not talk about this because the
Right.
board
The
the
board has to
commissioners
do
had
that.
not seen it yet, so I didn't think it was appropriate to show it to the trustees because this is a separate space. It is not part of the library. However, we did review the policy for the podcast booth and the innovation lab, and they agreed that they wanted to revisit it in 6 months. They were concerned about it not being priced high enough or enough. We'll just say that.
So is this something maybe you want to look at in 6 months when we look at?
the usage numbers,
Right.
remember?
And be like, is it being used? Is so much, did you have damage to the equipment? So when we do that look back for the podcast equipment, maybe the AV equipment can be included in that and the other items. right now it's sort of like that test to see, does someone lease this?
But we still want to be in the market and not so below the market that we have such a demand because they know it's a great deal.
Right. Well, if you want to charge $25 an hour for the AV equipment, we can make that adjustment for the approval for tonight.
Then maybe that'll be the future is per hour.
Okay.
Maybe now we could double the 25 to 50 because that's what's both been discussed.
It's on the Nexus Center Community Room recommended fee schedule. If you look at underneath the add-ons, flat rate.
Do you think maybe just a deposit, if we're worried about damage? Or is it covered in the deposit? Is there a deposit for that?
There is a
Yes,
deposit.
we do require a deposit.
Yeah. I don't know. I'm okay with it now, but whatever.
I'm okay with it the way it is now.
Okay.
Come back in 6 months.
Okay. You want to revisit
I
it
agree.
in 6 months?
Yeah.
I'm okay with that. I just want to keep it in mind that we're giving them a discount right up front,
Yes.
in my opinion, you know.
Okay. Anything else? No? Good. All right.
Thank you.
All right, any public comment? I'll open up for public comment on the Nexus fee schedule discussion. All right, seeing none, we'll close it and bring it back here. Everybody's good for now with the consensus that she'll give us an update in 6 months, see what usage looks like, equipment damage. Adult daycare discussion.
You didn't pull it, huh?
Mr. Hagedis.
She can't.
Huh?
We can't pull it today. We'll see. Mr. Hagedis, how are you, sir?
Good afternoon.
Afternoon.
My name is Joe Hagedis, Director of Flagler County Health and Human Services Department. I'm here today to discuss the Adult Daycare Center. Just a refresher for the public, presented in October. The October 20th workshop, in that shared an array of data and figures. The board asked to come back at this meeting and try and present a bit more of a budget-neutral plan or a goal towards a budget-neutral plan as it relates to operating the adult daycare. So I've put together this presentation to that aim. To begin, the adult daycare program provides essential community-based care at a net annual cost of about $4,500 per participant in the program, a figure that's substantially below typical market rates for comparable services. We are in a community where no other alternative adult daycare program or providers exist. This program fills a critical gap for vulnerable adults and their caregivers while preventing significantly higher downstream costs to families in the public sector. The program serves 45 to 50 adults annually and also supports 40 to 50 or more caregivers, providing respite and additional medical support in a family setting. The program was formerly operated by the Flagler Council on Aging, and we took over in the early 2000s from them after they closed down operations and ceased administering the program. Attendance and enrollments dipped during COVID levels, understandably. We attained those pre-COVID levels in late 2024 of about 25 to 30 enrollees in the program per month. Again, we are the only state licensed adult daycare in Flagler County, and we are the only Medicaid licensed adult daycare in Flagler County, serving seniors. I won't dive too deeply on community need. A lot of that was included in the last presentation. But just briefly, again, no alternative providers other than in-home care. There's service exclusivity. There's no other adult daycare options. Equity and access. Without this program, families, especially those with limited means, have no viable alternative for care. Rural and aging demographics, the county's population profile increases as demands for non-institutional and community-based care also increase. I gave more numbers at our last presentation, but these are kind of summarizing some of those points. Aging adults aging adults with cognitive or physical limitations rely on structured daytime care to remain safe in their homes and with their families. Daytime activities prolong the progression of dementia and other conditions, and family caregivers depend on the program to maintain employment, manage stress, and avoid burnout. This slide presents some of the financial figures as it relates to the program. You'll see the past few fiscal years, and then at the bottom is the current fiscal year. I've included a column for approved budget versus actual expenses. I'll dive into the differences there, but the bulk of the costs for the program are staff. We have to meet state mandated requirements around staffing levels. There's no way to avoid that. The program costs outside of personnel and staff have been minimized. When I first arrived here, it was $30,000 a year in operating costs. We've brought that down in our budget to $20,000, and in reality, we see roughly $16,000 to $17,000 in operating costs per year. So in reality, the actual operating cost of the program is about, outside of salaries, is about $17,000 to $18,000. That includes food, utilities, costs of services, program supplies, etc. Our biggest cost is our utilities. We have no control over that either, unfortunately. We spend less than $1,000 a month on food, program supplies, and the like. So again, I'll touch on approved budget versus actual budget. Our approved budget that we bring to you every year has a set number, and that goes up year to year, mainly due to COLA, the cost of living increase. You'll see there's a difference, though, between the actual and the approved budgets. Our staff, the proposed staff every year in our budget, pads or kind of adds staffing wiggle room in our budget. In case we have staff that take leave, we have to have substitutes to cover them. Staff are out sick or whatever it might be, we have to bring in substitute staff. We also have a CNA position on the books that's not filled. I had terminated that position, somebody from a position when I first came on board here, and we have not filled that position. So that's been a savings as well, along with the reduction in operating costs. So as it comes down year to year, we have an actual real program cost of about $300,000. This year, we're projecting $335,000 of actual program costs. We'll touch more on revenue, but we're projecting a goal of about $125,000. If we maintained as is, $125,000 of revenue. So that would relieve roughly $200,000 in costs of the program to the county. And that's where I came up with that figure at the beginning of my presentation, $4,500 per client per year. So again, some of the savings measures taken since my time here in Flagler County. We vacated and froze one FTE CNA position, which between benefits and pay is roughly $60,000 in savings. We've reduced operating expenses and budget by $14,000. And up until late 2024, we had boosted enrollments from 15 or even less up to 25 a month. And we're on an upward trend. We've also enrolled in 3 HMO Medicaid plans and as they become approved for our region so that we can receive referrals from those providers. We'd applied for working with the VA. They are not taking new providers at this time. But these, again, are steps that we've taken to try and reduce costs, expand referrals, and the like. Some additional program figures. on average, in the past few years, we've billed 12,000 hours of service. Each client averages about 5 hours a day. So at our $10 an hour rate for private pay clients, if all of our clients were private pay, which they're not, but if they were, that would bring $120,000 in revenue from that billing. Again, our annual cost is about $330,000. So there's a gap, which this board has signaled and concerned about. If we bumped up our private pay rate to $15 an hour and still had that same amount of billing, we would bring in roughly $180,000 a year. Still not enough to cover the costs of the program. So that leads us to, we really need to look at doubling our attendance, maximizing the number of folks and the billing. So just back of the table napkin, or back of the napkin math, excuse me. If we double our attendance or average hours to 24,000 hours a year at $10 an hour, that brings us to 240,000. If we bump up that private pay rate, that finally gets us up to covering the costs of the program. And again, this assumes these are all private pay clients. We have Medicaid clients, others, referrals that don't pay as much as the private pay rate. They'll typically be put lower. So I share all of this just to kind of give you some rough sense of the numbers that we have to play with to bring revenue up to the cost of the program. Another key piece of this that I would say, if we're talking about doubling attendance, we also have to consider the patient acuity and level of care, right? So if we've got 20 people and half of them require 3 people to toilet or to take care of themselves or whatever it might be, that takes our staff away, and we have typically one staff person left. So we have to be then judicious about who we let in and deny folks and kind of, how do I say this, slice and dice our enrollment a little bit more, right? So again, there's some, I guess my point is there's fluidity in these numbers here. So again, we had a projected net expense of this year of we have a projected net expense of about $210,000. It's about $4,500 per client. Just in looking at other areas across the country, median daily rates of $100 a day. If you're looking at 8 hours, that's, over the $10 an hour we charge, but under the $15 that we're looking at potentially adopting. So what's my plan going forward? Again, as my presentations alluded to, there's no one fix. We need to bring a mesh of different ideas together to shore up the budget for this program. First step is renewing our license that's due this month. There is an opportunity when we renew to attain a specialty Alzheimer's designation, which I believe could be a draw or a benefit. There are none in the region. So, that could be a potential draw again or specific aspect to the program that's unique.
How many more people would you have to hire?
For that specific designation, it's not so much about hiring, it's about training and staff experience, which our staff has the experience. We just need to make sure then we would meet the annual training requirements and expectations.
Okay, thank you.
Yeah. I will add to that, there is a supervision component that requires a bachelor with an RN, a bachelor's degree, a registered nurse with a bachelor's degree. So that would be another required piece to that designation. And the other next step I have to deal with is addressing staffing. We've lost 2 staff recently, our manager and an on-call staff. So again, that limits the number of people we can have every day. Right now, we can only have 15 people attend every day. So we have to really get working on recruiting if we're going to achieve this. We obviously have to increase community outreach and engagement. Frankly, that has not been occurring to any significant degree in light of these discussions, and increase our monthly enrollment through that outreach and engagement by doubling, again, essentially our enrollment, and again, doubling the daily attendance. The last point on this slide is about increasing our private pay rate. I would propose doing it incrementally. Currently, we're at $10 an hour. I think we could bear going up to $15 an hour. I proposed by fiscal year 28, 29, but again, welcome feedback on that. I do have some, I think with a couple of these recommendations, there's a diminishing point of return, right? So the higher we charge, the less people to come because they can't afford it type of thing, right? We already have had 2 folks just in the past month or 2 leave service because of inability to pay. So there's the kind of a give and take there to some degree. Continuing on the plan to shore up the finances, we want to enroll more folks from our Alzheimer's and Disease Initiative grant, ADI grant. We currently have that grant, and there's opportunity for about $50,000 to $65,000 in funding from that grant. So we are working with our senior services case managers to promote the program to people that are under that funding stream, recommend the opportunity and see if they're interested. And then again, tap into that funding. That grant does reimburse us at a higher rate. That's at $17 an hour, so that's our biggest money maker, if you want to call it that. But again, it's limited in funding unless we pulled services out of the grant and focused only on the adult daycare. Some other options are considering increasing the minimum required hours per week. We currently require 4 hours. We could up that to 6. Again, I think that's one of those with a diminishing returns. If you go to 10 or 20 hours a week requirement, you have folks that won't come to your door. So striking a balance there is, I think, important. And then the last option I put on here is considering reduction of hours for times when there might be less attendance. Typically, the bulk of our folks are there from maybe 10 to 3 or 4 in the afternoon. So there may be some efficiency in, staffing hours and streamlining hours that way. Again, with that one, I think the more you shorten the window of your hours of operation, you kind of exclude, say a family that needed caregivers for 8 hours a day, right? That we're off the table for them at that point. So again, we're kind of shooting ourselves in the foot to a certain degree with some of these ideas. So my suggestion and recommendation would be to implement all of these, in a kind of a incremental degree, and then just continue to see how that impacts the budget as we go forward. Sorry, just real quick. So again, roughly $200,000 in cost to the county when it comes to caring for those in our program. Sorry, got behind in my notes here. Oops. Okay, and some other just quick updates. There, I mentioned our staff changes there. We've seen a slight reduction in enrollments, again, mainly from limited outreach and engagement. If folks come to our doors, we will enroll them and engage with them, but we're not doing active outreach and engagement in the community, which I think is what brought us back from COVID. We were doing a lot of monthly outreach and engagement in the activity after that time. Again, we had 2 that were discharged from due to cost. And then a piece of positive news or fun news, we did participate in the Santa to a Senior program this year. So we worked closely with volunteers in the community to provide gifts to over 200 seniors in all of our programs and show them some love around the holidays. So again, in summary, my goal since coming to this program and to this county has been fiscal responsibility and stewardship. along with providing critical social services to most vulnerable in our community. We aim to increase outreach, enrollment, and attendance. But again, I believe, and I would pose to you, that this is a critical service for the most vulnerable in our community. And even at an annual cost of $4,400 per client, I personally believe that's an acceptable cost to provide the service that we do, and again, with no other option for folks in our community. Thank you.
Thank you, sir. All right, I'll go ahead and open it up to our board for any questions for Mr. Hagedis or comments. Anyone would like to start?
No, I just agree with Joe. It's a very much needed service and one we should not consider getting rid of. I mean, it's a cheap program, and it really does do a good job for our seniors. I appreciate what you do.
So the ADC manager, RN, left. Was that Miss Lord?
Yes. Yes.
Do you have any comments, questions, concerns?
Has, who else has reviewed the new business plan, if you will? Is that just internal to your office?
No, we met with administration, and finance was involved in the conversation. Yeah.
The only issues I see moving forward is finding an alternative. If we don't continue this ourselves, you know, I've talked to a couple of people that use it, and it is an important component to their quality of life. I mean, they're in a certain situation. Doesn't answer who does it, us or somebody else. I just have a fear that in another year this is going to be a program, as you know, the next big talk we're going to have is on, you know, what do our core county services because of reduction in property taxes, and this doesn't fall under a core county service that you know, we're going to have to be making a lot of hard decisions if the future holds out the way it is. And going, not a fortune teller, I don't know what's going to come down the pike, but we've all been asked as county leaders to start preparing for that. So that's the only, you know, as we look forward, you know, we're budgeted for the remainder of the year. Do I think we can reduce the annual cost per client by doing all of these things? I think there could be, if we made a concerted effort to do more research or more outreach. I'm just concerned about the future, and I don't know if it's the right thing to invest in all of this, if it's going to be one of the services that doesn't survive. You know, but this is part of the campaign we're going to be talking about is, you know, as voters, it's going to, right, it looks like this is going to come to a constitutional amendment on the ballot that voters are going to have to decide, and they're going to be weighing these types of decisions of quality of life issues when they go to cast their ballot. I don't know if this ends up surviving that, because we're going to have so many things that are going to, we're not going to be able to do everything that we used to be able to do. So I don't know that I have, without some other thoughts from the board on what we do beyond this year. Maybe have a conversation again in July, or once we know what's going to be on the ballot. So I'll just leave it there.
And I agree completely. We don't know what's going to happen. This came up last year when we were taking a little bite at the apple on non-statutory services. These are things that came before us that we're going to have to decide on. When I look at performance, it's like the new Chick-fil-A. Did you see how long that line was to try to get in a sandwich from the new Chick-fil-A? If this was the best program in town, you would have people knocking on your doors. You would have to turn them away. I'm not saying it's not needed or it's not good. I have lost my mother since our last discussion about outsourcing. I know Granny Nannies has been in to talk with administration. I never heard anything about that discussion. I don't know if it's an option. I don't know that Alzheimer's, I'm not going to disagree that we're the only one in town. What I'm going to say is there are lots of Alzheimer's programs in this county. So is it daycare-oriented Alzheimer's? No. You're living there. Most of the Alzheimer's patients are living there.
Residential, yes.
I experienced it, and when it came to the point where my mom was going to need total care, she was going to go to an Alzheimer's unit. So that might be what we're up against. I don't know where we are with that. I don't know if loved ones of Alzheimer's patients want, it's not that they don't trust us as a government, maybe they don't see that as a good option. I would not put a lot of energy in credentialing for Alzheimer's. I just think it's a different breed than a daycare center, but I could be totally wrong. I'm with Commissioner Dance. I think this is going to be one of the items that's on the chop or not chop block. And I'm glad we can see this. I'm glad we can see where we are with this, but it's just not an overly utilized service, and we had to look at it. So I don't know what the outcome's going to be. I know we are poised to get through this year, and we start our budget discussions as early as the next agenda item. So let's just stay open and see what we can do.
I'm just going to make a short comment. First, I want to thank you for your more intricate work, Joe, on this discussion. I'm going to take an unemotional, and I'm going to look at it straight business. If I opened a coffee shop and I had 3 customers, and Starbucks is down the street, and Starbucks had 3,000 customers, I'd be bankrupt in 2 minutes, right? We need to look at what's the highest and best use for what facilities we do have and how they're operating. And we're not a profit organization, we are a community organization, and I respect that. But we can't keep making losses when we can't even handle other things. And it's going to be a matter of how many people. We don't have the participation. It's so limited, and it's a shame, and has been available, and it hasn't grown at all. And with our population growth, has it kept up with the population? And I don't see where it has. So numerically, it doesn't add up to me to stay active in it and to find community organizations that do a tremendous amount of marketing and have professionals. They are pushing just for one item. We are trying to take care of every item. And I just don't think we have the capacity to do that at this point. And I just want to thank you for going through more detail than we did at the last presentation, because it opens my eyes to a couple more things. And it's no one's fault. It's just a sign of the times. And growth causes different things. Growth will always cause turns and twists and directions, and we always find a new way to make things happen in a better light. And I pray for all those people that have to deal with family members that are not 100%, but we're not taking on people that are have other issues. So it's a really challenge, and I just thank you for the presentation.
If I could, I do want to thank you as well, Joe. Thank you for putting together the formulation, because I think when we talked in December, these issues were already on our mind about the property tax thing, and knowing that if something's going to survive, right, it's going to have to be cost neutral to a degree, because we're going to be looking at ways of saving money based on what's coming down the pike. Ms. Petito, what is reasonable, looking at our timeline for the budget of, we'll know by the end of session and in June what's going to be probably on our plate, right? What our options are?
We should know a little bit closer to probably June or July, but then it's still going to have to go out to the voters to approve.
Right. But I mean, the framework will be there, and we'll be able to really determine what's going to happen.
Correct. I would say probably June or July as we start to end the budget cycle to be able to prepare the tentative budget. We'll know. As we move through the budget, you'll see on some of the slides we're going to show you in a little bit, we're already taking into consideration the impacts that are going to be there. We just don't know which path the legislature is going to move forward, but certainly we will have an impact.
All right, and then just another couple questions, Joe. When was the last time that CNA was filled, the one that you were holding?
The one that's been open?
Yeah.
It's been at least a year and a half it's been open.
Okay, so some of those, the fee should have been reflected in some of the older years that we were looking at on your sheet.
Sorry,
one of your
fee?
slides had multiple years.
Yes.
So it was looking at personnel, the actual expenses.
So it's still on the books currently. It's that vacant position is currently on the books in case we expanded our consent.
Right, but I mean, it would be reflected in actual expenses.
Yes,
because you didn't fill it. So I was just trying to figure out, was it before 2023, or do all of these show it vacant?
24, I believe, is what it was, yes.
So it was on the books in 24,
Yes.
but then vacant in 25. But personnel went up.
No, sorry, it was on the 23 and then vacant in 24, excuse me. If I remember correctly.
Yeah, doesn't seem to flow there. It would be higher, and then,
check.
but I guess we have, I don't know, I'm just one thinking out loud. You've got the first half of this year to, as we determine what the legislature is going to do. I don't know what everybody else, I mean, if you expanded your opportunities and we got more attendance and it was neutral, I don't know what the thoughts of the board is, keeping it for and moving forward. I know there's no real options, I think, Ms. Petito, other than private, right? And then we would probably still have some subsidies going even if it went private. Would we be doing any subsidies?
It really depends on the direction of the board. If we are faced with what we believe may be coming out of Tallahassee, then I would say that you're not going to be providing, providing subsidies at all. You're not going to be able to afford it. So it really it's going to be dependent on what happens in Tallahassee and what the voters ultimately approve.
And what's the average stay for a client when they come in for the day? Do you have 1 hour people, or do you have two?
We've a mix, yes. We've got people that come in maybe 1 or 2 hours a day, 4 or 5 days a week. We have folks that are there 6, 8 hours. It's kind of a range.
So is there a minimum daily rate?
Not daily, it's per week, 4 hours per week.
So would it change if you weren't there as just a drop off for an hour, but you had a minimum stay? Would that change things?
It could. I mean, it wouldn't be significant. We don't have a lot of folks that are in that bucket. Right. Most folks are 4 to 5 hours generally, that they're there. So it could have some impact, but it wouldn't be a significant piece. I did want to say also that compared to in-home care, this is a much cheaper option. So in-home CNA is roughly $25 an hour to have them come to your home, and $10 an hour comparatively is a much cheaper option for that. There's obviously different services and different things there, but
Yeah, I know in my research, the only thing I could come up with a comparable was in St. Johns County, and they were already at $15. So, and I know we're not the same as St. Johns County, but I'm almost thinking if we make that switch now and see how it affects you, see who drops and who doesn't, and just start now bumping it to 15 and see how it goes. I know it's a big bump.
I defer to the board in their direction
So
there.
is the daycare, is the medical part of the daycare the reason why we need CNAs? If I just needed to drop my mom off so I could have respite and do what I have to do, I don't need a CNA to do that. Do we give meds? What do we do that we need CNAs?
So the state, to be licensed by the state, you have to have
It's in statute.
licensed staff, which includes LPN or RN for 75% of your hours of operation.
Okay.
And then you have to have CNAs for the remaining times, yeah. So that is if you're doing the medical model. If it's more of a place for people to be, and it's not a licensed daycare, it's just a room,
Right.
a senior center, or whatever you
Right.
want to call it, then, all those requirements are off the table.
Okay.
Yeah. But again, I think, there's a reason why the one public or for-profit entity that was on Palm Coast Parkway closed. The Flagler Coalition for the Aging closed down their operations. I mean, it's not a windfall of funds. Social services has ever in my 25 years experience been anything about revenue. It costs to serve our most vulnerable folks, to pick them up and get them on their feet. And it's just about whether or not that's an acceptable cost to us as a community, I think.
I think we're going to be making that decision really soon as a community, as a state.
Okay, so let's address some of the issues because we're funded in this program through the end of the fiscal year. You lost the manager.
Yes.
Do you have to hire back in order to continue with the program for the rest of the year?
We have to have a registered nurse that can supervise our LPN. So I'm looking at other options of maybe not hiring an RN, contracting out for a supervision piece. Frankly, I'm looking at all the options right now. But there potentially could be some savings if we don't hire an RN and just contract out for that supervision piece, and then maybe hire a CNA as the extra set of hands and eyes in lieu of the RN. So that's a potential thing I'm looking at, and looking at partnerships with other entities. I mean, everything's on the table.
Yeah, my concern is it's a speculative business plan, regardless, just to break even. Because you're saying, like, let's increase the rates, let's increase the population on a program that not too long ago, we had to pass a no-show fee because people didn't show up. We have people dropping out because they can't afford it, or it's such an inconsistent, right? They come, they go, but enrollment's not been, really high. It's so speculative for us as a group that we just don't have revenue like that to expend. And I understand it's like not something we're supposed to make money. And I'm not even trying to make money, just break even or close to it, but we're not even close to it for a population that's small. So it's one thing to lose $200,000 a year, but you're helping 8 to 1,000 or a couple thousand people in the community. It's another thing to lose it on a population that's, less than 20 people. It just doesn't seem like that's a good use of tax dollars for a local government to be in the business of. And so, I mean, you can wait on what the state's going to do or not, but, you know, the reality is, you know, we're still going to have a lot unfunded beach plans, unfunded stormwater plans, and we are just not a county that can be in this business of losing money on something that is doesn't benefit a large population of people. It's painful. It's not a nice thing, but that's being honest. That's just my opinion. I'll go back to I'm one of five, but these are the little things that add up along the way that that we have to deal with, that we have to move on from. And I hate, that's my opinion. I mean, we can come back in July. He's going to have to staff. He's going to have to go find some sort of temporary to help who's there now. But I don't think, even if they come back, and I think that it's not gonna be a total cut of property tax. I think it's gonna be some sort of like homestead exemption or something. We're gonna have losses realized this year if we don't start,
It's going to come down to necessities, not desires.
We have that now. Like, we should be filling the necessities regardless of whether or not what they're doing with property tax. We need to be funding stormwater. We need to be funding.
Exactly. We have necessities, priorities.
I like all this stuff, but we are not a rich enough county to be in the business of adult daycare, where we have losses. And then say, well, okay, if we want to break even on it, you got to go with me on this plan. We got to get more people, charge more, hope they show up. It's like, I don't know if that we can sustain that. Because when you get more people, you got to hire more people.
Right.
you got to hope they all show up. You got to hope they all pay. It's just like all these things have to fire off, and they've not been firing off for years to begin with. So I don't know that it's smart to speculate that they would now. And that is just.
It's a
how
shame,
I see it
but
when I look
it
at
is.
this.
It's a shame. It is a shame, but sadly, it's so unstable that we're the only funding that's offering stability to it. That's the truth.
So you need a plan going forward. This is funded through this fiscal year. And you have to staff back, one or two people to keep the operations going. How many are currently there right now enrolled?
3.
There's 3
We
employees?
have 3 staff, yes.
3 staff. You need 2 more?
We need 1 and then an on-call to cover.
You always
float.
have to have you always had an on-call out, right? So you have to get somebody, and I think we need to help him decide, should that be, or maybe administrator can help him decide whether or not that should be a temporary person, or, do you want to make that an employee, knowing that they risk the possibility of us not continuing on? Or are we just going to go ahead and say we're not continuing on? There's not like a magic pot of money coming in. There's nothing coming in, and I'm just being honest. There's no magic pot of money coming.
Is
to
it
us.
cost effective? That's what you have to look
I
at.
don't
Is it
think there
cost
is.
effective?
Do we have the ability to spend time trying to find a transition for these people or other avenues?
We were doing a year ago.
Well, we gave direction not to take any new clients. We did give that direction. Do we not, or am I sleeping
recall.
somewhere?
I don't remember that.
I don't recall
I
receiving
thought
that.
we were phasing it out.
I was
when
gonna say,
we first had this discussion, there was a discussion about a phase out, funding for the year with a phase out.
We did. We said there was a phase
I think
out.
everyone forgot.
When we
We gave
funded
them
it.
extension too, instead of immediate action. It was going to be extended through the rest of the
Right.
So,
time frame.
I mean, if the consensus is not to fund it beyond the year, I think we owe it to try and come up with some alternates, or at least spend time researching where there's going to be options for
Has there
the
been
clients.
has there been any research towards that from the administration?
When we, when we brought this item forward during the budget process, we had talked about phasing it out through December of '25. The board did not talk about not expanding, that those directions were not provided. It was for Joe to come back, which he did at a previous meeting, and this is a follow-up to that meeting to get direction from the board. I would suggest that if you don't plan on funding it in the next fiscal year, that you begin the transition now for the duration of this time. And we would have to work with those providing, that we're providing care to see what other methods or alternatives are out there. But that would be the direction that we would look for you today to let us know if that is the case, so we can start working on that and come back to the board with what that plan looks like before we implement it.
Well, we can't vote. We can't vote here today. So do we bring it back to the meeting after this? What do we do?
If the
Well,
board,
it's a budget. I mean,
You
so
want a
we just won't
consensus?
fund it in next year's budget.
But how
So-
do we give him direction if we don't
Consensus.
know what the vote's going to be?
you can provide consensus verbally
Consensus.
today, and then that way we'll know whether or not we're going to include it in the budget or not. And if we're not, what we'll do as an action item is come back to the board, either at a workshop or a board meeting, provide to you what that strategy or that exit plan looks like for now to the end of the current fiscal year.
And then we have a chance to change our mind again.
That's going to be up to the board, but at that point, we're already going to be coming up with a plan to dissolve it. So we were looking for direction today as we start to work on the budget, and we are looking to unwind things that either are not required of county government or become a financial liability that you're not going to have funding to cover.
So would that be at this time?
It's
or-
painful, Greg. It's
I know it
more than
hurts.
painful, Greg. I know. But the data is there, the information's there.
If that's where we're headed, then I'm going to very strongly suggest that there be no talk or consideration of follow-on,
Of what?
of any type of follow-on assistance. Because if you offer,
You have to.
Yeah.
then you've opened the floodgates to anybody in the county to come in and say, oh, I want help.
Yep.
Give me help for daycare. I want help. So I strongly suggest if we do this, we do it. We cut it, that's it.
Okay.
No more dollars going for this program. And I got to tell you, that pains me. That really
does.
pains me.
So we continue, so is the consensus to continue funding through fiscal year, and that being the transition plan that they have till the end of the fiscal year to find?
That's what it sounds like
Well,
to me.
if the consensus is to not fund it next year, then that's on them on how they phase it out. I mean, that's not us. That's not our job.
It gives you that time to phase
Right.
out from January, what are we, January?
We have employees, we have,
Yeah.
I mean,
Right.
Right.
And if employees have another spot somewhere, then we need to be flexible, or the administration needs to be flexible on letting them go when they can with a backup plan. I mean, I don't know. I don't know. We can't fall in a situation where we have more clients than we have staff. Then what do we do? I guess you're going to have to bring in the alternative.
My suggestion would just be to set a clear end date of services.
Yes.
And that gives both staff and clients a projected timeline. They can plan towards that.
Okay.
We can work with them on our case management team to bring in home care.
You can assist them. So here's the
Not
question.
pay for it.
If we were to do that right now and discuss it and finalize today at some point of this meetings to decide that, where was I going with that? Where was I going?
your
Well, I
end
think
date
we've
would
got
be your fiscal
consensus.
year.
I
Yeah,
think
we've
we have,
already
Fiscal year.
budgeted through the fiscal year.
yeah, I
Yeah.
think we have consensus, don't
Yeah.
we?
Yeah.
To shut it down.
Fund it through the end of this
The end of
fiscal
this
year,
Through 26.
right?
Which is what we
Doesn't sound
agreed
like
to
we're
in
funding it
December.
in their upcoming budget discussions.
We discussed that last year. We did discuss it in
We had
December.
to go through this exercise. We had to go
Right.
through this
Yeah.
because
Yeah.
we had to see the data. We had to see it.
So do we need the motion? How do we go from here? Ann?
Can't at this meeting. It's just a
Oh,
consensus.
just a consensus.
Okay. So the consensus is to end the program at the end of the fiscal year. Concur.
Do you want to voice that?
Yes. He knows how I am on these very important topics. Can I have a consensus discussion? Mr. Dance?
Yes.
Ms. Carney?
Yes.
Ms. Richardson?
Yes. Mr. Gregg? Sure.
Sure. All right. Thank you, Mr.
She
Haggisford.
gave an S. Thank you, Joe.
I'm going to open it up for public comment. Adult daycare discussion, 30-minute time period, allowed up to 3 minutes. Please state your name, Mr. Royer.
Raymond Royer. I would agree with Greg.
Well, there's no joy in any of us doing this, so.
No.
Right now, you don't even know where the taxes are going for property taxes. It's just it's thrown all over the place. I mean, my understanding, the House put 4 proposals on the bill. The Senate put 3 proposals on the bill. So we don't even know if the bill is going to even make it to the election at this point. So.
Or any of them giving us more money?
No, but
Okay.
what I'm saying is, this program that he's providing, you could put a face to it, and you know, we help our animals. Maybe the county has to work a little bit better too to help this program. We got churches out there, you know. I mean, there's probably over 100 churches within this county. We should maybe outreach to them. You know, get the donations in. Joe is doing enough as it is. For you to ask him to throw another life preserver out there is crazy. He's doing so much. I served in the Navy, rescue swimmer. Fighter. Don't give up on this program. I know you've already voted, but reconsider. Like I said, there's people, faces, I can see faces. I've been at that facility. There's people that are falling through the cracks that are using that facility. Thank you.
Thank you, sir. Any other comments from the public regarding adult daycare discussion? No, seeing none, I'll bring it back. Moving on to item 8, fiscal year 26-27 budget capital improvement plan discussion. Is that you, Ms. Petito?
I was going to have Mr. Sales cover the capital improvement plan, since that falls under his purview, and then we'll start with the budget discussion.
Okay, thank you.
Well, good afternoon, Commission. Chair Pennington, Vice Chair, Commissions. We'll go ahead and get started on a capital improvement plan and discussion. And I just recognize you guys have a tough job, and that was a pretty tough discussion. I will apologize in advance for the number of slides. I know it's been a long day, but we'll try to get through as quickly as possible. There's a lot going on, and that's a good thing. The agenda today is a capital improvement update, and then followed by the policies and funding priorities for the upcoming fiscal year. The capital improvement program Mr. Mengel alluded to this a little bit ago, but one of the things he said was how it provides priorities for the staff. And one of the things I'd say about the CIP is it provides a clear schedule for staff, our private partners, and your constituents so that everyone's on the same page. The county's vision is to make Flagler County a vibrant and prosperous community with a focus on exceptional quality of life. And in that strategic plan, to achieve this vision are 4 focus areas. The effective government, which is provide an excellent customer experience and maintain fiscal financial stability. Economic vitality is promote and market Flagler County as a desirable place to live, work, and visit. Growth and infrastructure, provide quality, fundamental infrastructure, protect and manage natural resources. And our public health and safety is to improve public safety response and service capabilities and expand behavioral services. And you'll see that theme throughout all of the CIP projects. Public health and safety projects. When we work on the CIP plan, there are several considerations, and this is a list of the considerations. So a lot of what you all been discussing throughout this meeting surrounds these considerations for the CIP plan that we bring forward to you each year for approval. The first is, and foremost, is public health and safety, which is regulatory compliance, strategic plan alignment and board priorities, which is what we're seeking today, fiscal responsibility, which is what we've been talking about all afternoon, growth and efficiency, infrastructure condition, community needs, economic development, and the urgency of the project. And I'll start out with roadway. County Road 205, widening and resurfacing. This is phase 2 of that project. Approximately 2 miles of roadway and drainage improvements along County Road 205 between State Road 100 and Private Road, which is roughly about 2 miles. Currently, the project, after being on the shelf for about 9 years, is awaiting construction due to funding, is finally moving forward. The roadway conditions deteriorated so that the surface was no longer viable and conditions as a segment required reconstruction. Currently, well, one other thing about this project is County Road 205 operates as a bypass connector. This bypass helps facilitate the movement of traffic around Bunnell during emergencies or evacuations. It's a heavily traveled road by commercial, industrial, agricultural traffic, making it an important economic roadway within the county. Construction of the second phase is to be advertised the first quarter of 2025. And from a project funding perspective, that construction is being funded through a state program at roughly $3.1 million. Local match is anticipated to be $868,000. Currently, we have budgeted in FY26 $500,000 towards that project. Jungle Hut Road resurfacing. This project consists of paving of approximately 0.75 miles of roadway. It includes paving, grading, stabilizing the shoulder, siding, signage, and pavement markings and associated stormwater improvement. Jungle Hut experiences a significant degree greater traffic loading than other normal nearby paved roads. It serves as a convenient local roadway that allows for motorists to gain access to Hammond Dunes Parkway and the beach parking at the eastern end of the roadside of the road. Aside from local vehicle traffic, the road also serves the Hammock area wastewater treatment plant and has been used as a primary access for truck haul beach projects. It's a pretty significant project. Current state of the project is design schedule is due May 2025 through February 2026. The design is funded at $120,000 and the construction funding is to be determined. At this point, it's anticipated FDOT is 75% and a local match 25%.
Can I ask you a question on the previous one? I'm sorry.
Sure.
If you look in the capital improvement for 26 through 30, for 2026, there's 4 million for County Road 205. It says it's coming out of the gas tax. Is that correct? Is it still coming out of gas tax?
Funding for 205?
Yes.
The match is a state it's a state county funded, and the local match of that is 25%. You know, this is one of those projects that was started back when we were a fine county, and at this point, we're not. I think Brian is coming.
Hi, Brian. There you go.
Brian Eichenberger,
Hi, thank you.
Financial Services. So it's grant funded, but the grant is in the gas tax fund. So the local portion would be
It is a
paid from
grant.
market.
Okay, thank you. Thank you, Percy.
Next one is Forest Park Street and County Road 305. This project consists of design for paving of approximately 3.2 miles of an existing unpaved roadway. It is in District 4, and the current status is the engineering team is working on the 60% design. The project right now is funded for design only, and that's at $442,000, and the construction funding to be determined is with an anticipation of a 75% state funding and 25% local. At this time, though, unlike the other projects, it is not presently programmed in the FDOT's construction budget. Malacomper Canal Restoration and Resilience, and this is moving over to stormwater. As you all know, I think we've received quite a few emails from the Commissioner Hanson about the Malacomper flooding in that whole area, and this has been an ongoing area since 2016. But this project includes design and permitting for restoration and resilience improvements of approximately 4,100 square feet of the Malacomper Canal from Intercoastal Waterway to the eastern terminal limit of the Malacomper Road. Current status of the project will be phase one outfall channel and box culvert equipment. Replacement at $4 million, and the remaining $8.4 million will be for the eastern segment of the project. This project is part of, as I mentioned before, the regional drainage plan that was adopted by the county, previous resolution, and at this point, it does qualify for funding in terms of assessment and local funding. Next one is a First Avenue Phase 2 drainage improvement. This project here includes design of a roadside drainage system for First Avenue due to the flooding in the area. The project construction will consist of construction of a drainage conveyance well with segments of stormwater and associated drainage structures. Current status is the design team developing 90% design documents, and the document schedule is September 25 to February 25. The overall, they're at the 90% mark on it, so just about done with that. Funding for this project is design is $57,000. Construction funding is to be determined, but there's $500,000 included in the FY26 adopted budget for stormwater projects.
Pardon, can I just ask, is that supposed to be, is that a typo, February 2026, or is it?
Yeah, it's February 26th.
Yeah, February 26th.
Just a typo, right?
Yeah.
Okay.
So you all know the history behind this, right? We built it, it didn't work. Okay.
That's a good answer.
Well, we're going to fix it now. Trails and parks. This is a River to Sea Preserve new restroom, and this is installation of one ADA compliant parking space, improve overall parking, construct one new ADA accessible restroom, and it's hurricane rated. It's going to be funded through impact fees. It's in a budgeted for $125,000. This additionally is to establish additional beach access parking to assist with the critically eroded funding requirements for the beach.
Where is it located? Where is it located? River to Sea. Oh, I know where. I know. Up near Marineland? Yeah.
Malacompra Disc and Golf and Restroom. This is construct a new ADA restroom with an 18-hole disc golf course, establish additional beach access parking to assist with critically eroded funding, similar to the other one. At this point, this project was funded in the FY20, I think this was a capital in FY25, 24. Where we are with this is the schedule needs to be determined, but what we need is public outreach for this project. Apparently, we're up there clearing this area, and we recognize there's going to be more community outreach needed for it, and we'll be reaching out to the District 2 Commissioner to arrange those. But this came through feedback from the Joint Parks Master Plan conducted with the City of Palm Coast.
I'm a little confused about this. Because I don't remember us ever approving this or anything like that, right? I can't hear you, I'm sorry.
Oh, I'm sorry. Yes, we did. We did. It's been
What, a year
probably
ago?
a year and a half, a year.
Yeah, it was, we did the
Might have
big
been
survey.
right before you.
It might have been
May
way
have been
before we
right
got
before
it
you.
on, that's why I'm asking. So it hasn't been discussed since then?
Well, it's been voted on.
It was on, it was voted on?
It's been funded, yeah.
Yeah.
This has been probably
They funded
before
it?
them.
Okay, I don't remember that. I must have been absent that day.
I think it was before you came to.
It was when we did that big Parks and Rec survey.
Yes.
And this came out.
And that's probably
is part of
before
it.
these
This came out
commissioners.
as almost everybody said, hey, we got to have that, okay?
Do we have a usage? Do we have anything matrix to show value to it? Other than people saying, I'd like it? Is there any demand on it?
Yeah, this was community feedback that digging what the services would be for this park. This wasn't staff driven. But if you look at that picture there, that frisbee golf is what they call it.
Yeah.
That came out of the study, and there's like some folks that are. Matter of fact, we have a couple staff members that are really into this frisbee golf here kind of thing. And when the feedback from the community was this was a need, and it's a passive recreation that could be done at this park.
So this is more than just the disc golf. This is a new restroom facility and additional parking for the beach.
So we're building a
being
structure
created,
besides this.
and it's coming out of the funds over
So
there.
it's
for the-
joined with more of facility rather than
Right,
just
we're
a
getting
park.
new restrooms, new parking facilities,
Okay.
which I
Wanna
think
make sure
helps
it's
for that
used.
beach area in Malacompra. And then it happens to have an 18
Okay.
disc
It's
golf.
an
But the
assistance to
cost is all-
Malacompra's
Right,
development.
right. They're redoing Malacompra Park.
Okay, just want to make sure it's going to get used
Could
a lot.
Could I request a more detailed update? I would like a site plan, a little bit more looking at what the overall improvements. I mean, I can do that on my own. I don't have to have it come back here, but
I'd appreciate seeing it as well, so I think that they should, really.
Yeah, why don't you send us a site plan?
We can do that. We actually will
Five
talk.
of us, that'd be good.
Yes, we
Make it a
can
little
do
bit
that.
more understandable and reasonable.
We're going to need that site plan when we go out and try to do the community outreach anyway, because just like you all folks are going to know, what does it look like? Well, what does the trail look like? What does the course look like? How is it going to impact? So, yeah, we'll do that.
Fantastic. Thank you.
I'm good with some of the other amenities, the infrastructure that's included in it. First glance is it's a nice to have, but we need the other components. Okay. So I would like to just get the entire look at it of all the infrastructure and everything. But yeah, you can send it to us. Thank you.
Yeah, to help with the critically eroded funding requirements is key.
Maybe we should relabel it or retitle it.
Right, because really what it is right, it's the additional parking and all of that they're putting in there.
Well, all I see is restroom and disc golf. So
Oh.
I don't know there's a restroom.
I think it needs a price breakdown for you to understand the,
Needs a little PR.
yeah,
Yeah,
we're not paying.
comprehensive understanding. Next.
Okay. Bing's master plan improvement. This is the site plan for future improvement to Bing's Landing. This will include improvements for activities and passive recreation and have archaeological and historic components as well. Right now, the status is the master plan is 75% complete, waiting for details on size and placement of the new restaurant and the Malacompra Canal expansion project. Tonight, on your agenda, there will come for consideration the acceptance of a fine grant that will increase the amount of funding. Right now, it's at $500,000. That will increase the amount of funding at Bing's by $452,000 to include that fine for a total project cost of $952,000.
But that's for dredging, right?
Part of it.
Does a couple things.
Yeah, there's a couple things in that, but renovation of the park, dredging, and obviously the new restaurant and those kind of things like that. So there's several things going on in that park.
Yeah, but we never saw the master plan.
It's not finished yet.
Not done.
That's why.
Yeah, it's
Only 75%
about
done.
75,
It says right here, master plan.
Oh,
75% complete.
wow, that's been, yeah, we were running then. That wasn't even, it's been well over a year and a half, yeah.
Yeah, that
We
was.
lost the guy that was in charge of
Right.
that, yeah.
Can you go back one sec? I had forwarded some comments from a gentleman who's very in tune with the archaeological component of the park, and I think it's been integrated into the master plan. I just wanted to make sure that those issues have been forwarded anyway, and maybe some of those concerns could be addressed. A lot of it had to do with signage or clarifying signage.
Some of the information we had readily available, we actually scheduled a meeting with the gentleman, and he did not show up.
Okay.
So other than some of the signage and some of the obvious things, we did address, but if he had additional comments, he didn't come to the meeting.
Okay, thank you.
The agenda item tonight covers funding for that dig. There's money in there too. I forgot if it's just the roof or signage or whatever. But we're voting on that tonight. Give some money to that.
What you're voting on is to accept the fine grant tonight. Yeah. The Lehigh Graham Swamp Trailhead. Graham Swamp Trailhead and Lehigh Trail near the south end of the pedestrian bridge at South State Road 100. As planned, the trailhead facility will include an access drive, connection between the trailhead facility to connect with adjacent trail facilities, estimated total of 18 paved parking spaces, stormwater improvements, and a small restroom building. This facility will augment the existing similar function facility located at Colbert Lane. Status is the project design began in the first quarter of 2026, and construction is expected to be completed in 2027. Project budget is $220,000 for design and permitting, and roughly a little over $1 million for construction.
I don't have that slide.
Bulow Creek Headwaters Regional Park is an 1,800-acre preserve for passive recreation. At this point, it's designed to be a passive recreation, possibly including paved roads, multi-purpose trail, and trailhead, restrooms, picnic, and parking area. The status is The planning efforts are progressing under contract with Kimberly Horn and Associates. There's been a lot of community outreach, and the next community outreach public meeting will be a workshop at February 3rd, 2026 at 4 p.m. in the BOCC chambers. Project budget is $569,000 for planning, a little over $1 million for design, and the construction funding is to be determined based on the features of the project. This is shared use trail on Old Kings Road South. This is a 12-foot wide asphalt trail, shared use park that will be for bicycle and pedestrians along Old Kings Road South from Flagler, Volusia, up to roughly State Road 100. It's anticipated design to be completed September 2026, and the construction phase will transition in 2026 to 2027. The budget design is $534,706. Funding is programmed at $2.5 million in FDOT FY27 for construction, and a local match will be required. Construction is currently estimated at $4.8 million. Vertical projects. Fire Station 51, that's the fire station located at County Road 305 near the intersection of 100. It's the West Side Station. What's unique to this station is it's going to be the prototype for any future fire stations, save the next Station 50 we'll be talking about, because that includes the administration. The project cost is $10 million. It was funded locally. The substantial completion is expected in November 2026, and we had our groundbreaking in December of 2025. Fire Administration Station 50, it's roughly a 19,000 square foot fire administration along with the fire station. The groundbreaking for this station was held on November 13th, 2025. Contractor is mobilized. If you haven't seen it, it's just across the street. There's a lot of dirt being moved around. Substantial completion is planned for December 21st, 2026, and the project was funded by a $10 million grant and a little over $4 million local funding. SMA Receiving Facility, it's a 24-hour, 2,300 square foot central mental health receiving facility. It's a 20-bed integrated stabilization unit and men's substance abuse residential with men's substance residential beds. The design will also include construction on site, storm drainage, and other site utilities. A groundbreaking on that was in November as well, and substantial completion is expected November 20th, 2026. $14 million is the total cost, $10 million from a grant, and $4 million funded by SMA Healthcare. The Visitors Eco Discovery Center is an approximately 10,000 square foot facility to serve the county and the region with ecotourism opportunities and to create access and elevate awareness of the county's vast natural areas and resources. The design build team proposal for conceptual design is at about 30% schematic and is under review. Expected completion of construction is the fall of 2027. Budget cost is $10.3 million, and it's funded through tourist development. The multi-purpose preparedness facility is a storm shelter facility and exhibit hall, which includes a 16,697 square foot dividable main area, kitchen, storage, restrooms with shower, and an external area with a generator and outside HVAC equipment. This project was originally capacity was 10,000 square feet. It had been increased to 16,697 square feet. And it features disaster equipment area in the rear of the building for parking of RVs and that type of thing. Expected construction completion is June 30th, 2026. Project budget is $10 million, and it was grant funded. And I think either Heidi or Jonathan sent you guys out a flyer on the timeline on that project so we can keep the stakeholders in that area because there's many updated. Station 40 expansion. This is the station in the north part of the county. It was, the original scope of work was to construct 2 additions to Station 40 and a freestanding fitness center, and also install a fire sprinkler system per NFPA codes. Its project was broken into 2 phases, and phase 1 is roughly complete. That was 2 office spaces and a facility to store firefighter gear. And what currently is happening at that station is, if you take a look at the lockers on that top picture there, those are gear storage lockers for the firefighters. They were in the bay and they were commingled with the engine exhaust, which is a no-no from a safety perspective, health and safety for the firefighters. Now they've been relocated into their a separate facility. We've also taken care of that in the station near the airport, and then with the construction of the 2 new stations, which I just talked about, Station 50 and 51, we won't have this problem anymore with commingling of diesel exhaust and gear that the firefighters wear. So that's phase 1. Phase 2 of that project is a freestanding fitness center, and right now the trusses are on site. Just got to find time with General Services to complete that project. You know, they have so many competing projects. This just hasn't gotten to that priority yet, but it will, and we'll schedule out and get that done.
Percy, when was I didn't see any sign that they're going to put in the sprinkler system.
The sprinkler system is a part of phase 2.
They built a fire station without sprinklers.
Well, that was prior to the code changes and those kind of things like that. Our fire marshals on our case each year in regard to not having a sprinkler system in the facility. So it is a part of this project, and I can assure you he will not let it go without a system. Mr. Dixon's ensured that it will get accomplished.
You just need to put it in either phase 1 or phase 2.
Understood. Yes. Bull Creek Restaurant. This is Flagler County is building a new restaurant storage facility that is elevated and in compliance with current building codes, elevation requirements, and install a floating dock system so they can restore the service and revenue generation to Bull Creek Fish Camp. As you can see the pictures there, there's a lot. If you look at the dock there, that the concrete foundation is fully poured, which is in the picture there. The kitchen is on site. The retaining wall has been complete, and the floating docks have arrived. So where you see the gentleman standing out there on those wooden piers, that's all going to be changed out, and the docks are there on site. The grant on this is, I think most of you all know, we have to get all of the items purchased by March of 2026, which we're working on. I think we have a purchase order in for the metal structure out there, and the project budget is 1.5 million, a little over, grant funded at 1.2 roughly. So it is moving forward, and it is a top priority for us. Fireflight office hangar, well, this is the hangar expansion with an office. The expansion of Fireflight, the hangar, right now, if you haven't seen Fireflight, their office space is a modular unit that's in the bay of where the helicopter sits. The fire marshal has heartburn with that as well. So we're working on expanding that hangar space, 3,000 square feet office space to include dorm rooms, a training room, a crew-ready room, a kitchen/dining area. Right now, the status is it's a conceptual plan. Engineering has taken over this project, and we currently have it budgeted at $350,000.
Is that where we had the ground opening, the ground digging to the right of that, correct? To the east of that? Is that the hangar you're talking about?
Get groundbreaking for
For the new airport building?
near that.
It's east of that, I mean, west of it, just west of it, right?
Yes.
That's the hangar you're speaking of. Okay, thank you. It looked like it, I just wasn't sure where it was located.
If you ever want to take a look, Todd is the pilot out there, and he will love to tell you all about that helicopter.
I know.
So-
I've already heard.
Oh, you have? Okay, all right.
I just want to know where the hangar was, where it sleeps.
Yeah. You will leave there much informed about helicopters for sure. The 4-H barn project, this is in conjunction with the emergency preparedness shelter. The project itself is the installation of new ADA accessible barns for the 4-H club at the Flagler County Recreational Area. Currently, that's the concrete pad. It was poured on December 29th. Project budget is $240,000 in impact fees, and it's moving forward. Airport projects. I think you just mentioned, Commissioner, about the terminal there. So this is an update on that. The airport terminal building.
Wow.
Yeah, it's moving along. It is a new airport terminal. It's a 15,500 square foot facility, and it will replace an existing 40-year-old metal building, which has outlived its useful life and will include related parking, roadway access, and a roundabout site work and demolition of the existing administration office. Project status is it's under construction and progressing well, and the project budget is $11,175,617.
Which it doesn't state here, but the bulk of that was state funds,
FDOT.
grant, right? Not grant, sorry, legislative.
Was it legislative or
Legislative. 10 million. And the other portion comes out of airport enterprise fund.
All right. Well, I'll update it with that then.
No, I just wanted to put it out there for those watching.
Airport wilderness fence design. This design project includes plans to replace the current perimeter fence and adding a new wildlife fence based on the 2016 Wildlife Hazard Assessment recommendation. The design will not include fencing at or near buildings, parking areas, tenant enclosures, or other non-airfield perimeter areas. Current status is at project is progressing towards the 60% design submittal, and the budget for this project is $213,000. Airport fuel facility design. The new fuel farm facility will be constructed on the south side of Taxiway A, directly across from the existing facility. The new location allows for future expansion, doubling the storage capacity to 20,000 gallons for the 100 low lead and Jet A fuels, and includes parking for fuel trucks and a restroom facility. The contractor consultant on that is Avcon, and is working on the scope of services for this project. Budget cost is $400,000, and it's moving forward. Airport taxi lane to T-hangar design. This project includes design services for the reconstruction of taxi lanes serving T-hangar buildings A, as you can see on the picture, B and C at the Flagler Executive Airport. The red area denotes the taxi lanes that will be reconstructed. AFCON, again, is the consultant and was issued a notice to proceed on December 15th. And they're currently working towards a 30% submittal. Project budget is $125,000. The airport master plan update. The forecast information used in the airport master plan will be to determine existing facility capabilities, identify any deficiencies that the master plan update needs to address to meet the airport's needs for the 20-year planning period. Currently, the consultant is working on the initial development of a working paper 1, which includes Chapter 1, background and airport settings, Chapter 2, existing conditions, Chapter 3, aviation activity forecast. Project budget is $696,880. Capital preservation projects, which there's 2 slides and there's several, so I'll just highlight a few of them. In the discussion we had earlier there, the 2 on this is the HHS services. Is this on this slide or the next one? Next slide. Got them out of order. Just highlight a few. The Wadsworth Park Electrical, that's currently in process. We've done quite a bit of work out there recently, and this is going to be continued. The other one that I'd highlight on here is the roof replacement for the library. That's budgeted at $473,000. Mr. Dixon shared an update and said that they evaluated the roof. It does not need to be replaced. It can be recoated at a cost of about $150,000, which is a significant savings from what was budgeted and can go towards other projects. The Princess Pace pool preservation, that roof covering and fence is obtaining quotes and evaluating alternative options. So we will be in further discussion on that. On this slide here, a couple that I'll point out is the HHS parking lot refresh and the HHS repaving of those areas there. We've kind of held off on those 2 projects pending what the board had to discuss today. So based on that direction, we'll reevaluate what the usage of this area will be as we've decided, kind of gotten consensus that it won't need to be for the senior services anymore, any longer. The couple other projects on here of note is the expansion of the EOC. I think when Heidi and I were meeting with the commission on our one-on-ones, someone mentioned, I can't remember which one of you, but one of you alluded to the fact that, hey, we just took over the dispatch services and we're already expanding the facility. That was a pre-existing need prior to them coming underneath the county's umbrella. The folks in the dispatch center are really bursting at the seams, and this will help. And what will happen is the EOC has 2 training rooms, training room A and training room B. The training room A side will now be a part of the dispatch center. Going to take that wall out and push over, so you'll still have the training room B, and I might have those wrong. I'm sure Johnson's looking at me going A and B, but either way it goes, there's 2 sides to the training room. We'll expand that out. That project is budgeted at $200,000. General Services is going to do that work as well, and they're scheduled to start. They were scheduled to start in December, January area there. So we will get that expansion. The issue with this project unique is that it's a 2-part project. In order for you to expand the EOC, the dispatchers have to be somewhere. So they're going to go to their Fleet 2 site, which is over off the Justice Lane area. So that site had to be worked on first before you can start construction on the existing dispatch center.
Have we thought ahead about where we're going to hold events that required both those rooms?
That is a very good question. And We, we actually ran into that, and just recently here with I think we have an award ceremony coming up for years of service. It's either this week or next week. I'm looking, is that this week?
Well,
Yeah.
Pam brings it up, the Nexus Center is the next logical choice.
We have space now.
Yeah, that's the same thing we thought. So the years of service is this week award recognition, and normally that we thought the Nexus Center would be perfect for that. The problem is half of that, as Holly alluded to earlier, is for HHS, the congregate meals, and that's Monday through Friday. When we come in for the awards banquets or something along those lines, and you bring a full staff in there, half of that facility won't do. So we thought, I mean, this time to make it work, HR worked it out that along with HHS, they're going to relocate the congregate meals to the EOC that day, and then we'll take over the Nexus. But we don't want to disrupt that population continually when you want to use the entire structure. So Commissioner Hanson brings a good point to the table, and I think our solution to that when we want to do day meetings with a full staff is probably using the new emergency shelter out at the fairgrounds. It's a very large facility. I think Jonathan got it up to 16,000 square feet or somewhere in that neighborhood. So
It is a hall.
yeah, so I think we'll have a landing spot by the end of this year. The other thing that we do is bring your child to our work day, and that may be a little tricky, but we'll work through that. These are recently completed projects, and as you can see, I mean, you know, working through this presentation, I thought, wow, we have been really busy. But several have been done. One that's kind of, we have the paving of the basketball court, so to speak, at all of the parks. I had to clarify because it's two of them there, you'll see there, but there's an outdoor and an indoor floor. So those were done. The Nexus Center is open and running. We had a good discussion about that today. We have the stormwater master plan complete. So there's a lot of things taking place. And as you can see, but this list here, it's staff's busy and a lot of projects are getting completed.
May I ask a question? On the Carver Center gym floor replacement, 122,000, in the 2025 project funding summary, it says that the Carver gym was going to be resurfaced. What went from resurfacing to a complete replenishment or replacement?
Yeah.
I think when we went in there, we found that the vinyl flooring that was in there was not able to be repaired or fixed, so it really is calling for a complete resurfacing of the entire floor.
So where'd you get the money? So you had 30 in the budget, and it ended up being 122?
It was part of the capital plan. I believe we updated it to show that reflection when we brought it to the board for approval. So the amount that you see here is what the board approved. So it may have been an adjustment that was missed.
That was for 2025? That was 2025 budget? Yes, I would.
It depends if Percy just mentioned something. We had one that was a court resurface for the exterior, and then we had one that was the vinyl flooring for the inside gymnasium. The higher of the two was for the gymnasium flooring, and it was not able to be repaired. And then we did a resurface on the exterior.
I just don't remember it coming back, that's all. It's an adjustment because it's not what's in the budget. But, thank you.
And now we'll move to the FY27 budget board priorities and guidance. And that'll be the county administrator.
Well, good Good afternoon, and thank you guys for being here. As we begin the fiscal year 27 budget discussions, our first step was to define the board's priorities and policies that guide the development of a focused and effective budget, aligning fiscal decisions with strategic goals, ensuring that resources are directed to the programs and services that matter most to our community. These priorities provide a clear framework for administration as we evaluate funding requests, manage expenditures, and uphold financial stability. Your leadership and well-defined policies strengthen transparency and accountability throughout the budget process, and I appreciate your guidance as we move forward. Here's a look at last year's guidance as we developed the fiscal year 26 budget in alignment with the board's policies and priorities. It's with the board's leadership that we've achieved significant progress, increasing the reserves, reducing the millage rate, supporting public safety needs, and investing in critical infrastructure, including roads, stormwater systems, and our coastal shoreline. Flagler County continues to experience significant growth and evolving service demands, creating both opportunities and substantial fiscal challenges. With our current population of approximately 140,714, we're seeing projections that are indicating an increase to more than 172,000 residents by 2030. The county must prepare for heightened needs across public safety, recreation, transportation, stormwater management, and other essential services. This rapid growth requires strategic and disciplined approach to long-term financial planning. Major infrastructure programs reflect the scale of these challenges. Our stormwater program, which was adopted in 2024, identifies a substantial gap between current funding and actual need. The county has historically invested about $2.4 million annually in stormwater maintenance. The program outlines an additional $14 million required each year to adequately maintain the system. Construction needs are equally significant, with the top 20 of 58 projects that were identified estimated at $85 million. That's an increase of 20% from when it was originally presented back in 2023. Similarly, the Roads and Bridge Program, as reflected in the FDOT Work Program, which was last approved by the board June of 2025, it highlighted the need for increased investment. Annual maintenance needs exceed current funding by about $5.1 million, and then the county's 28 priority construction projects total $260 million, which will be requiring a minimum of a 25% local match because we're no longer ready when we go after funding with FDOT. These obligations underscore the importance of sustainable revenue strategy to preserve mobility and safety for a growing community. And then our capital improvement program, which was adopted September of 2025, it anticipates $10 million in projects over the next 5 years. However, there's an additional $77 million of unfunded capital needs that remain, reflecting the ongoing pressure on county infrastructure and facilities. And then we've got the beach management program, which was adopted in October of 23, which further requires the county to secure funding for 25% of future beach restoration costs in accordance with Senate Bill 636. This mandate will reinforce the necessity of long-term financial planning to protect the county's shoreline and ensure continued eligibility for state support. Together, these challenges illustrate the critical need for strategic prioritization, sustainable funding mechanisms, and continued collaboration between the board, administration, and community stakeholders. As we move forward, our focus remains on maintaining fiscal stability while investing in the infrastructure and services essential to preserving Flagler County's quality of life. When we look at the legislative impacts, we're closely monitoring several proposed state property tax changes that could significantly reduce the revenues we rely on to fund essential services. Some proposals would immediately eliminate homestead on non-school taxes, while others will phase out these revenues over time or create new exemptions for seniors, homeowners, or policyholders. Together, these measures could remove more than $60 million from the county's tax base and limit our ability to keep pace with service demands. The fiscal year 26 general fund totaled $202.7 million. 84% was coming from non-school property taxes. Most of these dollars, nearly $126 million, support essential services such as public safety, emergency response, and some mandated programs. The remaining funds support quality of life services that residents value. Any major reduction in property tax revenue would require difficult decisions about service levels, capital projects, long-term financial planning. We're going to continue to evaluate these proposals and keep the board informed as we assess their potential impact on Flagler County's fiscal stability and service delivery. On Friday, I sent you something titled the fiscal budget planning. It kind of walked through each one of the joint bills that are being considered in Tallahassee and what those implications would be. We're going to continue to monitor that, but I did want to share with you those dollars and what that looks like for Flagler County as we move forward with the budget. Next steps in the budget development, we're going to continue evaluating those impacts, as I said, particularly those that reduce the homestead-based tax and limit future revenue growth. As these proposals advance, the county must assess how shrinking ad valorem revenues are going to affect the ability to fund essential services. A key focus will be on reviewing the role of an MSTU and MSBU because MSTUs are directly affected by homestead exemptions. Their revenue capacity will continue to narrow. MSBUs, which are not impacted by the exemptions, remain a critical tool for funding infrastructure and service needs. However, reliance on MSBU raises some equity concerns as more of the financial burden shifts to non-homesteaded properties. In order to maintain stability, the county is going to need to explore a balanced approach that combines some of those MSTUs with non-ad valorem funding tools, ensuring that essential services remain protected while preserving fairness across taxpayers. This work is going to continue throughout the budget process as staff refines projections, evaluates service impacts, and prepares options for the board to consider. In developing the budget, our focus remains firmly aligned with the strategic plan, evaluating economic impacts, ensuring financial feasibility, optimizing resources, and leveraging all available funding sources. We continue to navigate economic uncertainty with care, working to maintain the financial capacity needed for long-term success. We are committed to maximizing every resource by identifying cost-saving opportunities, improving operational efficiencies, and closely reviewing all expenditures, including the employee health insurance, which you saw earlier today. As responsible stewards of taxpayer dollars, we remain disciplined in our spending, mindful of our responsibility as a coastal community, and focused on strengthening reserves and maintaining sound financial planning. Several measures have already been implemented over the years to reduce costs and improve efficiency. These include introducing evening temperature setbacks in county facilities to lower the electrical usage, installing a water softener at the chiller plant to reduce the pH level of the water, which increases the water cycling efficiency. We added CO2 sensors to regulate outside air intake and reduce energy consumption. We installed photocell dusk-to-dawn sensors to ensure outdoor lighting operates only when needed. We've established an internal insurance fund for properties valued at under $1 million, and we've also outsourced janitorial and landscape maintenance services. These actions reflect the ongoing commitment to responsible management and continuous improvement. Last week, we met with each commissioner to gather input on priorities for the fiscal year 27 budget. These conversations focused on 5 key areas that will guide our planning and resource allocation: Commissioners shared expectations for core services the county must protect or strengthen in the coming year, as well as community outcomes that they would want residents to experience or see reflected in their daily life. We also discussed long-term positioning, identifying a direction that the county should be moving over the next 5 to 10 years. Each commissioner did provide perspective on acceptable or unacceptable levels of financial, environmental, or operational risk. And then we received potential focus areas where additional investment or attention may be needed to support the county's strategic goals. So this is a look at the common themes from our one-on-one discussions. Following up from last week, there were several common themes that emerged. I'm sharing these insights with you so that we can discuss today and kind of get your support moving forward. There seemed to be a common thread of infrastructure needs, stormwater, roads, coastal resilience. There was a discussion about coming up with fully funded plans. The talk about exploring different funding options, especially as we face uncertainty in Tallahassee, looking at MSBUs, MSTUs, dependent or independent districts, even a conversation centered around debt service. We talked about exploring options for consolidation of services, reducing or keeping a flat millage. Then there was also discussion about the need for affordable housing, a swimming pool, and a municipal animal shelter. And that concluded the presentation that I had for you today. Administration, along with financial services, continue to make ourselves available should you wish to have any more one-on-one discussions. And then on February 9th, we're going to have our official budget kickoff for the creation of fiscal year 27. And I just wanted to go back to get a takeaway from the board on these discussions that we had last week. If there's anything that we've missed or anything that you would like included as we move forward. I know it's early in the game. We don't know what the property values are going to do, and we don't know what's going to come out of legislature. But with the understanding that whatever does come out of Tallahassee will go out to the voters, and it won't take effect until fiscal year 28. So it's not going to affect fiscal year 27's budget, but it is something we need to be mindful of as we move forward in the creation so we can continue to save funds.
Well, I have to say something. So we're going to fund an animal shelter and we're not going to take care of our senior citizens? Just a comment. I think the animal shelter is a reach.
The animal shelter is an ask right now with the city of by the city of Palm Coast for legislative funding, correct? That's where it's at right now. They're asking for funding.
I fully support an animal shelter if they come up with
the funding.
Not
Management.
one penny
Right.
of our money.
Well, we already pledged funding, correct? 500. If the state, it's a match. We've already pledged a match previously in a previous meeting. Correct?
And we're due to come back to a joint workshop with the city and the county. I believe it's the end of January, maybe it's the 28th or 29th. But the ask from the city to legislature was for a $500,000 appropriation. They asked if the county would pledge the match, and then they would utilize land owned by the city to potentially put a facility on.
I don't know if it belongs here in this discussion, but I know Ms. Petito mentioned ESL would need to go out to referendum possibly in 26, so we need to
2028.
For 2028.
It's going to be for 2028, so it'll be on the presidential election.
Okay, so we're not this year. I don't know why, but even Mike used to say we should probably get it out earlier to okay, never mind. Anything else? Let me start down here.
I have to piggyback Greg and make sure everybody is fully conscious of what additional costs are going to go into animal services in light of some of the other decisions that we're making, especially looking past potential property tax cuts. I don't want to over-commit ourselves to what we can't end up funding post-amendment. I think a lot of what I talked to staff about was consolidation and alternatives to, I think with MSBU's, in making sure that we can fund our emergency services and police, trying to make sure that there's dedicated funding streams outside of property tax. I think everything is got to be really on the table in order to be as efficient with the funds that we're going to be left with post-amendment. Yes, sir.
I agree, but I think we're going to have to do a public outreach, depending on what year these things get in front of the public, referendum type thing, which one of those things survive, is the impact of the MSBU, MSTU on the people of Flagler County.
Yeah.
So you don't have to pay property tax. Whoops. Now the people that were renting and the people that were, and the businesses that didn't have, now they have to pay another tax.
Oh, it's going to have to be studied. It's going to have to
It's
be.
unbelievable, yeah.
Yeah.
Yeah, but I worry that the voter's going to say, oh, no more property tax, when we're going to replace it with something else, an MSBU or an MSTU, to get enough money to run the county. We're going to have to. So I just worry that the golden thing sitting out there, no property taxes. Whoa, hold it. There's going to have to be some education done. And God forbid they come up with the no property tax issue. They come up with something a little more sane. But they're going to, the public are going to have to pay for the services we provide, and we provide all the services. The county does.
I mean, a lot of doom and gloom today,
There is.
obviously.
Yeah.
We won't know exactly what is happening over the
Quite a
next
while
couple
yet.
months
Yeah.
when they narrow it down and start looking at the fiscal impacts of
Yeah.
what they're proposing. But everything, all the instructions we're getting from FAC and everybody else, the small counties, is to be prepared, have those discussions and
That's
get
what
it
we're
out there
doing
to the
now.
public, right?
That's what I'm saying. We need to at least get lined up on the priority so that we can do an MSBU or we can do an MSB if we have to. We need to get that paperwork done this December just to get it in play, just so. And then there's the consolidation of services in the county, like the fire departments and the police departments and the things that could be consolidated to save money. There's a lot of things that we could be discussing with our cities out there, but and it may come to stuff like that. We may have to do that. So
I just want to say the word on the top of this page is discussions. These were their discussions with each of us, right? So nothing is put in stone on any of this. I just want everybody to be aware of that.
Oh,
It was
exactly.
suggestions and discussions, right?
Right.
And from what I'm reading from Tallahassee is there are going to be many options, but not as many as there were before. They started with 13, something like that, and down there about down to 4, and now I think last I saw they were down to 2, but it's going to be what it's going to be whenever it gets there. And then the voters will have their rights too. So I think it's hard to us to even guesstimate where we're going to be.
Even if the legislature decides on one option,
Yeah.
they can't implement that. It's against the law. So it has to go to the public.
Right, I'm saying, and then
Yeah, it
they're
has
going to have
go
to
the
have a
public.
referendum, exactly. So education is going to be paramount, and that's not anywhere on this discussion. Marketing, education, commercializing, and explaining. FAC had a great Andy, you were there when you saw the video too. Have you seen it out anywhere, or is that for something later on?
No, there's a dedicated website. I don't recall off the top of my head. I can find it and share it with everybody.
I Wish. No, was it called Wish? No.
Is it a fact presentation?
Yes, it was a fabulous presentation. It discussed what services you get because you pay homestead taxes, taxes. And then it goes into what you will lose if you don't pay homestead taxes. And it was astonishing. I wish they had sent that out to everybody to use. It's a wake-up call for the public, really is. And it would assist us a lot if we could get that and put it out there a little bit more.
We'll go to public comment on this, and then we'll come back and give any direction to Ms. Petito. I'm opening up the fiscal 26-27 year budget and capital improvement plan discussion up for public comment. Anybody like to approach? Let's say, Mr. Tanner, would you like? Do you have a?
Yes, ma'am, but it's not on the budget.
Nope, I bet it isn't. So we'll go ahead and.
So sit back down?
Yeah, that sounds like a plan.
I'm good at that.
So we'll go ahead and close that out. Ms. Petito, what do you need from the board? Any direction on this specific today?
Well, as we start to craft the budget kickoff, which is going to take place, I believe it's February 6th, we're going to need some guidance, direction from the board on what you would like the message to be to the constitutionals as well as staff, because when you look at what's being considered in Tallahassee, I shared it in the backup on Friday, 84% of our current ad valorem supports the constitutional offices, our public safety, and just the core services of Flagler County government. If you look at the homestead exemption that's being considered, it would be a loss of 47% of what we get today. We're ranked, I can't remember if it was number 5 or 6, but we are a really strong community when you look at the number of properties with homestead exemption. So it would hit us severely. So just putting it out there, not to be the doom and gloom, because we don't know what's going to come and what the voters will vote for, but I think that we need to have a concerted plan and need direction from the board. If we're going to evaluate different options for revenue, then we need to include that in the budget so that we can hire consultants to look at what makes sense for us, if it's independent districts, whether it's MSBUs, some other sort of fee or an assessment. The TU, as I mentioned, the MSTUs, because of their link to property values, with that homestead exemption, those TUs would only apply to non-homesteaded properties or businesses, which would be a little bit of an equity issue. But we do need direction from the board on moving forward, what you want us to explore and look at.
Did the version of the bill that is being considered, I thought it was only if you owned your home outright.
They had several different scenarios when you look at each one.
If you had a mortgage, you don't own your house. I mean, let's face it, the bank has got just as much right to your house as you do, your property, right? So I didn't think that this homestead thing was going to go to all homesteaded. I thought it was the ones that just owned their homes outright.
I don't believe that that's the current language that
I don't
they're
think it's been
considering.
narrowed.
No, it's not that.
That was taken out.
No, I don't think it's been narrowed specifically to that.
I heard him talking about, I heard Renner, yes, somebody, it was either Senator Leak or somebody was talking about it, that it's really, the government's not infringing on your ownership if you don't own it. I mean, they have to own it outright. If you own your house, right? That's the whole idea, is that the government can't go after and assess you on something that you own. But if you have a mortgage, you don't own it. You mortgage it. So that didn't go through, and I know I read something on that as well. All right, so this is everybody that's homesteaded. No. All right. Well, I don't think we have any other choice than to start looking at what an MSBU would look like for at least our portion, which would be fire rescue, right?
We had started that conversation a couple of years ago, prior to you joining the board.
We
Yeah,
did.
we even talked about an MSBU for the sheriff.
Yeah,
you know,
we just,
Split him out separately and
Yeah.
split out the firefighters separately.
Right.
Yeah. But all my comment is we need to get the stuff in place by December so we can do these things.
Right.
The only thing is with the taxes, you can't touch the school board and you can't touch what they were talking about, and the police. That was in that, in every one of those is, it would not affect them.
Well, why would it not affect fire if it affects police? Doesn't make sense. Again, this is too vague for me. I'm not following this tight enough. I'm sure we'll hear a lot more about it when we go there.
Yeah, I don't think we need to follow it until they tell us.
Right. I mean, I don't have
Week
that much
away.
time to spin a wheel and decide where it's going to land. I think we just need to stay with the same direction. Look for efficiencies. Stay with your flat millage, or if you can reduce it. Constitutionals are going to have to hear the same thing. Efficiency, filling position, verification, having a reason to fill position. I don't know. You guys do this every day. I don't do this. It's.
so when I had met with Ms. Petito, I had asked that maybe perhaps it would be best if they take all of the different areas and departments and determine what type of funding they could, if there was no ad valorem tomorrow, right? What's the worst case, scenario, to take and split them up by what they could fall under, MSBUs, TUs? Are they statutorily?
Yeah, that's a
Are you
good start.
statutorily required? Are you, what core service you are, what type of service you are, what
Right.
type of function you are? And then from there, like, would it be a necessary function to keep, you have to keep, obviously? And then what would be an alternative funding source for that if ad valorem was not an
And
option?
is it necessary?
Well, that's it. You have to go
That's
statutorily
Core. Is it a core?
Is it a
support
core value?
services.
And you have to decide
Yeah. Right.
what you can save and what you can't keep.
And then what would be an alternative funding source if ad valorem was not available? Would that be something that warranted a BU, a TU, however, else? Enterprise fund, could it be an enterprise fund, things like that? So it's, and we are probably going to need consultants, obviously, around this, as well everybody else.
And
I
then,
watched the-
and then
did
you've got
anybody
debt
watch the
service. I mean, this is money that we've already spent that we're trying to pay back. So
Right.
that's not going to
another-
fall into anything because it's like already spent.
Behind the eight ball before you get started.
Yeah. So the Volusia County did a workshop on this, if anybody got to watch it the other day. They did not seem to think that it was all going away. It's not. It's not. The additional homestead exemptions would probably come at a minimum. And so, I think it's a good exercise. We had started it. We need to continue on with the MSTU and BU discussion for fire rescue and police at a minimum. Right? We need to go ahead and continue building that out.
Are those the typical ones, Heidi?
There's-
Fire rescue and police? Is that the typical MSBU?
Normally, when you see them for a variety of things, but when you're looking at MSTUs, MSBUs, or what they refer to as like a service district, typically you'll see public safety, whether it's police, fire, EMS. You also see them when you have service districts. You could even have them for a library, you have them for Parks and Rec. It depends on what community you're looking at, but they use them for a lot of different things. They use them for street lighting, they use them for you have assessments typically for like stormwater, if you're looking for a way to do stormwater. So there are a variety of them. I don't know that I would pigeonhole us into just one. I would say the thrust behind putting out that document on Friday was to identify what those core services we have that were required. And it is your constitutional officers, it is your public safety, so your fire, EMS, and then it's the core services that remain, which would be your legal, your administration, your finance, your IT, facilities and fleet because they support your public safety needs. So we kind of identified what you would be left funding at a minimum, which was the 84% of your current ad valorem, and if it were to be reduced, how are you going to make that up? And then the remaining 16%, which are your quality of life, if you still want to have a library, if you still want to have parks and rec, if you still want to have veteran services or public transportation, how do you pay for those? And that would be the exercise of trying to find how do you fund them? You know, if we were to consider assessments or districts or MSBUs, what does that look like? And we may need some of those for some of the primary core services that we're providing when it comes to public safety, for instance. We did, with board's approval, we did have money in the budget to hire a consultant to look at fire and EMS. At the time, we were looking at an MSTU and MSBU. We may need to rethink that and have them look at an MSBU and perhaps maybe a fire district, because the TU is, again, only going to apply to non-homesteaded and commercial, so it would be disproportionate. But we're going to have that consultant take another look at it under a different lens of creating a district.
So then, to your point, you establish a fire district. Flagler Beach has its own fire department. So there's a duplication of services there?
You wouldn't necessarily include them unless they wanted to be included, and then that would open up the conversation a little bit different, but a conversation that we had with some of the commissioners last week regarding consolidation. Are there things that we can do jointly? Are there things that would make more sense if they were combined? When you look at Leon County and Tallahassee, they have...
Yeah, but we ultimately have to provide services to the entire county, correct? Or am I wrong?
Only emergency.
EMS.
Right.
So none of our fire equipment goes to any other fire in this county.
That's not true.
Right.
Because
So we're back up. I know we're back up to Flagler Beach. I know we are.
we have automatic mutual aid agreements.
So we do
closest
away with
unit-
all the mutual aid, and they're on their own?
I don't know if that would be wise. I think that we would have to have conversations with them, whether we'd have to look at how do we fund it.
Yeah, same thing in Palm Coast. We're all mutual at this point.
But we can't levy an SBU or an FTU.
Right, in
on Palm
in
Coast.
another municipality.
Can't do it.
But they're also going to be facing the same challenges that we have. So that's why I'm saying it may make sense for a discussion at least to look at consolidation, where if you have one district paying for it, then it makes sense. and
Probably
then-
by the end of this year. I don't see that happening before budget for this year, but for next year, but it's worth anything. It's worth anything, but I just, if MSBU, it doesn't make any sense. If I can't levy it in another in another municipality, we're cutting out, just like with the beach, with the half-cent sales tax thing. We can't force these municipalities to do this stuff.
No, but you may need to do it and consider some of these, even if it is only in the unincorporated areas. Look
Then
at
unincorporated pays for everything?
No, when you're looking at EMS, that's countywide, so that would be countywide. No other provider provides it. When you're looking at, potentially your fire, we are Bunnell, the city of Bunnell's fire department. So either we need to look at
okay,
the
Bunnell.
interlocal agreement, or we need to come up with a way to capture funding from them.
All right.
We're also the fire department for Marineland, Beverly Beach.
But I think your idea is good. I mean, let's start with the cores, and if the oh God, I'm so tired at this point. I don't know how I'm going to get through tonight. Oh God, if our electeds, constitutionals, they must be hearing the same stuff from their folks, right? They must be getting stuff from all of their associations. I wouldn't think that they're in a bubble here. So they're hearing it too. If we want to come together, we want to talk about it together as a group, then we should.
Their budgets come from ad valorem, and so you have a responsibility to provide them. That's part of the core function of county. I don't know that you can turn their services into, with the exception of law enforcement, I don't know that you can collect differently for those services. I've never seen a jurisdiction that has, say, an MSBU for clerk of court or other, tax collector or property appraiser. I've never seen that. So I don't know that it affects them as much. They are aware of it, but
I think they all have to internally have the same discussion we are about what is core services and maybe what they have expanded or crept into others that aren't core. They have to do the same thing we're doing.
It's a consolidation time for everybody. That's what they've been saying and saying it for the last 3-4 months in the state. How, when, and where is yet to be determined.
So Ms. Petito needs some feedback on how to proceed. So do we want to how would you guys like to see Ms. Petito proceed? Because I think we're all on different pages.
Do you have enough to proceed for February?
I'm going to just summarize, right? So I heard as we prepare the budget, we're going to be looking for efficiencies and areas that we can consolidate resources, working with either a flat or a reduced millage rate. We're going to be looking at alternative revenues, and I don't know if I missed one. Oh, the infrastructure needs that we're going to try to come up with some fully funded plans for stormwater, roadways, and coastal resilience.
But that's not even within reach. We might have to have discussions about percentages for each of those. And that's just for this coming budget, obviously, divvying up the remainder.
So
We might have to have an exercise in prioritizing each of the projects under those 3 titles. That's just my thought.
Well, we never fully know what our estimated revenue is until June anyway, right? June or July?
We guess.
We guess, sure. I think we're going to have to guess 2 different scenarios, badder, and baddest.
And the absolute worst, yep.
Well, even if it goes through, you'll still have another year to continue to work on it.
Well, the thing, right? If there's a 4.5% to 5% increase in property values, that's basically level funding.
Right.
So we're funding off of last year's budget.
Correct. You need 4 to 5% property valuation growth just to keep up with CPI and contract
Right.
increases.
Right.
Anything above that would be what we would consider new, that or new construction.
Well, the forecast is 5%.
We haven't had it yet. I mean, that's what we're.
No, it's just in the press, and you read 5% growth. I mean, but it's. I think here it's going to be more than that, but I wouldn't bet on it.
I talked to Palm Coast manager, or I forget what department she was in. Do you know how many building permits they got in December? Palm Coast? 12. The new construction, guys, the new construction, I know there's lots of developments out there planned and moving dirt, but the new construction, you watch it. You watch it.
Stopped. It's
Yeah,
now got
it's-
grass
But
again.
that's a year. That's next year's budget is what you're hearing today. So
Well-
remember that. It's a year off.
And the feds are doing this whole affordability housing with mortgages and stuff, which could pump it back out. go crazy again. So we'll see. As this still doesn't help Ms. Petito. So.
But it's fun.
So how about we just keep it simple right now and just explore MSBUs and TUs
We'd like to know our core.
for course, well, define core service. I think you've done that before, that exercise, right? Statutorily required, here's our core functions. And then explore the funding options within the core functions. It's just an exercise right now. Well, she's done this, but I know we've had it before, that list, but yeah. Yeah, no, we will. That's the takeaway, right? We're going to define the core, explore what are our funding options. We won't peg it to MSBU and TU, but you tell us what the considerations are. Just keep it simple. I don't anticipate a full ad valorem, but stranger things have happened.
So as we leave today, we're only going to be looking at alternative revenues for core services. You would like me to include the flat or reduced millage in the budget kickoff with the constitutionals in our departments, looking for efficiency and consolidation. And then bring back at some point, we're going to work on developing a plan for infrastructure, not fully funded, but some sort of a plan that gets us there, that you can determine later what percentage you want to put in, but it's for stormwater, roadways, and coastal resilience. Correct?
The remaining balance, what's left?
What's left? It's not funny. It's not funny. And I think we could ask Cody, I had read somewhere, and it's so speculative, I hate to even bring it up, where they may be taking away the half-cent option for small counties. Because their plan is to fund at the state level with an increase in sales tax.
Well, we're the only county that didn't use it.
I know.
Yet.
I don't know what's true anymore. It depends on what article you read. So,
Look at the chart.
yeah.
Look at the chart. It's published.
Oh, we're not the only county. Yeah, that's right. That's correct. There's other counties that haven't explored it. Okay. I appreciate it, Ms. Petito. Hopefully, let's just keep it simple and we'll have more when we get direction. You ready? Okay, I think we've scrambled everybody's brains up here. We're moving on to the final item.
Tonight's going to be fun.
When is the county attorney evaluation due? When is your eval due?
October, I think this is the 6-month review.
Would we like to table this item to the next workshop?
When did you get here?
I haven't been here 6 months.
When will it be 6 months?
February, August,
There's a 6-month review coming up.
Is that in his contract?
Is
August,
that a thing?
August 11, I think was my first day.
Hold on.
That's what I'm doing now.
Yeah, I had it in there originally with 6 months, but I reviewed his contract again. It's once a year anyway, so we don't have to do this now. We can
We
wait.
can do informal 6-month reviews with them, one-on-ones,
You're welcome to do that. It's just not in his contract, so.
and then we can come back to
So
this.
I hate to bust, would everybody be comfortable with moving this item to the next workshop?
Fine.
As long as there's not 8 items on it.
Amen. Is that okay with you,
Yeah,
Ms.?
it's not a
Okay.
mandatory.
All right. All right, so we'll be moving item 9 to the next workshop. And finally, any other items needed for discussion as needed by the board? Mr. Dance, any items you'd like to?
No, I'm good, thank you. No, I'm good.
All set.
Ms. Carney, you're all set? Ms. Richardson? Okay, Mr. All right, then I have to do one final public comment. Oh.
That would make more sense.
You're having a what?
Who you are?
No, you're good.
You look
You're
great.
fine. Okay. Mr. Tanner, finally.
Thank you, Madam
So
Chair,
patient.
and board members, and again, wow.
Wow, right?
Wow.
First of all, and no one asked my comment on it, I guess I should have done it when I had the chance, but health and safety, yes, but I would hope you also put in your kind of overall look, welfare and quality of life, because those are two other things that you defend all the time, and if you have it in writing, when you get into court, you can say, hey, here's one of the policies. We defend welfare and quality of life. So that was just for free. That was pretending to be a commissioner for 2 minutes. Thank you. Actually, I have to, and I apologize, but in fact, I know it's not my fault. The speed with which the annexation of Randa Bay and Summertown is moving now, and what we consider some really considerable deficiencies in evaluation and obtaining a development that fits the community and is a worthwhile as far as the county and the citizens of the county, not just the developer, who certainly has his rights too, but it should be something. This is a mega development for Flagler County and certainly for the John Anderson corridor. And I respectfully, because we're on a time crunch that I have no control over. The meeting with the city was the 8th of this month. That means 5 days have already elapsed. I think we have 30 to get a response out, or we may not have an opportunity to make a response. It's like an appeals timetable. And we have something that will work to not for delay, but for thoroughness and competence can be applied, and that is the county's dispute, it's a state actually, dispute resolution process, which Mr. Hadid outlined, and I know Mr. Rodriguez, Mr. Mingle, all of them know it very well. But I need to read because this is a little complex for me. It says, and this is my request on behalf of the Preserve Flagler Beach and Beulah Creek group as their attorney. Request that the county pass a resolution. Now, that's not asking for anything more than a pronouncement that will guide, and I'll explain why briefly, a resolution for the county to initiate dispute resolution procedures. And the reason for that being, the time will have run by the time this commission meets again to trigger this, and we would be denied due process. And truthfully, the county and the other citizens that are involved would be denied due process because the 30 days would be gone. And we're asking you to pass a resolution today, which is not a law, it's not an ordinance, it's a directive to the staff. And in that, we'll ask to initiate dispute resolution procedures prior to filing an administrative and or civil actions against the developer or the development plans. And that doesn't mean the city's going to, or the county's going to sue the city or the developer. And this is the city would be the recipient, not the developer. The city would have to actually come to resolution dispute process. That's like mediation. It puts the city and the county together, and the county can, because I understand the county's not been getting answers for their complaints and their concerns. And if they have been answers, they haven't been complete or did not really address the issue. So we're asking that the county today pass a resolution regarding the city's Summertown project and concerns regarding compliance with the Water Wars Agreement, Flagler County Record Book 1560, page 471, and then the January the 8th annexation of the west side of John Anderson Highway and what they call the Summertown Project. The property on the west side is the unique property that we've all been fighting to save, and if we have a resolution dispute opportunity, we'll hopefully make some good progress with regard to getting some agreements between the county and the city with regard to, and citizen groups as well, with regard to the protection and what would be best for the community. Without that resolution process, we cannot bring a legal action. It's a prerequisite. If you don't, it's state law, the state requires governmental agencies, and it's to avoid lawsuits, which is a good thing. It requires them to get together with this resolution process. So that's what we're asking, is to leave us due process of law, which is what we would be denied if we don't get this because of the time schedule, because by the time this board meets again, the time will have run.
Okay.
We will not have had the opportunity to initiate the dispute resolution process, which is what is in place to solve this type of issue. So I have, in my scribbling, have put up a proposed resolution. I have shown it to Mr. Minkle. I've looked at it with Mr. Rodriguez, and of course they will put together something much more artful than this, but I'd like to give it to them and just ask you to pass a resolution that we, that the staff, legal and planning, put together the necessary resolution that would move this process forward. Then we can all have our day in court and in commission meetings, council meetings, and get this worked out without the loss of due process by concerned people as well as the county.
Thank you, Mr. Chairman.
Thank you.
RJ Santori, I'm a resident of Flagler Beach. I support Mr. Tanner's request that the board initiate a Chapter 164 conflict resolution process. I got a few quick points. First, at the City Commission meeting on Thursday, the county's concern did not appear to be substantively addressed before the vote. The county submitted comments, county staff and council have been reviewing the matter, and the city proceeded anyway. I think that this is exactly what intergovernmental conflict resolution is appropriate for. Second, many residents raised good faith questions about process and infrastructure, such as traffic, stormwater, utility capacity, and those questions were not answered in a way that the public could review before final action. Conflict resolution is a constructive way to get clear answers and documents on the record. Third, this matter is for the taxpayers. The Water Wars agreements include provisions that relate to utility responsibilities and infrastructure planning. To the extent those obligations were contemplated but not completed, including reclaimed water or wastewater-related facilities, the county's involvement could help ensure the burden does not fall disproportionately on Flagler Beach residents. Fourth, the proposed conservation acquisition depends on a separate agreement. If the county and the developer can't reach terms, that protection could disappear, and I do not see equivalent binding protections hard-coded into approvals to protect Bulow Creek. That's why the county should initiate conflict resolution and get enforceable commitments clarified. Thank you.
Thank you. Thank you, sir. All right. I'll go ahead and close public comment. Any takeaways from that for our board?
Well, yeah, I was there at the meeting. I think Andy was too, so he can speak to it. There's like nothing we can say. We've had written correspondences, we've tried joint meetings, they don't do joint meetings. Adam and Sarah have worked diligently to point out to Flagler Beach the problems. So everything we did to secure a seller's letter and not seller's intent, is that what the letter was, about the 150? What's the name of the letter? Willing seller letter. It still states in the development agreement that he does not have to sell it. They're not willing to change any of the verbiage on Summertown. So what happens next is Veranda Bay was put on hold as a result of our attorney pointing out an annexation problem on the east side. So what they did was they separated the two items and took the east side off the agenda and kept the west side annexation on the agenda, which makes the fiscal impact study basically flawed because it includes both the east side and the west side. So there, if you weren't sitting in the seat, there is no attention being paid to us, to Flagler Beach's citizens, and some of which are on John Anderson and happen to be us. I believe with a firm heart that this thing needs to be slowed down. They are pulling every loophole they can to move this along, and they're not listening. It's not fair to the citizens of Flagler Beach. The water wars thing was explained to them. They did a fabulous job, and they still sit there with this blank stare. We didn't threaten to sue them, obviously, but it was pointed out that you are going against the water wars agreement. Many times. And they keep saying, well, we put the purple pipes in the ground. Well, that's not what the water wars said. You got to put the purple pipes in, but you got to build the facility. There's just things that they're either not aware of, that they're avoiding, or they're just simply overlooking. And the floodplain, development of that floodplain on the west side needs more attention. And the developer keeps getting up and saying, we're going to abide by all the rules. We don't know what the rules are. We don't even know how many residential pieces of residential single-family homes are going on the west side. But it looks like it's 3 to 1. It looks like it's 3 per acre. 3 per acre.
The latest number I saw was combined single-family and multifamily, 1,600.
Okay.
1,500, something like that.
1,600, and that's just outrageous.
Yeah.
That's outrageous.
So I would like to move towards at least getting in the room with them. I think that our attorney and Mr. Rodriguez and Sarah have, and I got Sean involved on Friday after the meeting on Thursday. So I know they're well aware of the facts. We could not get up and speak on Thursday night because the board only gave our attorney the go-ahead to talk about issues that we've already brought up. But there were other things that we haven't addressed with them. We don't meet again. The 22nd, it showed up. I confirmed with Sarah that the annexation, it would only be the first reading. We would have a meeting 4 days before the second reading of the annexation of the east side. So if we don't do something now, we could call an emergency meeting, or it would have to be a meeting so we could vote. So if you don't feel comfortable today because of the short amount of time, I'd like to ask for us to consider a special meeting so we could vote and give some direction to our attorney.
Mr. Rodriguez, could you give us clarity on exactly the ask here tonight from Mr. Tanner regarding a resolution?
Sure.
What would be the steps for that?
In order to initiate the statutory Intergovernmental Dispute Resolution Act, the first step that what the statute calls the asking government, which would be us, is it's a resolution that simply states we're going to invoke the act. That resolution is then transmitted. After the resolution is adopted, within 5 days, that resolution is transmitted to the city with a letter explaining these are the issues that we are going to raise. These are the issues that need to be resolved as part of the process. So, but the language of the resolution itself is that we are hereby invoking the statute, and that starts the clock. So when that clock starts, while the statute is not clear, litigation is not allowed to commence until the two governments have completed the intergovernmental dispute resolution. So by inference, the action should be told. Because this is it would be a challenge to their comp plan amendment, it's actually not, if we limit because the way I'm listening to it, this may actually be kind of a two-pronged litigation against the city, because any challenge in regards to the settlement agreement relating to the water wars, that would need to go to circuit court. The challenge to the comp plan amendment is actually an administrative challenge that goes to the Division of Administrative Hearings. Now, while the statute says that administrative challenges under 120 are not part of the Intergovernmental Dispute Act, there is I can read it exactly, the scope of the act, actually. When it talks about the issues that are covered, the first one is any issue relating to local comprehensive plans or plan amendments prepared pursuant to Part 2 of Chapter 163, including but not limited to conflicts, including levels of service for public facilities and natural resource protection. It's the first intent of why this act was created, for local governments to get together. So the resolution starts the clock, which would then toll. So in essence, if I were to file an action with the Division of Administrative Hearings and in circuit court, the next step would be an immediate, and I speak from experience because we did this in Volusia. We sued the city of Daytona Beach Shores, and the second we filed our lawsuit, the next act was the city immediately filing an action to abate the case and throw us into this dispute resolution process, which we did. I would probably, just on the safe side, before the 30 days, I would file an action with the Division of Administrative Hearings to protect our rights, and then at the same time ask the administrative court to abate the case while we proceed forward with the dispute resolution process, and probably do the same thing in circuit court, have the action filed, and ask for it to be abated while we proceed forward in this case. So timeline, we may be able to consider the resolution tonight, have what the findings of the resolution are to be in it, and then have you vote on the resolution. We would prepare the resolution, prepare the letter to describe the issues that would be discussed. We also have the option to, if you want to have a special meeting, to simply discuss. Therefore, we can hash out and have it all out. Because the Chapter 164 actually doesn't even say how long you have after the government's action to pass your resolution. There's no set time. So we can go by we have 30 days under Chapter 163, 3187 3184, because this wasn't a small scale comp plan amendment, under 3184 to challenge the comp plan amendment. So that's the timeline we're looking at now. So I would err on the side of caution that we have up to 30 days from the date of their adoption of their amendment to at least get the resolution in and start the clock for intergovernmental dispute. At that point, then, the first step is we proceed forward to try to establish the parameters for both boards to have a full joint meeting of the County Commission and the City of Flagler Beach City Commission, where the matter is discussed in the open. If a resolution is unable to be attained at that meeting, the next step is actually to go to mediation and have the matter mediated. Both the city and the county split the cost of the mediation and attempt to try to find some resolution where we can find some type of a middle ground where we can get both of our interests heard. And if we can find a resolution in that matter, then great, we can then proceed forward. If not, then the case will proceed forward both on that two-track, with both in circuit court and with the Division of Administrative Hearings. Now, the caveat, though, is proceeding forward with the Division of Administrative Hearings is that challenge to comprehensive plans, the burden is very great on the petitioner because the courts pretty much will uphold the decisions of local governments when it comes to the comprehensive plan amendments because their standard is simply that it's a reasonableness standard. So it is a large hurdle to overcome, at least on the administrative side. Whether we might have a greater likelihood of success in the circuit court if we're going to go on the whether or not they're violating the terms of the settlement agreement, it's another matter that I'd like to take a look at much closer. But I mean, I want to put it up front on the administrative side. That's a tough hurdle. Plus, with the recent changes that the legislature imposed, those challenges to comprehensive plans now they've added the additional sting of attorney's fees for the prevailing party. So we could be on the hook for paying the city's attorney's fees in any challenge to their comprehensive plan amendment in the event that we don't prevail.
May I respond to that just briefly?
Mr. Tanner,
On behalf of
I think how about we do this? How about we take this with us and we'll discuss this in commissioner comments tonight at our 5 o'clock. We'll have our time because we need to give everybody a break. Bring it back. We'll think about it and have a discussion tonight. Would that be okay with you, Mr.?
yeah, the only thing I'd caution is that this has not been advertised. I don't see.
I understand.
I would strongly suggest we don't pass a resolution tonight. It has not been advertised. There's no opposing people to speak.
No, we can have a discussion about a special meeting. Discussion, if that's what we need to do. It was just called take away this for the next hour and a half. And
Can I respond to just one thing Mr. Rodriguez said?
no, we will. Are you able to do that this evening in our public comment?
Yes, ma'am.
Okay, all right. We're going to go ahead and we're going to try to adjourn. I think we should take this back with us to think about tonight and have a further discussion tonight.
We'll eat on top of it today.
So, is that all right? Okay.
Madam Chair, I was just going to withdraw something I said.
Okay.
On behalf of Preserve Flagler Beach and Beulah Creek, on learning from experienced land use counsel, I don't want to expose my clients and my nonprofit to another lawsuit from somewhere. And therefore, we withdraw any request for administrative review, including the fact that if it's such a high burden, we don't want to go there and risk losing more money in this. The citizens. Thank you.
Thank you, sir.
So that's withdrawn.
Motion to adjourn?
Move we adjourn.
Or adjourn.
Thank you.